l'époque. Routine proceedings, tabling of documents. The Honourable Parliamentary Secretary to the Leader of the Government in the House.
Thank you, Mr. Speaker. Mr. Speaker, pursuant to Standing Order 36.8, I have the honour to table in both official languages the government's responses to 5 petitions.
Oh, well done.
Thank you. Dépôt de projet de loi émanant du gouvernement.
Introduction of government bills.
Bills. Statements by ministers, déclarations de ministres, reports from interparliamentary delegations, presenting reports from committees. The Honourable Member for Huron-Bruce.
Mr. Speaker, I have the honour to present in both official languages the 6th report on the Standing Committee Health entitled Marijuana Health Risks and Harm. Pursuant to Standing Order 109, the committee requests that the government take a comprehensive response to this report. Thank you.
Présentation des rapports du comité.
Presenting reports from committees.
From committees. Introduction of private members' bills. Dépôt de projet de loi émanant des députés. First reading of Senate public bills. Motions, motion. Ms. Crowder, seconded by Ms. Hughes, moves that the 4th report of the Standing Committee on Aboriginal Affairs and Northern Development presented on Wednesday, March 26, 2014, be concurred in. Debate, débat. The question is as follows. Ms. Crowder, seconded by Ms. Hughes, move that the 4th report of the Standing Committee on Aboriginal Affairs and Northern Development presented on Wednesday, March 26, 2014, be concurred in. Is it the pleasure of the House to adopt the motion? Carried on division. Motions, motion. Presenting petitions. Présentation de pétitions. The Honourable Member for Red Deer.
Well, thank you, Mr. Speaker. It's my pleasure to rise today to present 2 separate petitions on behalf of over 200 Central Albertans. The first petition asks that Parliament enact legislation that restricts abortion, and the second petition requests that Parliament support Bill C-583, fetal alcohol spectrum disorder. Thank you, Mr. Speaker.
Petitions, pétitions. The Honourable Member for Timmins James Bay.
Proud today to rise presenting this petition signed by many people in the Kirkland Lake, Virginia Town, Larder Lake region, and their concern over the right of Canadian farmers to save, reuse, select, and exchange seeds. This has been something that has been a right of farmers going back to the very beginning of agriculture, and there's a very real concern among people who've been involved in agriculture that their ability to maintain this tradition be protected under the proposed changes that we're seeing, particularly with Bill C-18 and the plant breeders' rights. So I'd like to present these concerns to the House.
Petitions, pétitions. The Honourable Member for Langley.
Thank you, Mr. Speaker. I'm honoured to present a petition representing thousands of people from British Columbia. The petition highlights that, sadly, 22-year-old Cassandra Collius was killed by a drunk driver. A group of people who have also lost loved ones to impaired drivers, called Families for Justice, believe that the current impaired driving laws are much too lenient. They're calling for new mandatory minimum sentencing for people who have been convicted of impaired driving causing death.
Petitions, pétitions. The Honourable Member for Nanaimo Cowichan.
Mr. Speaker, I have 3 petitions all dealing with the right to save seeds. And in this petition, the citizens of Canada recognize the inherent rights of farmers derived from thousands of years of custom and tradition to save, reuse, select, exchange, and sell seeds. Current and newly proposed restrictions on farmers' traditional practices resulting from commercial contracts, identity preservation systems and/or legislation criminalize these ancient practices and harm farmers, citizens and society in general. And so in this petition, Mr. Speaker, the petitioners are calling on Parliament to refrain from making any changes to the Seeds Act or to the Plant Breeders Act through Bill C-18, and are also calling on actions that would not further restrict farmers' rights or add to farmers' costs. Thank you, Mr. Speaker.
Petition, the honourable member for Vegreville, Wainwright.
Thank you very much, Mr. Speaker. I'd like to present two petitions. The first, the petitioners call upon members of Parliament to condemn discrimination against girls occurring through gender selection, pregnancy termination. They note that 92% of Canadians support this condemnation. And in the second petition, Mr. Speaker, the petitioners feel that impaired driving laws are too lenient, and they call on two things. They want new mandatory sentences for persons convicted of impaired driving causing death, and they want the Criminal Code of Canada to be changed to redefine impaired driving causing death as vehicular manslaughter, Mr. Speaker.
Petition, the honourable member for Saanich Gulf Islands.
Thank you, Mr. Speaker. I rise today to present two petitions. The first is from literally hundreds of Canadians, primarily from the GTA, the General Toronto area, calling on this government to recognize that that there is an ongoing and deeply disturbing number of reports of organ harvesting from Falun Gong prisoners, and a call for Canada to publicly request the Chinese government authorize an independent investigation of this, among other demands. The second petition, Mr. Speaker, is primarily from residents of Ottawa, calling for amendments to the Criminal Code to take crimes against animals out of the property section and to recognize that there needs to be, to close the loopholes and further ensure that the Criminal Code punishes those who cause harm and suffering to animals.
Petition, l'honorable député de
Honourable member for Manicouagan. Mr. Speaker, I would like to draw this House's attention to a petition signed by the citizens of Manicouagan, which bears witness to the importance of continue delivering mail to people's homes as an essential service.
Petition, the honourable member for Edmonton, Strathcona.
The first is Canadians calling to end the cuts to the Postal Service. The second is Canadians calling for federal greater leadership and investment on a pan-Canadian prescription drugs examination, pan-Canadian strategy on primary care and improved conditions for Aboriginal peoples, and two petitions calling on the House of Commons to increase the Canada Pension, Quebec Pension Plan.
Petitions, l'honorable député.
The honourable member for Gaspésie et La Madeleine. Thank you, Mr. Speaker. I would like to table a petition today signed by hundreds of citizens in my riding with regard to the fort of Cap des Rosiers, the highest fort in Canada. It was designated a historic site in 1971, but unfortunately, 3 years ago, the government deemed it to be surplus and wants to transfer it, and our citizens are calling upon the federal government to preserve it.
Davenport.
Thank you, Mr. Speaker. I have three petitions to present on behalf of the good people of Davenport in the great city of Toronto. The first one concerns the Cuts to Canada Post. This is signed by many seniors in my community on streets like Dufferin and Gladstone and Havelock and Lansdowne. They're concerned about the cuts, and they call on the government to reverse these devastating cuts, particularly with respect to door-to-door mail delivery. Mr. Speaker, there is a general crisis among youth in terms of employment in the GTA. Right now, actually, about 50% of all workers in the GTA cannot access a full-time job. They don't have access to benefits, a pension, any job security. This petition is signed by many in my community calling on the government to support a national urban worker strategy. And finally, Mr. Speaker, notwithstanding the decision on Line 9, many in my community are very concerned about the way in which public engagement happened with this decision around Line 9. In particular, the company who's building and managing and maintaining Line 9, and they call on the government to intervene immediately to stop the development of the Sarnia-Montreal Line 9 pipeline. Thank you.
Petitions, petition, the honourable member for Algoma, Manitoulin, Kapuskasing.
Thank you very much, Mr. Speaker, and I rise in this House to table a petition with respect to the Algoma Central passenger rail. The petitioners are from Sault Ste. Marie and Goulet River in the riding of Sault Ste. Marie, and they would like to ensure that their voices are heard in this House with respect to the cuts that the federal government did to the funding for the Algoma Central Railway passenger train. They note the impact that this will have on the economy, health and safety. Now, we know that the government did reinstate funding for one more year, but they will likely need some more assistance, and we need to recognize the importance of passenger rail. So thank you very much, Mr. Speaker.
Petitions, pétitions, the honourable member for London Fanshawe.
Two petitions. The first is in regard to a tragedy that happened in London, Ontario almost a year ago, and it involved a family that felt there was no recourse but to end their lives. And so the petitioners are asking the Government of Canada to reverse the cuts to public service jobs that created a workload that made it impossible for those at Citizenship and Immigration to help this family. And they want the Government of Canada to ensure that the Department of Citizenship and Immigration is properly staffed and resourced in order to reach decisions on applications in a fair and timely manner, and that immigration officers consider all factors regarding an application, including humanitarian and compassionate grounds. And the second petition, Mr. Speaker, is from Londoners of both the Christian and Muslim communities who are profoundly upset about what has happened to their families and friends in Iraq as a result of the Islamic State of Iraq and Syria and their attacks on communities. And they ask that the Canadian government highlight the plight of Iraqi Christians and use all diplomatic and humanitarian efforts to assist them in their plight. And they also ask the government to assist other like-minded governments and organizations who are engaged in the effort to stop the suffering of Iraqi Christians and work with all governments and organizations currently engaged in humanitarian and diplomatic assistance. Thank you.
Petitions, pétitions, the honourable member for Thunder Bay, Superior North.
Thank you, Mr. Speaker. Mr. Speaker, it gives me particular pleasure this morning to present these petitions on neonicotinoids from hundreds of people from across Canada. The reasons are many years ago I played a key role as a regulator in banning DDT in the United States. The other reason is our Senate is holding hearings on this tonight at 5 o'clock. So what these petitioners would like, Mr. Speaker, is to have a ban or at least a moratorium on neonicotinoids, as Europe has done, until we know more about whether they're as bad as they seem. Thank you, Mr. Speaker.
Petitions, pétitions. Question inscrite au feuilleton.
Questions on the order paper.
For the Honourable Parliamentary Secretary to the Leader of the Government of the House.
Thank you once again, Mr. Speaker. I ask that all questions be allowed to stand.
Agreed? Agreed. Orders of the day.
Government orders, business of supply.
Ebola, in the name of Ms. Fry.
The motion is Ms. Fry, seconded by Ms. Duncan, Etobicoke North, moves the House recognize the devastation that Ebola is wreaking on Western Africa and the serious threat to public health that the virus could pose to Canada. Et que le ministre de la Santé,
and that the Minister of Health, the Chief Public Health Officer of Canada, and the Minister of Public Safety to appear before the Standing Committee on Health twice monthly to report on Canada's efforts at home and abroad to ensure that the outbreak does not pose a threat to the health and safety of Canadians.
Debate. The Honourable Member for Vancouver Centre.
Thank you very much, Mr. Speaker. I wanted to start from the very beginning to say that this motion is a timely one. I think that we see that fear, news broadcasts, listening to things going on around the world can create panic and fear in certain parts of the world, including Canada. And we want to ensure that the balance is kept, that with good information going out to the public and to Parliament and via Parliament to the public, that people will not begin to panic, that they will be aware of the fact that the risks are indeed not very high of Ebola spreading to Canada in the way that it has in West Africa, and that everyone is on top of their game. And I think that that is really why we want to do this. And because we have seen that in the past we have not, the Minister and the Chief Public Health Officer have not been forthcoming with actual details of what they've been doing. I think, Mr. Speaker, I also want to say that we want to make sure this is not a partisan issue. Where the health and safety of Canadians are concerned, I think we put aside partisanship, and this House has to decide what is best for Canadians and how to communicate to them in appropriate manner. So this is not anything to do with partisanship here. I think we are concerned about a few things, and that's why we brought out this particular motion. The first one is that the recent cases of Ebola emerged in North America, and that some recent cases have emerged in Europe. And so we know that Ebola is not completely contained in West Africa. And I think this is an important thing to remember. I think we're concerned that cuts to the Public Health Agency of Canada over the last 5 years may have compromised its ability to respond to public health crises, period. We have noted that the Minister and Chief Public Health Officer on Friday last week and, in fact, yesterday have begun to communicate to the public, and that the Chief Public Health Officer is letting the public know about the plan, a complete plan of action nationally, so that the public can become aware. But we want to be ensured that this level of communication becomes continuous, that it doesn't happen just on Friday and on Monday, and then we no longer hear from anyone. I think it is really important, in the best interest of creating good information and therefore not creating panic and confusion, that we continue to ensure that there are regular updates. And so that is the reason that we're asking the Minister and the Chief Public Health Officer and any other appropriate ministers to report to the Parliamentary Committee on Health, the All-Party Committee, to report twice a month. And, of course, if we see any virulence increasing in Ebola, or we see of any other cases that are closer to home, that in fact, reporting be ratcheted up, and so that we may have to get it weekly as the situation changes. And I think this is something that is in the best interest, not only of Canadians, but of keeping this particular disease under the right kind of information basis, and that Canadians do not panic. I think we want to be ensured as well that Canadians are informed. We want to ensure that up-to-date public health protocols to contain the disease are evidence-based and are not politically based, and are not done in response to political correctness or in response to public panic. These must be evidence-based, and they must be absolutely based on public health protocols. It's imperative that the federal government take every step necessary to protect the public from the spread of dangerous diseases, not just like Ebola, but all dangerous diseases, because as the world becomes a smaller place and as travel becomes more frequent from every corner of the globe, the risks of pandemics and epidemics spreading unwittingly has become higher and higher. And I think we need to think about how we not only protect Canadians, but we also take every step as Canadians to move into the region of the world where the particular illness has begun, and that we begin to do the kinds of things we need to do to contain it, because we know that, in fact, the only way to stop the spread of Ebola is to contain the disease within the region where it is currently rampant. And I wanted to add that it's interesting to note that Nigeria, which was one of the most affected countries, has now been considered to be, and I use the term guardedly, Ebola-free. And that has been because for 42 days there have been no new cases. And I will refer to Nigeria again, because Nigeria is a good example of how an African nation, a developing nation, has actually worked on a plan that they stuck to, Everyone was on the same page in that plan in Nigeria. Every healthcare professional, every region, rural, urban, they even brought in non-healthcare professionals, and the plan was clear. And I think this is an important thing to remember, that the plan must be clear, that everyone must understand it, and that we must ensure that everyone is working out of the same textbook. I think Nigeria is a good example because they used evidence-based protocols. Now, I think what we need for Canadians to know is, in an open and transparent way, which is what we're asking for, openness and transparency by the Minister of Health and the Chief Public Health Officer, to reduce confusion and to reassure against panic. The Public Health Agency of Canada has to begin to coordinate, and we don't know if they have, and this is another reason why we're asking for transparency, must begin to coordinate regular meetings of the professional health organizations, like the Canadian Public Health, the Association of Public Health in Canada. We have to look at the Canadian Medical Association, at the Canadian Nurses Association, and at the Association of Medical Microbiology and Infectious Diseases Canada, because the nurses have said that they're concerned. And again, this concern may translate to Canadians that things are not right, and that may not be so. But we need to have everybody being informed so that everyone can ensure that they do not create a panic by suggesting that something is amiss. I think the government must ensure that the Public Health Agency of Canada continue to be working with the provinces and territories, that there must be dedicated regional hospitals in every province with the highest levels of isolation protocols and treatment units. And that, again, I repeat, there is one plan that every province and territory is actually following. It must be the same plan, and everyone must be on the same page. And I again point to Nigeria, who have actually been referred to as having done that exact thing, one plan, and that has worked very well for them. But we also need to be aware that Ebola is a disease that it is not good enough to say we don't have any direct flights from the affected regions. Because, as we well know, somebody can go from an affected region to some other place, leave, transfer, come to Canada through a different route, and through any one of the airports that we have. And we also know that because of the 21-day sorry, my brain has gone into a fog here. The 21 days that the disease takes to actually show itself, that in fact we know that somebody could come in, be well, walk through the hospital, and then go off to some small rural community. And when we find that in 21 days the incubation period arrives and they begin to show symptoms. So that rural areas and urban areas must be able, even though they're not in large centers, be able to know some very basic things about what the symptoms look like. They must be able to have personal protective equipment. Every single small hospital must have some personal protective equipment. We know that that was a reason why the spread occurred in Spain and in Texas, and it was because people didn't have the right equipment. And I think the federal government has to actually ensure that, if necessary, they have to give financial assistance to small provinces and small areas that may not have the money to buy some personal protective equipment. I think not only should the equipment be there, but there must be ways of people learning and training how to put them on and how to take them off. Because once you've been contaminated with the equipment's contaminated, taking it off is a very essential part. And I think one of the ways that the Minister of Health can do this, and that the Public Health Officer can do this, is to put webinars out on the web page that the PHAC has, so that people can learn, watch someone doing it, and be able to be ensured that they are doing the right things. I think border personnel, emergency room personnel across the country should be aware of early signs and symptoms of Ebola. They should also be able to know how to use their personal protective equipment. I think we know that the Canadian government must ensure that travellers who receive the health assessment by the PHAC quarantine officer at the airport but have no signs of infection must also be able to inform a person who feels that they have been in an affected area or they may have been exposed, how to self-isolate and how to deal with the during the 21 days and how to look for signs and symptoms and what they must do immediately. And I think these are the kinds of things that we're talking about, giving people basic information that they need. I think we're also concerned about reports that there used to be public health equipment for sending off to countries at risk for diseases, and that equipment was sold off for $1.5 million recently. And in fact, it was auctioned off at about a fraction of its real value. And now we don't have some of that equipment to send that we might be able to. And we're depending on other countries to send mass units because we know that the ability in the affected regions to have any kind of public health system is very compromised, and that therefore they need to have small clinics in some of the villages and the isolated areas so that they can have the kind of care they need, so that they can go to these clinics. But more than anything, we know that the mortality rate for Ebola is now moving to 70%. And what we also know is that with good hydration and good care, that in fact that could drop very significantly to about 20 to 30%. And yet, when you have a country with absolutely no health infrastructure whatsoever, even with no electricity, the ability to be able to put in IVs, to take them out, to be able to see when it's pitch black at night and there is absolutely no infrastructure. These are the kinds of basic, practical things that need to happen in the region that is most affected, because we do know that in West Africa, if we can contain the disease, that we can be able to stop the spread to the rest of the world. I think we need to have some other questions answered. We know that in September, the PHAC pledged $35 million to go to the World Health Organization, to go to Physicians Without Borders, and to go to some of these affected areas. And we also saw that last week, that a new $30 million was pledged. That brings it up to $65 million in all. And yet, we only know that $4.3 million has actually been committed. So where's the other $61 million? Why isn't it getting there when actually timeliness is very important in containing any kind of epidemic? Getting things done right away is really, really important. And so we also want to know why the 800 vaccines that were committed to the World Health Organization didn't get there until Monday. What stopped it? What were the problems? When these vaccines could have been there a long time ago, why? We would like to know. Nobody's blaming the Public Health Agency of Canada. No one is blaming anyone. We just want to know why it took so long. What are the challenges that we're facing in getting money to the affected region and getting vaccines to the World Health Organization? Now, the World Health Organization, as we heard, actually fell down on the job at a particular point in time when they could have responded earlier. That may be the simple answer to it, but I think we really want to know why all these things have been happening. Now, vaccine trials, we hear, are set to begin in Switzerland, Germany, Gabon, and Kenya. My question, and our question is, should there be trials? Are there vaccines for our trials in North America? Should we have some trials in the United States and Canada? We'd like to know the answer to that. We saw that the new money that went, the $30 million on October the 17th, which was a new pledge, we want to know what that money is going to be directed to. Is it going to be to fulfill the request by the World Health Organization and by Médecins Sans Frontières to supply personal protective equipment, to supply rehydration equipment, because as we heard, hydration is one of the serious things that lead to death, training and personnel? It has been repeatedly said by the World Health Organization that they need personnel. And yet we heard today from the Minister of Health that Canada will not send more personnel. Canada has only sent 13 personnel so far, but they will not send more until they are sure of an exit strategy. Who is devising the exit strategy? Is the minister working on an exit strategy right now? We need to know. These are the questions that keep coming up, and we need answers. And again, I want to say, this is not about blaming. This is about wanting to be informed, to be open, and to be transparent in terms of what is going on. I just wanted to quickly speak a little bit about Nigeria and to say that Nigeria has now been 42 days free of a new case of Ebola, which means that it is seen to be Ebola-free with a 21-day incubation period. That gives them 2 full incubation periods without a new disease. And one of the things that they had to deal with are the same things that we see happening in Sierra Leone and the other regions. And that is they're struggling against a backdrop of weak health systems, although Nigeria has had a stronger health system than most, with significant deficits in capacity, personnel, trained people, protective equipment, and with fear and cultural practices. And what Nigeria did was really, really important, because I'm referring to the disease in West Africa right now, because we know to stop the spread to the rest of the world, we have to end the disease, or to get the disease contained in West Africa. And one of the things about cultural practices, we know that there's a great deal of fear by people who live in the villages that they have a cultural practice of bathing their dead, and that this increases their risk of getting exposed to blood and body fluids. Now, education was necessary. What Nigeria did, apparently, was they brought together religious leaders, local people, local community leaders, and they got them to knock on everybody's door, to go to everybody's place and say, listen, you're going to have to stop doing that. This is what this is. This is not something that somebody gave to you maliciously. This is a virus. These are what the things you must do. And here are some of the things that you must change in terms of your practices. And that made a difference, having people from local communities and leaders from religious communities speak to them, because I think that dealt with some of the fear. Now, according to the World Health Organization, as of October the 12th, there are about 9,000 cases of Ebola. Now, this is really, according to the World Health Organization, an underestimation, because we still don't know if there are cases that people are hiding. We still don't know if people had someone with Ebola who died, and whether or not they buried them without letting anybody know because of fear, again. We know that, again, almost 4,500 deaths have been reported in Guinea, Liberia, Sierra Leone, and up until now, Nigeria. Now, there have been additional deaths recorded in Spain and the United States. The Public Health Agency of Canada has, as far as we know, based on the very last discussion with Canadians, done some really important things. They have actually been talking to the provinces and territories. They have been moving on a plan. They have done some training sessions to ensure, like that in Nova Scotia, the ability to put on the protective equipment has happened, and they've shown that that is so. But I think that's a great start. But I think it is really important that the Public Health Officer of Canada ensure that everyone is working to the same plan, that every province and territory is working to the same plan, that every province and territory has what it needs to ensure that that plan is operative. And that it means meeting and talking much more regularly than is happening. And webinars, as I said before, are something I want to repeat, are a good thing. You can have people in rural areas in Canada and in isolated areas and in some of the small towns be able to go online and be able to see how to put on personal protective equipment and how to take it off. I think that that some of the work, as I said, done, the travel notices to advise Canadians of the risks of traveling to countries with Ebola, additional scrutiny for passengers that have been in affected countries, automatic referral to somebody from an affected country being screened by a PHAC quarantine officer at point of entry into Canada. These are all important. And the PHAC has been supportive of some of the control systems already in Canadian hospitals. And we see that Ontario actually has done an extraordinary job of creating a solid plan that they're moving on. I think, so what I'm trying to say about Public Health Agency of Canada is it's not good enough to support. It's very important to ensure that it is done. And we need to know that this is going on an ongoing basis. We would like, as Parliament, through the Parliamentary Health Committee, to be informed twice a week by the Minister or by the Chief Public Health Officer or by the appropriate officials, so that we can be able to reassure our constituents and Canadians across the country that everything is moving according to clear, evidence-based public health protocols. Thank you very much, Mr. Speaker.
Questions and comments? Question et commentaire. The honourable member for Thunder Bay Superior North.
Thank you very much, Mr. Speaker. Mr. Speaker, I wonder if this honourable member, who knows a lot about medicine and apparently Ebola as well, would like to comment on what I saw in the media, which I don't know the facts of, but apparently our conservative government, which loves to privatize everything in sight and sell off important Canadian assets, has sold Ebola protective gear worth well over $1 million for a few tens of thousands of dollars, which we could really use now in this Ebola fight. I wonder if she's familiar with this issue and would like to comment further.
The honourable member for Vancouver Centre.
I want to thank my colleague for that important question. I think that I had mentioned that in my speech, and I think that that was a pity that we took steps to do this kind of thing. We now know that pandemics will occur more and more in a world that is absolutely open to borders and to travel, and people of every class and of every age are traveling around the world. We know that this is going to be important, so we need to take some steps now. We need to ensure that Canada has what it needs to be able to go to bat and to be able to help any country in which an epidemic has begun, and to do so swiftly and clearly, and to make sure that whatever they're doing gets there in a timely manner. But Mr. Speaker, there is one thing that I would like to add, and that is that the Public Health Agency of Canada has been cut severely over the last 5 years, and their ability to respond may be very compromised even now as we're standing in this House. I would like to know whether the cuts have done anything to create a delayed response by the Public Health Agency of Canada. And finally, I would like to ensure that after this Ebola epidemic is contained, that we don't wait for another epidemic, that the countries of the world sit together and talk about building in the interim strong and clear, solid health systems in the developing world so that they can respond themselves when something like this happens in a timely and effective manner. Thank you.
Questions and comments? Questions et commentaires. L'honorable député.
The honourable member for Hochelaga. Thank you, Mr. Speaker. The member knows, as I do, that when ministers appear before committees, just as it is in question period, they don't answer questions. They're very evasive. They read the lines given to them by the PMO. So how will this motion change anything to this principle that has lasted since I was elected and probably from long before? What will the member do to ensure that the minister truly answers the questions that are important in order to protect Canadians from this scourge?
That's a very good question by my colleague. I think we've seen this happen over and over at committee. But I think this is something different. There's huge risk to Canadians if this disease ever gets to Canada. This is about public safety and public security. And I think if we put aside partisanship and we let the Minister and the Chief Public Health Officer know that all members of this House are prepared to work together to ensure that evidence-based protocols are put in place, I think that might go a long way because we won't be as critical. We may ask questions and we may be looking at creative and at very positive ways of working together to find the right answers.
Questions and comments? Questions et commentaires. The honourable member for Etobicoke North.
Mr. Speaker, I'd like to thank my friend and colleague for her excellent motion and excellent speech. We know the best way to stop this disease is to stop it at its source. There's an upward epidemic trend continues in Sierra Leone and in Liberia. The situation in Guinea appears to be more stable, though in the context of Ebola, it's still a grave concern. The World Health Organization recommended that within 60 days of October 1st, 70% of all those infected must be in hospital and 70% of the victims buried safely if the outbreak were to be successfully arrested. Otherwise, the Ebola numbers risk rising dramatically. From her calls, does the World Health Organization have enough diagnostic laboratories, transport support, and funding to help with operation logistics? And if there was one thing she could ask of the government today beyond this motion, what would it be to help the people of West Africa?
The honourable member for Vancouver Centre.
Thank you very much, Mr. Speaker. I know my colleague has been very concerned about this issue for quite a while, ever since Ebola first began to show epidemic proportions in West Africa. I think perhaps one of the things that I would ask without, other than the reporting to Parliament and letting the Canadians know what is going on. I think it is that the money that has been promised gets to the region as soon as possible. That there be a movement to have timely response. We can't keep dragging our feet. This has been going on since April, and we've only spent $4.3 million of money that we said, and there is still $61 million that's not been spent. That's one of the things I'd ask for. The second thing I'd ask for is that we send personnel. The World Health Organization has asked over and over for personnel. Other countries, like the United States, have sent their armed forces, personnel, MASH units. We've seen small countries like Cuba send more personnel than we have been sending. I think we can do this. And the minister said clearly that she would like to have a safe exit strategy. I would like to know that she's developing one now so that we can have that ready to roll within 24 hours.
Questions and comments? Question et commentaires. The honourable member for Surrey North.
Thank you, Mr. Speaker. Mr. Speaker, I've had a number of family members in my constituency whose relatives are in the Ebola-affected area of Liberia, and they were very concerned about their relatives, their friends that are in that country. Mr. Speaker, we've seen the foot dragging that's taken place by this government in responding to this this disease that all of the world is putting effort into combating it, and we've seen that the Conservative government actually failed to take leadership on these issues. And we've seen from this government they failed to take a leadership role in the international level, and this was an opportunity for them to do that. And I want to ask the member, you know, we've lost the seat on the UN Security Council. Would this sort of effort, humanitarian effort, actually help us get back that seat?
Member for Vancouver Centre.
That's a very interesting question, Mr. Speaker. I hadn't quite thought of the Ebola epidemic in terms of whether it would give us some kind of goodwill down the road. I don't think that's what it's about. It's about ensuring that we end an epidemic in a part of the world where people are dying, and that we prevent that spread from getting to the rest of the world and creating a pandemic. But I do think that there haven't been any answers as to why it took so long and why it is still taking so long for the money that we've said that we're giving not to get there. We started off with $35 million. We've only spent 4.5, has actually gotten to the right places. Why did the vaccines take so long to get to the World Health Organization? There's some real questions we have to answer, but I think we want to put this on an open and transparent footing. I don't want to keep going back in time and saying we did, coulda, shoulda, woulda. We know now that we shoulda, coulda, woulda as a country. And so let's move forward. Let's all work together to get moving on making the right decisions and in a timely manner. Let's get the stuff to the people that need it, and let's talk after this epidemic about building strong health systems in the developing world.
Questions and comments? Question et commentaires. The Honourable Parliamentary Secretary to the Minister of Health.
Thanks, Mr. Speaker. In fact, Canada is at the forefront of responding to the Ebola crisis in West Africa. Does the member opposite think that when Canada's Chief Public Health Officer made himself available for fulsome briefings to all members of the opposition, then made himself again available for all parliamentarians to answer any and all questions, that was not sufficient? Does the member opposite think that regular, almost daily press conferences by either the Minister of Health and Canada's Chief Public Health Officer are not sufficient? Does the member think that regular daily responses here in question period by our Prime Minister, by myself, by members of this House is not sufficient?
The Honourable Member for Vancouver Centre, you have 1 minute.
I gather the member must not have been listening when I made my speech. I think, Mr. Speaker, no, it's not enough. That's why we put this motion forward. We need to get regular briefings, and I would like to point out to the member that this public press conference that occurred only occurred last Friday and this Monday. It's kind of late in the game to have these happening. But you know what? Nothing is ever too late. So I thank the Minister and the Public Health Officer for doing that. And I think that it is important that as this disease continues to progress or not progress, that we should get regular, updated briefings on what is going on. Of course it's not good enough. We do not want Canadians to be panicking. We do not want parliamentarians to be not knowing what to tell their constituents when they ask questions. Look at what happened as soon as they started in Ontario. The Minister of Health and the Chief Public Health Officer of Ontario immediately went out and did it. So I'm just saying it's not enough. No, it isn't.
Resuming debate, reprise de débat, the Honourable Parliamentary Secretary to the Minister of Health.
Mr. Speaker, thank you for the opportunity to speak to the House about the serious outbreak of Ebola in West Africa, and that our government is taking to ensure Canadians here at home remain safe and protected. There's no question that the Ebola situation in West Africa is tragic, and I think I speak for all members of this House when I say that our thoughts are with those who are affected and their family and all surrounding communities and the international community. The government is closely monitoring the Ebola outbreak in West Africa, and we're working closely with our international partners to support the response and to help those who are suffering. The current outbreak has been ongoing since December 2013, and as of October 17th of this year, the total number of reported cases was 9,216, including, tragically, 4,555 deaths in those affected regions. With the exception of cases in the United States and one in Spain, the current outbreak continues to be confined to West Africa. Much recent media attention has been focused on the situation in Texas. And while there have not been any cases of Ebola in Canada, we must be prepared for a case to come here. Provincial and local health authorities and officials are on the lead of any Ebola case in Canada, but the Public Health Agency of Canada continues to assist. Ebola spreads in a community through direct contact with infected body fluids. The scientific evidence shows that Ebola is not airborne and cannot be transmitted through casual contact. The Ebola virus does not spread like the common cold or influenza or even like SARS. Mr. Speaker, I should note that I will be splitting my time today here in the Commons with the member from Pickering Scarborough East. As I continue, it cannot be spread from a person who is not showing any symptoms. Secondly, the situation and environmental context in West Africa is radically different from here in Canada. Our hospitals in Canada have sophisticated infection control systems and procedures in place that are designed to limit the spread of infection, protect healthcare workers, and provide the best care possible for patients. In contrast, the West African countries that are affected, tragically, have limited resources to respond to prolonged outbreaks, especially in rural areas. The healthcare infrastructure there again, very unfortunately, varies greatly in the countries and communities affected, and there is a lack of appropriate personal protective equipment. And tragically, despite some progress, outbreak control strategies continue to be met with distrust due to fear and misinformation. Despite the fact that the risk to Canadians is low, the Government of Canada remains vigilant and is taking concerted action to ensure that Canadians continue to be protected against the Ebola virus. This includes maintaining our preparedness to detect, investigate, and prepare for people with the Ebola virus in the unlikely event that a case were to appear in Canada. We are well prepared. The Public Health Agency of Canada has recommended that Canadians avoid all non-essential travel to Guinea, Liberia, and Sierra Leone due to the outbreak. As well, public health notices have been issued for Nigeria and Senegal, recommending that travelers take special precautions. The government is making sure that Canada and Canadian travelers know how to protect themselves and what they need to do if they begin to experience symptoms of illness. It's recommended that those traveling to affected countries monitor their health carefully and seek immediate medical attention if they develop symptoms that could be associated with Ebola within 3 weeks of returning. Canada is well prepared to identify and manage ill travelers. The Quarantine Act is administered by the Public Health Agency of Canada 24 hours a day, 7 days a week at all points of entry into Canada. Technical guidance and protocols have been shared with provinces and territories and with the transportation sector to detect and manage suspected cases of Ebola infection. Frontline staff have been trained to screen international travelers arriving in Canada from communicable diseases and to refer any travelers suspected of being ill to quarantine officers. We also have 5 Ebola response teams in place, which include specific scientists, lab expertise to quickly confirm diagnoses, and emergency supplies from our national strategic stockpile. Stockpiles such as masks, gloves, and gowns. These rapid response teams would support the provincial and territorial authorities in their response should a case of Ebola occur. And under the Quarantine Act, officers have the authority to implement the appropriate public health measures to ensure public safety. From there, a strong network of laboratories stands at the ready to detect and respond quickly in the event that a case of Ebola arrives in Canada. Though there have been no cases in Canada, each suspected case to date has tested our response capability and demonstrated to Canadians that we are ready to respond and that our systems are working. In every case, the individuals suspected to be infected with the Ebola virus were identified, isolated, investigated by health authorities, and tested for the Ebola virus by the Public Health Agency of Canada's National Microbiology Lab in Winnipeg. We have learned from our experiences in SARS and with the H1N1 influenza pandemic, and we're applying these learnings to how we prepare for future outbreaks. Canada should be proud of our world-class researchers and science capacity. It was our very own scientists at the Public Health Agency's National Microbiology Lab in Winnipeg who developed an experimental vaccine for the Ebola virus. It's the result of years of hard work and innovation by Canadian scientists to better the global public health and security. The Government of Canada has offered a donation of up to 1,000 vials of the experimental vaccine to the World Health Organization. The vials represent 2/3 of the total vials of the experimental vaccine currently in the possession of the Public Health Agency of Canada. 2/3, Mr. Speaker. I think we can all concur that that is a rather generous donation. Canada will keep a small supply of the experimental vaccine to conduct research and clinical trials on safety and efficacy. We will also keep some vials in the unlikely event that they are needed here at home in Canada. Already these vials offered for donation are on their way to the World Health Organization in Geneva. The first shipment left yesterday. The vaccine vials are being sent in 3 separate shipments as a precautionary measure due to the challenges in moving a vaccine that must be kept at a very low temperature at all times and in the event that there is some sort of unfortunate accident during shipment. The World Health Organization has determined that there are some important safety and ethical considerations that it needs to resolve before the vaccine vials can be given to people. The global community, under the leadership of the World Health Organization, are making progress addressing these issues. There are also logistical challenges. Canada stands ready to support the World Health Organization, and we expect to see our donated experimental vaccine deployed as quickly, ethically, and as safely as possible. We're committed to supporting the efforts of our international partners to control the Ebola outbreak, and we hope that the experimental vaccine will help address this global crisis. Canada should be proud, and Canadians should be proud of our humanitarian support to address the spread of Ebola in West Africa, including significant funding and the deployment of Canadian experts to assist on the ground. On October 4th, our government announced the deployment of a second mobile lab and team to West Africa to assist in the Ebola outbreak. The lab and 3 additional scientists from the Public Health Agency of Canada have joined the agency's existing team in the field. One mobile lab team will continue to provide rapid diagnostic support to help local healthcare workers to quickly diagnose Ebola. The second mobile lab team has been working with Médecins Sans Frontières to monitor the effectiveness of infection prevention procedures, such as hand-washing stations, face masks, disposal sites, and to prevent the further spread of Ebola. Once their work with Médecins Sans Frontières is completed, the team will be deployed to other locations to support diagnostic needs as required. On-site laboratory support produces results in only a few hours, which in turn allows for faster isolation of Ebola cases and patient care. It's pivotal to an effective response in this affected region. I would end my remarks, Mr. Speaker, by saying that while the motion before the House is admirable in recognizing the devastation wrought by this Ebola outbreak, it is imperative that we as parliamentarians allow our public health officials and ministers the flexibility necessary to focus their efforts on addressing the outbreak. I'd like to close by extending my heartfelt condolences to those affected by this ravaging disease in West Africa, and to encourage Canadians to support international relief organizations working in this area. Thank you, Mr. Speaker.
Questions and comments? Question et commentaires de l'honorable député de...
The honourable member for Laurier Ste. Marie. Thank you.
And I would like first to make a brief comment about the fact that we're all proud of our scientists, and of course we are proud of our scientists, but I think it would be time to stop muzzling them. Ceci étant dit, Monsieur...
That said, Mr. Speaker, I'd like to ask two main questions. As I've heard before, does she believe that Canadians are adequately informed on how this disease progresses and what has to be done? Or does she agree with us that it's actually crucial that the minister inform, and people from the Public Health Agency inform Canadians regularly and be open about problems related to this disease? And I'd also like to ask her if she agrees with us that the best way to prevent the arrival of Ebola in Canada is to fight against the spread in West Africa, and Canada could do much, much, much more, because what they've done now is a drop in the bucket. The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. The Independent Scientist, Canada's Chief Public Health Officer, has been available regularly. He's been communicating at press conferences, taking questions from the media, and regularly sharing his expertise and his information on the spread of Ebola. This is a disease that, unfortunately, the world has now known for the better part of 4 or 5 decades. How Ebola is transmitted is well documented. It is not as transmittable as the common cold. One needs to come in contact with actual fluids. Nobody who has sat on a plane or in a train has actually developed Ebola from somebody else that was a passenger. So this type of information has been made regularly available to the Canadian public, to the international public. One need only tune in to CNN or to CBC or CTV to hear this type of information being shared. The Chief Public Health Officer has also made himself available regularly to provide these types of answers and to provide this type of independent information to all Canadians. Additionally, the Minister of Health has made herself available to provide this type of information. The Prime Minister has provided this type of information. Mr. Speaker, humbly I would suggest that I have provided this type of information here and in media panels regularly. So I think this information is being communicated to Canadians. I think it's critical that Canadians continue to remain vigilant, and it's not the time to make partisan games out of this.
Questions and comments? Question et commentaire. The Honourable Member for Vancouver Centre.
Thank you very much, Mr. Speaker. I have 2 questions I'd like to ask the Honourable Parliamentary Secretary. In April, the Ebola epidemic began to show that it was becoming an epidemic. In June, the Honorary Consul General from Sierra Leone got a letter from Washington asking for personal protective equipment. But since he sent that message to the ministry, the minister, PHAC, auctioned off 1.3 million masks and more than 209,000 gloves for the price of $50. Can you tell me why they didn't send that instead, on request, to West Africa or to World Health Organization? Why did they just go and auction it off? And secondly, I'd like to know what took the generous 800 to 1,000 vaccines so long to get there. It's only getting there yesterday. What took it so long since April and since June to get these things done?
The Honourable Parliamentary Secretary, you only have a little less than a minute.
Thanks, Mr. Speaker. In fact, these are two completely unrelated issues. When it comes to personal protective equipment, the member opposite is a little bit off on her dates. The Ebola outbreak actually began in West Africa in December of 2013, not April 2014. So December 2013, and as members of this House may be aware, Ebola has had some outbreaks in the last 4 or 5 decades, and there have been, unfortunately, a few thousand deaths up until this recent outbreak. This recent outbreak is truly different in that we've had thousands of individuals who have now passed away from this disease. As soon as the World Health Organization contacted Canadian officials in September, the auction of the personal protective equipment was halted. And Canadians ought to feel rather proud about our contribution. We are donating millions of pieces of personal protective equipment, 1.2 million gowns, 1.5 million gloves, and over 2 million face masks.
Resuming debate. Please the débat. The Honourable Member for Pickering Scarborough East.
Thank you very much, Mr. Speaker. I am pleased to rise in the House today to speak on the ongoing outbreak of Ebola in West Africa. I would like to focus my remarks on highlighting the work done by our scientists in developing the Canadian experimental Ebola vaccine. As my colleagues will know, on August 12, the Minister of Health announced that we would be donating up to 1,000 vials of this experimental Ebola vaccine to the World Health Organization. This vaccine was created in Canada by researchers at the Public Health Agency of Canada's National Microbiology Laboratory. This vaccine has never been tested in humans but has shown strong promise in animal research. It is a result of years of hard work and innovation by Canadian scientists to better global public health and security. The Public Health Agency of Canada has been prepared to send the experimental vaccine for some time now, and I am very pleased to hear that the World Health Organization finally signaled that it was ready to receive it, and vials began shipping yesterday to Geneva. The WHO, in consultation with partners, including the health authorities from the affected countries, will determine how the vaccine will be distributed and used. Mr. Chair, I would like to share some information on the development of the Ebola vaccine at the Public Health Agency's National Microbiology Laboratory. The agency's National Microbiology Laboratory officially opened in 1999. It is one of the few facilities in the world, and the only one in Canada that has the capacity to accommodate and research the most basic to the most deadly infectious organisms at the highest level of biocontainment. It is a world-class laboratory with a mission to advance human health through laboratory leadership, scientific excellence, and public health innovation. Before the opening of the facility, not a single researcher in Canada had the ability to work on hemorrhagic fever viruses such as Ebola. A potential case of Ebola in a patient could not even be diagnosed in Canada prior to 1999. Canada was entirely reliant on the Centers of Disease Control in the United States. It speaks to Canadian innovation that within 3 short years of opening its doors, researchers at the National Microbiology Laboratory had already developed the foundation of what would become the experimental Ebola vaccine. Through continuous research and experiments that spanned a decade, scientists at the facility perfected a vaccine that has been effective in protecting non-human primates from the deadly Ebola virus. The particular species of Ebola for which the vaccine was developed, Zaire Ebola virus, is considered one of the most aggressive infectious agents capable of causing death of up to 90% of humans and non-human primates. For over a decade, at the time when Ebola outbreaks were only sporadic and quickly controlled, Canadian researchers continued their important work at finding ways to fight and protect against this virus, knowing the potential for this deadly disease to spread. They recognize that although Ebola is not indigenous to Canada, international travel provided the opportunity for the transport and introduction of this disease into countries outside of Africa through an infected individual. They also realized the potential for the Ebola virus to be used as a biological weapon, and they worked closely with other government departments to ensure Canada was prepared. Their research also had a much broader goal. They believed that the novel technologies and methods used to create treatments and vaccines against the aggressive viruses such as Ebola could potentially be applied to less intimidating pathogens. This belief still holds true today. The cascading effects of Ebola research at the agency's National Microbiology Laboratory may soon lead to a universal flu vaccine, may help Canada stop the next pandemic, and could directly contribute and help shape the future development of better therapeutics to fight a range of new and emerging pathogens. This is the reality of the important work being done in Canada and truly exemplifies the world-class research conducted by agency scientists. The Ebola vaccine was a Canadian discovery with ongoing support from the Government of Canada over the last 15 years. Through considerable funding of this cutting-edge and innovative special pathogens research program, Canada can now, more than ever, stand proud as an international leader in the field of infectious diseases research. Since 2007, well over $5 million have been specifically invested to help agency researchers find vaccines and treatments against Ebola, as well as some other very dangerous organisms. I am proud to say that thanks to this funding, Canada has developed vaccines and treatments for a range of hemorrhagic fever viruses. In addition to this promising vaccine, Canada created and tested the ZMAP Ebola treatment. This post-exposure treatment has a very good survival rate in non-human primates. The treatment uses a unique regimen of multiple doses of antibodies designed and engineered to find, attach, and effectively coat the Ebola virus, preventing the virus from reproducing and multiplying in the body with no side effects. It is believed that the ZMAP treatment was directly responsible for saving the lives of some frontline workers who became infected with Ebola virus in West Africa. This is an important example of work being done in Government of Canada laboratories that has led to saving of lives, a proud moment for all Canadians. In addition to the Ebola vaccine and treatment, the agency's National Microbiology Laboratory has developed vaccines that have shown to be 100% effective at protecting against the Marburg virus and the Lassa virus. These viruses can be deadly and have no known cure. The threat of these viruses entering the country is real. It is through the hard work and dedication of so many, through innovation, vision, and scientific tenacity, that I can proudly say that our country is prepared and ready should a hemorrhagic fever virus enter Canada. There are no confirmed cases of Ebola in Canada, but Canada must be prepared for a case to come here. While provincial and local health officials are the lead on any Ebola case in Canada, the Public Health Agency of Canada stands ready to assist. The work to develop a vaccine or treatment is not done in isolation. Discoveries of this magnitude require collaboration throughout government departments, investment by private industry, and importantly, international partnerships. This vaccine is an example of what can go right when scientific knowledge is shared between borders, when important additional funding is made available through a variety of specialized grants, and when private industry is brought up to help further the work of Canadian scientists. While multiple organizations assisted in some aspects of the development of the vaccine, I would like to highlight that the intellectual property rights for this vaccine belong to the Government of Canada. I can assure the House that the Public Health Agency is in regular contact with the licensee of the vaccine, as well as with multiple international partners, including the WHO, to provide guidance and advice on ways to advance the clinical trials and facilitate the production of Ebola therapeutics. Phase 1 clinical trials for this vaccine were launched on October 13 at the Walter Reed Army Institute in Silver Spring, Maryland. Canada has supplied 20 vials of the experimental vaccine for use in these trials. We have confidence in this vaccine, but we must be remembering that it is an experimental vaccine and that phase 1 clinical trials are important to assess the overall safety of the vaccine in humans and to determine the appropriate dosage. Outcome of these phase 1 trials are expected in December 2014. Canada is an important contributor to the fight against Ebola in West Africa. This is no small part of the researchers at the agency, National Microbiology Laboratory, who have devoted their work to find cures and treatments for those that so desperately need it. I would end my remarks, Mr. Speaker, by echoing the Parliamentary Secretary's remark that while the motion before the House is commendable in recognizing the devastation brought by this Ebola outbreak, it is imperative that we as parliamentarians allow our public health officials and ministers the flexibility necessary to focus their efforts on addressing this outbreak. To that end, I move, seconded by the member for Don Valley West, that the motion be amended by replacing the words "appear before" with the words "report either in writing or in person too." Thank you very much, Mr. Speaker.
Order. It is my duty to inform honourable members that an amendment to an opposition motion may be moved only with the consent of the sponsor of the motion. Therefore, I ask the honourable member for Vancouver Centre if she consents to this amendment being moved.
No, Mr. Speaker.
There is no consent. Pursuant to Standing Order 85, the amendment cannot be moved at this time. Questions and comments? Question et commentaire. The honourable member for Etobicoke North.
Speaker, I'd like to thank my honourable colleague for the speech. Yesterday we learned $1.5 million worth of stockpiled Public Health Agency of Canada medical supplies were auctioned for just a fraction of that figure. This has raised questions about the true value of Canada's contribution to the global fight against Ebola. Why did the government not respond to the ambassador's June request for gloves and masks? Why did the government not make a donation of personal protective equipment on its own, knowing that the Ebola outbreak was unprecedented? How could the government auction off 1.3 million masks and more than 209,000 gloves after the June request? And what is the true value of the personal protective equipment?
Honourable member for Pickering Scarborough East.
Thank you very much, Mr. Speaker. I thank my colleague for the question. Referring to that process of auction of the equipment, this routine process was stopped once the WHO request was made. Offered to donate 1.5 million gloves, 2 million masks, and 1.2 million isolation gowns. First two shipments, including 128,000 face shields, already delivered in part by our RCIF Hercules aircraft. Remaining equipment delivered in coming days and weeks, priority given to what the World Health Organization is requesting.
Question et commentaire. Questions and comments. L'honorable député de Laurier-Sainte-Marie.
The honourable member for Laurier-Sainte-Marie. Thank you, Mr. Speaker. I'd like to remind my colleague that the honorary consul for Sierra Leone made the request, but it was simply ignored by the Minister of International Cooperation. Mr. Speaker, my colleague spoke a great deal about vaccines, and indeed we are very proud of this vaccine that was developed here in Canada. We are very proud of our scientists who developed it. We would like this government to allow our scientists to do their work without constantly muzzling them. That being said, does my colleague realize that this vaccine, before it can be used on the ground, it will take months? And we are told that in a few weeks, there could be up to 10,000 new cases of Ebola per week in West Africa. So don't we need to act on that front as well, a bit more than what the government is doing right now? Thank you, Mr. Speaker.
Pickering Scarborough East.
Thank you very much, Mr. Chair. Thank you, my colleague opposite to the question. I just want to tell you when a honorary consul is asking something, you know, I was a honorary consul, and not necessarily, if it is not coming from an official, from a government official, you will be getting an answer. That is first. Secondly, when you are speaking about the experiments of the vaccine that is taking months and months, we demonstrated that we send the vaccines at the request of the World Health Organization as soon as they requested that one. So there are 800 files in their possession, and what will be happening, and what will happening, that will be an issue that will depend on the World Health Organization. Thank you.
Questions and comments? The Honourable Member for Sandwich Gulf Islands. A short question, please. We don't have a lot of time.
Thank you, Mr. Speaker. To the Honourable Member for Pickering Scarborough East, I think it can be safely said that all of us in this House are united in concern about this dreadful tragedy, that we see that we must keep proportionality, that the greater threat is clearly in the African nations, and we mustn't create panic here in North America. I'd like to ask my honourable friend how he sees that balance between protecting Canadian lives at home and the importance of saving lives in Liberia and in the African region that's affected.
Member for Pickering Scarborough East, you have about 35 seconds.
Thank you very much. Thank you to my colleague for the questions. We demonstrated a very quick international response to the Ebola outbreak, and I think that domestically we are quite prepared to face an eventually outbreak of Ebola. At the border, Canada has adopted additional scrutiny for passengers that have been in affected countries in Africa. All international points of entry of Canada are routinely monitored 24/7. Travelers from affected countries are referred to quarantine officers, health assessments, temperature checks, and can implement measures under Quarantine Act, and no direct flights from affected countries on Africa. Public Health Agency and the Department of Foreign Affairs recommend against all non-essential travel to Guinea, Liberia, and Sierra Leone. Canadians in affected countries should consider leaving while commercial flights remain available. Thank you, Mr. Speaker.
Please, the débat.
Resuming debate. The Honourable Member for Laurier-Sainte-Marie. Thank you very much, Mr. Speaker. And, Mr. Speaker, I'd like to indicate that I will be sharing my time with the Honourable Member for Vancouver East. Mr. Speaker, we are currently facing a huge crisis. The United Nations consider it as a threat to global security and global health. This is not a crisis that only concerns Western African countries. It concerns us all. And the price, the worst thing about all of this is that this crisis, if we don't make every possible effort to contain it now, to become an even greater catastrophe. So as we have been talking about it throughout the months that this has lasted, and we have seen there are 10,000 cases over several months, the World Health Organization has now told us that it could increase by 10,000 per week, and this could happen by the month of December. So how can we face in barely a few weeks a potential for thousands, hundreds of thousands of new cases if we can't even face 10,000 cases right now? We can't deal with that now. So don't forget that the worse it gets in West Africa, the higher the risks will be for it to spread here. So we absolutely must contain this disease now, on the ground in West Africa. And in order to do so, we need to put in the necessary efforts, and unfortunately that's not currently the case. Canada's answer to date has been defined as being too little, too late. It took weeks for Canada to make its first significant contribution, and during the time that people on the front lines were desperately asking for assistance and equipment, the Public Health Agency of Canada has continued to sell off this very same equipment at ridiculously low prices, while the people who bought it tried to turn around and sell it back to the people who need it at a great profit to themselves. Even though the Prime Minister's office was informed of this situation.
Response to the Ebola crisis, for me, it's a bit like you have a fire in your living room. You know, you have a fire about this big, and you say, oh, there's a fire. I'm going to put 3 drops of water. And then the fire grows, and you say, okay, I'm going to pour, you know, a teaspoon of water. And the fire keeps on growing, and then finally you say, oh, maybe I should put, you know, 3 or 2 cups of water on the fire. If it's not even, some people say, just close the door, you know. And even then, even when we're starting to give a bit more seriously, much too late, it seems we can't do it right away or properly. Le Canada a promis.
Canada promised $67 million in total, but only $5 million has arrived to date. So does the government realize that in a crisis where cases are multiplying at such a rate, time is of the essence, and a few days can make a huge difference? Canada promised vaccines, but it took an incredibly long time for those vaccines to arrive at their destination. And, once again, those vaccines will not be used until a few more months have gone by. Canada promised equipment, but only a small percentage of that equipment has landed.
In this case, the same mismanagement and failure to act swiftly that we have seen, unfortunately, in too many humanitarian crises. From Syria, for example, where we're still not receiving the refugees we've promised to welcome in Canada, or where urgent calls for equipment for the winter are answered in the spring, or to South Sudan and Central African Republic, where Canadian response has been lackluster, to say the least. And, of course, to Ebola, where it's too little, too late, always. Alors, que devrait...
What should Canada do, Mr. Speaker?
On devrait...
We should follow the examples of other countries who decided to take the bull by the horns. The United States, for example, they sent 3,000 soldiers, 11 field hospitals, plus medical staff. We have to contribute more, obviously, to the calls of the World Health Organization, and I have to repeat this: do it quickly, not say we'll give you a little bit more and then send money weeks later. We have to act now. We have to more significantly support our other partners who are working on the front lines, Doctors Without Borders, for example. And I have to emphasize the work that their president, Joanne Liu, who is from Montreal and studied at McGill, has talked about. All of our partners in the humanitarian coalition who have recently launched an appeal that I hope we will all respond to. So, therefore, we must support all of these people in the field, and that also includes listening to them, listening to what they are saying their needs are. One of the things that they've mentioned, those people on the front lines, is the deployment of our disaster response team, because they are trained in terms of biological risks and medical health care, and they can work well in the field with armed forces. And I know the Prime Minister has said, oh, well, it wouldn't really be appropriate to send the DART now, but the people who are on the front lines who are fighting against Ebola believe it would be. So I put a lot of stock in what they say. We also...
Long term. We need to think building the health systems in those countries. We need to think about building resilience to threat in those countries. Would the threat be disease or climate change or other things? We need to work on this. And this includes good governance and democracy promotion. I know it may sound far away, but take a very good example. I've lived in Senegal for years. Senegal is relatively a rather stable country with good governance, strong institutions. Well, they had a case of Ebola, and they were able to control it. When we compare it to other countries like Liberia, who are just out of years of civil war, and just don't have the infrastructure, well, we see the result. And I'm not blaming the Liberian authorities here. We need to help those countries rebuild. We need to still be active in peace building. We have a responsibility to reconstruct. And then when we do that, even if it seems how could I say, a bit Boy Scout or something like that, in the long run, we win and we help avoid this type of crisis. And I think we can see it very clearly right now with what's happening in West Africa. Mr. Speaker, we can beat Ebola. We must beat Ebola. It's a matter of our safety. It's a matter of our humanity, and it's a matter of the world's stability. Thank you very much, Mr. Speaker.
Question et commentaires, questions and comments. The Honourable Member for Etobicoke North.
Mr. Speaker, I'd like to thank my honourable colleague, and we've worked together on Central African Republic and South Sudan. I enjoy working with her. At least 3,700 children in Guinea, Liberia, and Sierra Leone have lost one or both parents to Ebola since the start of the outbreak in West Africa, and many are being rejected by their surviving relatives for fear of infection. As the death toll from Ebola continues to rise, preliminary reports suggest that the number of children orphaned by Ebola has spiked in the past few weeks and is likely to double around now. UNICEF appealed for $200 million to provide emergency assistance to children and families affected by the Ebola outbreak across the region, including protection activities. So far, UNICEF has received about 20% of the amount. I'm wondering what my colleague would like to see the government do to help provide children with the physical and emotional healing they need.
The Honourable Member for Laurier-Sainte-Marie. Thank you very much, Mr. Speaker, and I thank my colleague for her question, which is very relevant, because we mustn't forget we're talking about the Ebola crisis, but it goes beyond those people who are suffering and dying from this disease. Some 75% of the mortality includes women, because they're often the ones who are caring for those who are ill. So these are mothers who are disappearing. There are orphans that we are creating here. And on top of that, there is an impact on the healthcare system in those countries. Those systems are falling apart under the strain. Even means that even more common illnesses cannot be dealt with currently, on top of the whole problem of ostracism, etc. So that brings me to 2 points that I would like to make. First of all, in those countries, we're trying to work more and more on information to deal with that ostracism. I'm very concerned when I hear the parliamentary secretary to the Minister of Health say that people have enough information through reports on television. I think the Canadian government could do much more here as well in this regard. But obviously, we have to contribute more. We have to support UNICEF, which has only received 20% of what they've asked for. Questions and comments?
For Algoma, Manitoulin, and Kapuskasing.
Thank you very much, Mr. Speaker. I really appreciated my colleague's speech. Clearly, she is working a lot with the international community, and she has a great deal of experience that she brings to the House of Commons. I'm wondering, because there is a press release that was issued yesterday, it was Amir Ataran from the University of Ottawa who said that the vaccine, had it been developed in time and submitted in time, would probably have saved the lives of people who have since died. So we could have saved them. When we look at the fact that the vaccine we've been working on it since 2005, and there's been a great deal of hope placed on that, but it's taken until 2013 for one to even be put out. So maybe my colleague could talk about the importance of putting out a vaccine, especially with something like Ebola. We knew that crisis was looming on the horizon. The government has to act quickly when we are looking at such a crisis. The government says that they're going to give $65 million, but I think we've said only $5 million has been sent so far. So the importance of the vaccine and the funds being released in time. The member for Laurier Sainte Marie, you have 45 seconds. Thank you, Mr. Speaker. So very quickly, it's unfortunate that very often when we're talking about vaccines for illnesses that seem to be very far removed from our world, we take too much time to develop them. But on top of this, the government has taken a ridiculous length of time before sending the vaccines to the WHO. And as I was saying earlier, every day, every week counts. Because in the meantime, the problem is only getting worse. It's the same thing with the funds. We need them to be sent now. We don't need to wait another month or two until the crisis is that much worse. We need to send it now. Thank you, Mr. Speaker.
Débat, the honourable member for Vancouver East.
Well, thank you very much, Mr. Speaker, and I'm very pleased to participate in this debate today as the health critic for the NDP. And I'd like to thank my colleague for bringing forward this motion in the House today. And obviously, we will be supporting the motion. We actually see it as a very minimal ask to the government to ask the Minister of Health, the Chief Public Health Officer, and the Minister of Public Safety to appear before the Standing Committee on Health twice monthly to report and account on what Canada is doing around Ebola, both in Canada and internationally, is a very minimal demand, and obviously we need to go a lot further and do a lot more. But certainly, in as far as the motion goes, we support it and thank our colleagues for bringing it forward today. Mr. Speaker, I want to focus my comments today on what it is that's being completely lacking in Canada's response. Of course, we do know that Canada has committed $65 million internationally. And just to put that in context, we know, for example, that the UK has committed $205 million. Germany, for example, has committed $127 million. There's been just recently very generous contributions made by private individuals. So Canada, I mean, we're obviously glad that Canada has made this commitment of $65 million. But what is really concerning and we should be focusing on is that at this point less than 10%, only about $5 million of the $65 million has actually been delivered in goods and services and in terms of what needs to be done. That is very concerning, Mr. Speaker. We're hearing every single day, and I know that all of us are very concerned and about what's taking place in West Africa. We're watching the evolution and the development of this crisis, and the international response is so critical, not only in terms of a vaccine, but also in ensuring that medical supplies, protective gear and so on, as well as healthcare professionals are there on the ground. And I think that's the most important point that I want to make today. To me, this is not unlike what we've seen with the AIDS crisis, unless you have the capacity locally. And I note that yesterday the article that came out in the Lancet magazine also made the point that the critical issue is containment within the countries that are now infected, and to ensure that they have the capacity and the support and the resources, including a vaccine, to deal with their situation on the ground. This is about trying to ensure that we're not seeing an increase in transmissions in other countries, whether it be in other African countries or whether it be in Europe or in North America. So it's very concerning to us that now that we're into many, many weeks of this crisis, that Canada has really fallen so far behind in its ability or willingness, whatever it is, whatever the impediment is, to actually deliver on the commitments that it's made. And in fact, I've come to the conclusion that unfortunately what we're seeing unroll in Canada is more of a public relations exercise. I've been on a number of panels with the parliamentary secretary. We've heard the minister in the House when we've asked questions. And we're told every time that Canada is a world leader and we're doing this and we're doing that. And the vaccine was donated and it's been made available. And yet nothing is actually getting done, or very little. I mean, it was only yesterday that the vaccine, some of the vaccine actually moved out of Canada. And we even heard the Prime Minister basically blame the WHO for that, when in actual fact, Canada itself sold the licensing rights to a company for $205,000, a very valuable health product, the vaccine that was developed in Canada, and basically did nothing to expedite the development of the clinical trials and the need to get this vaccine to where it needs to go. Even in the U.S., for a month already, they've been working on the clinical trials. So there are so many questions here, Mr. Speaker, as to why the Canadian government has kind of made these pronouncements publicly, but has not followed through and remained vigilant in terms of delivering on the commitment that Canada has made. And in fact, I think again it was yesterday or maybe at the end of last week, we learned the shocking situation that back in June, the Honorary Council, Canadian Council in Sierra Leone, was urgently sending messages to Canada saying we need protective gear. And yet Canada was auctioning off those same items at cents on the dollar. I mean, it seems unbelievable. And it wasn't until September that those discounted auctions that were taking place were actually stopped. So here you have a delay from June to September. You have information on the ground that's coming back to Canada saying we desperately need assistance. We need to get this protective gear over to Sierra Leone. And what is Canada doing? We're actually selling off equipment that's needed at incredibly discounted prices that now we learn that is being resold elsewhere at inflated prices. So it raises a whole question as to what this plan is about and whether or not there is oversight on the plan that Canada has developed that we've been told exists. We certainly do appreciate the briefings that have been given by officials at the Public Health Agency of Canada, and we appreciate the information that they've provided. But I have to say that I do have concerns that when we know that the budget of the Public Health Agency of Canada has been cut $60 million over the last 3 years, we have to question whether or not even within our own environment here politically, within Health Canada, within PHAC, there's actually the capacity to deliver on the plan that's being developed. We've been saying consistently in the House, in other venues, in writing to the Minister, I think we've done 2 letters now to the Minister, asking very specific questions about what it is that Canada is doing and why is it that we're falling so far behind. And Mr. Speaker, I have to say that we're not getting the answers that we need to get. And it's not like this is an issue that we can say, oh, well, you know, all in good time. This is a critical urgency. It's an emergency today. There are people who are dying. The rate of infection, of course, is there's on average 1,000 new infections per week. So every day, every week, that there's a lag, that there's a delay, is actually affecting the lives and the life and death of many people that we could be helping. So this is a very critical issue. I do want to just mention the letter that we wrote recently to the Minister of Health last week, and we asked some very pointed questions, Mr. Speaker. We asked the Minister who is responsible for ensuring quarantine and treatment protocols in Canadian hospitals and clinics. Very basic question. We know that PHAC has been developing national guidelines. We know that yesterday the Canadian Federation of Nurses Unions, a very major organization in this country representing frontline healthcare workers, expressed a lot of concerns about the fact that frontline healthcare workers are not prepared in this country. They don't have the protective gear that they have, and in fact provinces are apparently developing different protocols and different levels of safety equipment. So what's happening in Ontario may be different than what's happening in Saskatchewan or in British Columbia. So it does raise some very serious questions as to who exactly is responsible for not just developing guidelines, but ensuring quarantine and treatment protocols. Who is responsible for ensuring that hospitals and medical practitioners have the appropriate equipment? These are questions, Mr. Speaker, that we've not yet had answers to. So I want to say today that in supporting this motion, it is important that the officials come before the Health Committee, that we be able to hold them to account and to provide these questions. We will certainly be doing that in the House. I've been very glad that the leader of the official opposition, the member from Outremont, has been raising these questions in the House on a very regular basis, as have I and my colleague, the member from La Salimar. And we will continue to do so because we're very concerned that this not just be a public relations exercise by Canada, that it be a full commitment, not just in the short term, but in the long term, to help people in West Africa who are affected, to ensure that there are the proper protocols and treatments in place should there be a case in Canada, which of course we hope will never happen, but we have to be prepared, particularly given what we've seen in the United States and some of the protocols that have been broken there. So, Mr. Speaker, we support the motion and we will be doing a lot more on this file to keep the government to account. Thank you.
Questions and comments? Question commentaire. The honourable member for Sandwich Gulf Highlands.
Speaker, and I want to compliment and thank my honourable colleague for Vancouver East for, of course, and consistently putting health matters first. In the crisis of Ebola, I second all of her concerns where there was over-promising and under-delivering from Canada in the face of a crisis where I think we still know that there is much more we can do. I've been personally struck by Secretary General Ban Ki-moon saying that of the hundreds, $20 million, $30 million promised, apparently he only has access to $100,000 to confront this crisis. Does my honourable friend know if that remains the situation for the United Nations, and how quickly is our Canadian funds that have been promised moving into the region?
The honourable member for Vancouver East.
Well, I'd like to thank the member from Saanich and the Gulf Islands for her I think, very appropriate and pointed question, because the issue of timing and what's moving quickly or slowly is a very critical matter. And as I pointed out in my comments, Mr. Speaker, we do know that as of this date, less than 10% of the funds committed by Canada have actually been utilized in terms of actual delivery. So that implies that we're a long, long way from where we should be in terms of ensuring that the commitment that Canada made is actually getting to the people who need it. I think the same is true internationally overall. This does have to be an international effort, and it's very concerning to see the estimates that have been made by the World Bank, by the United Nations, by others who are saying, this is about the long game. This is about a sustained effort. It's about ensuring that there's basic healthcare capacity in these regions that are affected. That is a very important question to deal with. We saw that with HIV/AIDS. Even if treatments are available, if you don't have local clinics, if you don't have trained personnel, if you don't have the delivery system, then you're completely missing what needs to be done. And so I do think we have to focus on the short term in terms of a vaccine and the protective gear, but we also have to make a long-term commitment to make sure that this funding continues. Thank you.
In comments, question commentaire, the honourable member for Davenport.
Thank you, Mr. Speaker, and I would like to thank my colleague from Vancouver East for the work that she's done on this issue, and she underlines the fact that in many instances this government will make grand announcements and not follow through, or be incredibly slow under dire circumstances, and their commitments around Syrian refugees is another example of that. But I wanted to double back to the letter that my honourable colleagues sent to the government, and because I think for Canadians watching this debate, they want to also know sort of the level of engagement that parliamentarians have on this issue, and the importance that we place on moving these issues forward in fact a nonpartisan way to get the job done and to fulfill our commitments internationally. I mean, one of the questions that was asked in the letter was, is there a plan to rapidly increase production of the vaccine in the unfortunate advent of worst-case scenarios as outlined by the World Health Organization? And I'm wondering if the member when we might expect an answer on this issue. There's a number of very detailed questions, but they're very clear, and they're asking questions Canadians want answers to. And I'm just wondering if she could enlighten us as to when we're expecting a response.
The honourable member for Vancouver East, you have less than a minute.
Well, I think it's a very good question. Unfortunately, I wish I knew the answer as to when we would get a response from the government, and I think this is precisely why we need to have officials come before the committee so we can keep pressing on these questions. We have asked, is there a plan to rapidly increase production of the vaccine in the unfortunate event of worst-case scenarios as outlined by the WHO? We've not had a response on that question. We don't know what efforts are underway currently to produce more of the vaccine. We don't know what percentage of the existing supply will be used for clinical trials. So there are a ton of questions that we have to keep pressing, and I can tell the member that we will absolutely do that. That's our responsibility and duty to do that until we get answers.
Resuming debate, reprise de débat, the honourable member for Etobicoke North.
Speaker, I'm grateful for the opportunity to rise today to speak about our Liberal motion that first recognizes the terrible devastation that Ebola is wreaking in Western Africa, and that will require the Minister of Health, Minister of Public Safety, and Canada's Chief Public Health Officer to appear monthly to report on Canada's efforts at home and abroad to ensure that the outbreak does not pose a threat to the health and safety of Canadians. Mr. Speaker, my colleague from Vancouver Centre and I began formally raising Ebola on the national agenda on August 3rd, writing an open letter to the Minister of International Development regarding what Canada had specifically contributed to the Ebola response. We asked how many specialists and in what disciplines Canada had sent to the World Health Organization to help out, and asked that the Minister work with colleagues and relevant departments here in Canada in areas of air transport, border services, and protection of healthcare workers. And we asked that the government give more funding. Well, the government responded with a donation of $5 million. The amount was tiny in the face of overwhelming need and generosity of other nations. Mr. Speaker, we wrote the letter because Canada had a moral responsibility to do more to help combat what was then an unprecedented outbreak of Ebola. We also understood that the best way to stop this devastating disease was to stop it at its source, before it spread more widely and became even more difficult to contain. And we understood that if we want to protect Canadians from Ebola here at home, we had to end the suffering in West Africa. Mr. Speaker, during the emergency debate on Ebola on September 15th, I ask the following. How is Canada working with other countries, particularly through the Global Health Security Action Group and the Global Health Security Agenda? How is the government working across departments, and what specific departments are involved in each of preparedness, response, and recovery? And what is the lead agency for each? What specific actions are each of the departments undertaking? What is the government doing to ensure the safety of Canadians traveling to West Africa to undertake humanitarian work, commerce and trade, and to safeguard the well-being of those who are there now in areas where Ebola is spreading? What guidance is being provided to Canadians before they leave and while in areas in which Ebola has been reported? If they think they have symptoms compatible with Ebola, what should they do upon their return to Canada? How specifically was the government's April 18th funding of $1,285,000 used to address the outbreak? How many specialists and in what disciplines did Canada send to work with the World Health Organization and or West Africa to help? How specifically was the August 8th funding of $5 million to address the outbreak spent? Although the risk is low, is Canada ready to isolate and care for someone if affected? Does the Public Health Agency of Canada have a public awareness plan to help Canadians understand the prevention, transmission, and signs and symptoms of the disease? Does the government accept that the Ebola outbreak in West Africa has become a real risk to the stability and security of society in the region? Does the government accept that Guinea, Liberia, and Sierra Leone need more doctors, nurses, beds, and equipment? Does the government accept that the international response has been inadequate and that we need to scale up international response? In light of the United Nations International Rescue Call, will Canada do more to help? Mr. Speaker, we followed up the August 3rd open letter with another open letter on September 17th, yet again calling on the Canadian government to do more to help West Africa, specifically provide more money, more personnel, and more materials. On September 24th, I published an article, Will Canada do more to help combat Ebola? Specifically, I asked, will the government do more to help beyond the most recently announced $7.5 million? Will the Acting Chief Public Health Officer of Canada speak directly to Canadians to communicate the global impact of Ebola and coordinate and support health care workers who wish to assist efforts in West Africa? Will the government explain to Canadians how it will facilitate the delivery of assistance, including qualified, specialized, and trained personnel and supplies to the affected countries? Will the government offer much-needed field hospitals and other equipment and more healthcare specialists? Will the government call on non-traditional partners to contribute in the areas of communications, health, information, and transport? Mr. Speaker, because we lacked answers, my colleague from St. Paul's and I wrote to the Minister of Health to ask for a briefing for all parliamentarians on Ebola, as we needed answers on these important questions. I would like to thank the Minister of Health for granting our request, but Parliament needs to be updated on a regular, ongoing basis. Mr. Speaker, after the first patient suffering with Ebola arrived in the United States on September 20th, the Government of Canada made two separate pledges, each for $30 million. Why did we not see the same pledge and the same sense of urgency to help in West Africa before North America's first case? The government had two responsibilities when Ebola began spreading unchecked in West Africa. First, to join with the international community and try and stop it, and the second, to be prepared should a case be identified in Canada. When the World Health Organization asked for $600 million in July, the government gave only $5 million. Why a sluggish response to what was identified then as an unprecedented outbreak? Mr. Speaker, for the longest time, the government largely made announcements. It announced vaccines with a delay of 3 months between announcement and sending them to the World Health Organization. The government announced personal protective equipment, or PPE. On October 3rd, I asked in question period, quote, with Ebola cases and deaths tripling since August, West Africa needs personal protective equipment urgently, but Canada's failed to fill its September pledge. I will ask again, what is the minister doing to ensure that the promised supplies get to where they are needed now? Prior to this, Canada's only response was to auction off personal protective equipment until September, months after the alarm was sounded, after the Sierra Leone ambassador to the United States and aid organizations made a plea for personal protective support, and a month after the World Health Organization said the same. Shockingly, we learned just yesterday that only 2 shipments have been sent to the World Health Organization, with others to follow in the coming months, according to the Assistant Deputy Minister of Public Health. And it's unclear whether the first shipments have in fact even been dispatched to affected areas. And the government has announced funding. Of the $35 million initially pledged, only $4.3 million are showing up as committed funding on the UN Office for the Coordination of Humanitarian Affairs financial tracking website, suggesting no legal agreements have yet been drafted concerning the remaining funds. Mr. Speaker, as of October 19th, Canada's actual financial contribution for the international response to combat the disease came in 17th place. The United States, with $206 million in committed funding, remains by far the largest donor. Mr. Speaker, mere announcements cannot fight Ebola. Only commitments on the ground in West Africa can counter the epidemic. Canada's lack of commitment to short-term results is unacceptable, with Ebola cases doubling every 25 days. Mr. Speaker, yesterday we learned that Canada would not be sending any more medical personnel without a guarantee they can be medically evacuated if they get sick. Of course, we always want to ensure the health and safety of Canadians, but why doesn't Canada have this capability? When will a plan be in place? Has the minister met with anyone yet on this? When and who? The World Health Organization has been calling for urgent international support in sending doctors and nurses to the worst affected countries. Dr. Margaret Chan of the WHO has been clear, quote, the thing we need most is people, the right specialists, and specialists who are appropriately trained and know how to keep themselves safe. My contacts on the ground in Africa echo her call for more personnel. My contacts were in HoC, in fact, hoping that an announcement would be coming from Canada very soon regarding how it would coordinate those who wish to come and work in West Africa. Despite my asking repeatedly during the emergency debate on Ebola, we still do not even know how many Canadians are involved in the response in West Africa. Mr. Speaker, as the international development critic for our party, let me now focus attention on the needs of West Africa. And let me begin by sending strength, courage, and hope to the people of West Africa, namely the people of Guinea, Liberia, and Sierra Leone, who have suffered so much, and to Canadians with families, friends, and loved ones in Africa. Let me also extend my condolences to everyone who has lost someone during the world's worst outbreak of Ebola in history. I want you to know we feel your pain, we stand by you, and that we will fight for you. Mr. Speaker, this past Sunday, I spoke via telephone with Professor Monty Jones, Special Advisor to the President of Sierra Leone, an ambassador at large, who is responsible for overseeing the Ebola response in the country. Our Parliament should know that he was listed as one of the 100 most influential people in the world by Time magazine in 2007. His Excellency, President Ernest Koroma, was briefed that the call was taking place, on what transpired, and gave permission for me to talk about the Ebola outbreak in Sierra Leone, and particularly the urgent needs of the country and the Canadian Parliament. Mr. Speaker, 2,500 people have been infected, 900 have died, and 580 have recovered in Sierra Leone. In the special advisor to the President's words, the disease remains, quote, very stubborn despite all the measures taken. In fact, 5 of 14 of the country's districts are quarantined, including parts of the capital. Sierra Leone needs community-based care centers, and they need 1,000 more beds. And the country needs health care workers. Special Advisor Jones says 3 to 4 health care workers are needed for each patient with Ebola. This means the country needs a minimum of 500 more doctors, 2,000 nurses, and 1,000 technicians with various specialties. Mr. Speaker, burial remains a challenge in Sierra Leone, as the government wants to give a decent burial to everyone. Custom in Sierra Leone involves crying, mourning, touching the body, but now there are no ceremonies, no touching, and burials are fast-tracked. The special advisor to the President explained that a swab is taken from each of the dead in order to ensure someone has not died of Ebola. The problems there are not enough ambulances, not enough laboratories, and not enough technicians to analyze the blood samples. As a result, there is a backlog of samples, which means there is a backlog of bodies to pick up. Sometimes bodies are remaining in houses for 3 days. The longer a body remains, the greater the chance that someone will want to touch their loved one. Special Advisor Jones says labs currently process 50 to 100 samples per day, but they need more labs and more technicians, so 500 samples can be analyzed per day. Mr. Speaker, the Special Advisor is particularly concerned about possible travel bans and what such bans might mean to the economy and the importation of food and desperately needed health care and medications. Sierra Leone was one of the fastest growing economies in the world, and the World Bank ranked it the 6th fastest reformer. Economic growth was at 11%, was predicted to go to 14%, but has now dropped back to 7%. The special advisor explained that a ban would cripple the economy further and prevent much-needed food and medical help from coming in. He explained that people are thoroughly screened in Sierra Leone airports with thermometers and infrared temperature screening. And if there is even a slight increase in temperature, they are turned back into health care. Special Advisor Jones hopes that the international community will continue to respect the known science with regard to travel bans and not make political decisions that would hurt his country further. Mr. Speaker, as a final point, the Special Advisor to the President wants the Canadian Parliament to know that the economy and health care will need help after the Ebola outbreak, and that we must not forget the people of Sierra Leone and indeed West Africa. Several humanitarian organizations have relayed the same point to me. Healthcare systems have effectively collapsed and will require substantial support to be rebuilt and strengthened. The government's investment in maternal newborn child health and the gains in MNCH in the region will be reversed if we don't have a place to assist mothers after the outbreak. Mr. Speaker, now let me discuss the healthcare needs from people on the ground in West Africa, of whom I'm in touch with almost daily. But before I do, I want to acknowledge the tremendous efforts of healthcare workers, scientists, and humanitarian organizations in incredibly difficult, heartbreaking circumstances. Mr. Speaker, while there is a real push to create more treatment centers and holding beds, I also hear that there is a tremendous need for training, and particularly for training local health workers to use personal protective equipment or PPE to protect themselves. Even in developed countries, only a small number of health workers have ever used the required level of protection, sadly, as illustrated by the experiences in Spain and the United States. Training that is taking place overseas involves 3 days, plus 2 days in a ward, then regular supervision and mentoring. There are no shortcuts. Mr. Speaker, the Ebola outbreak ravaging West Africa is the most severe and acute public health emergency in modern times. Never in recent history has such a dangerous pathogen infected so many people so quickly over such a wide geographical area for so long. Mr. Speaker, it's past time that the Minister of Health, Minister of Public Safety, and Chief Public Health Officer appeared in front of Health Committee to update parliamentarians and Canadians on whether Canada is actually fulfilling its pledges on Ebola, and that equipment and money is actually getting to the people who need it most in West Africa, and that parliamentarians have an opportunity to ask ministers and officials about Canada's state of preparedness. Parliamentarians will want to ask about preparedness of Canada's ports, ports of entry, healthcare facilities, and other institutions to identify, diagnose, isolate, and treat Ebola patients in a safe and appropriate manner. Mr. Speaker, we've said from the very beginning that this is a nonpartisan issue. So in the spirit of compromise, we would like to amend our motion by replacing the words, the Minister of Health, the Chief Public Health Officer of Canada, and the Minister of Public Safety to appear before the Standing Committee on Health twice monthly with the words, the relevant minister or ministers to appear twice monthly, and the Chief Public Health Officer of Canada to appear monthly before the Standing Committee on Health. I call on all members of this House to support this motion to protect the people of West Africa so we can protect the health and safety of Canadians here. Thank you, Mr. Speaker.
Order. I just want to make sure that there was a seconder clarified on the motion. Order. It's my duty to inform honourable members that an amendment to an opposition motion may be moved only with the consent of the sponsor of the motion, or in the case that he or she is not present, consent may be given or denied by the House Leader, the Deputy House Leader, the Whip, or the Deputy Whip of the sponsored party. Since the sponsor is not present in the chamber, I ask the Liberal Whip if she consents to the amendment being moved. Agreed. Ms. Duncan, Etobicoke North, seconded by Ms. Foote, moves that by replacing the words the Minister of Health, the Chief Public Health Officer of Canada, and the Minister of Public Safety to appear before the Standing Committee on Health twice monthly be replaced with the words the relevant minister or ministers to appear twice monthly and the Chief Public Health Officer of Canada to appear monthly before the Standing Committee on Health. The amendment is in order. Questions and comments? The Honourable Member for Timmins, James Bay.
Thank you, Mr. Speaker. I listened with great interest to my honourable colleague. We're learning now that HIV first appeared in the 1920s in Kinshasa, and it circled around and it died out and it morphed and it came back and it formed again until it had reached a point where it became the virulent killer of the latter part of the 20th century. There's nothing should be surprising about what's happened with Ebola. It's appeared a number of times. The World Health Organization's been aware of it, and yet we saw this latest outbreak carrying on with absolutely no awareness, it seems, or interest from Western powers, because it was in Sierra Leone, it was in poor African countries, and now we're at a point where we're facing a potential 10,000 new cases a week. There's many recriminations we can make looking back, but this was something that was staring us in the face in terms of the need for an international response to this to prevent this pathogen from getting to the point where it is now. I'd like to ask my honourable colleague, what is it that she thinks we need to do in order to learn lessons from this to make sure, like hopefully we will not be seeing 10,000 deaths a week, but these are lessons that we seem condemned to learn again and again and again as governments don't pay attention to the importance of public health. I'd like to ask my honourable colleague what she thinks.
The honourable member for Etobicoke North.
I'd like to thank my colleague for the question. Ebola really started to increase in the spring. At that time, $100 million was asked for to stem the outbreak. In July, that number had increased to $600 million. There was a real cry for more help from governments around the world, and it was at that time I asked the government through a letter, and $5 million came. As I said, it was a very small amount. In the fall, that number was increased to $1 billion, and as of last week, that fund is only 25% funded. I have been saying since the fall that the international community and Canada must step up its response. West Africa needs more hospital units, more beds, more transportation, more labs, and they need more personnel.
Questions and comments? The honourable member for, the honourable member for Charlottetown.
Thank you, Mr. Speaker. And I thank my colleague from Etobicoke for her speech and her passion in this topic, and in many other topics in the developing world and in health in particular. At the end of her speech, she proposed an amendment to the motion, and that's the second amendment that's been proposed today, and I'd like to invite her to speak to both of them. The first amendment came from the government side. The member from Pickering had sought to amend the motion and didn't get the consent of the mover, but his amendment would allow for the ministers who are being called before committee to not come before committee, but to submit, to make written submissions. So I would invite her comments on why that amendment did not receive the consent of the mover, and why that amendment is unacceptable, and also if she could speak further to the amendment that she just put forward in terms of how does she expect that this will be able to gain cross-party support. Thank you.
The honourable member for Etobicoke North.
I'd like to thank my honourable colleague and friend from Charlottetown. Look, it is the job of any government to protect the health and safety of Canadians. We have a major public health crisis, the worst outbreak of Ebola in history. It is also the job of the government to communicate with Canadians in an open and transparent manner. That is the reason we put forward our motion to call the Minister of Health, Public Safety, and the Chief Public Health Officer in front of committee, and to do it every 2 weeks. We then heard today the government wanted to respond in writing. That is not good enough. Canadians need to see parliamentarians asking questions. Is the government prepared? Is the government prepared should a case ever come to Canada? The government has to be prepared. It is not enough to submit written communications. We have to be able to ask those questions. I have amended the motion in order to hopefully get all party support. I had questions on Ebola last week. I have families who have families back home. I know many of us do. We all need to be asking these questions to ensure West Africa's the outbreak will come to an end, and to ensure the health and safety of Canadians are protected.
Questions and comments? Question and commentaire. Resuming debate. The honourable member for Don Valley West.
Well, thank you, Mr. Speaker. I welcome the opportunity to address the Ebola crisis in West Africa and to update the House of Commons on our government's action to date. Mr. Speaker, I will be sharing my time today with the member from Elmwood, Transcona. The outbreak continues to be a very serious situation, and our thoughts are with those affected by this. Recent statements from West African researchers, scientists, clinicians, and health officials underscore the fact that families and entire villages have been shattered. Canada remains at the forefront of the Ebola response, contributing funds, expertise, and equipment to the international efforts to fight the Ebola outbreak. Our government continues to work with domestic and international partners to ensure the most effective response to the Ebola outbreak in West Africa. We also continue to take steps here in Canada to further protect Canadians right here at home. I'll start off by reiterating that there are no confirmed cases of Ebola in Canada, but Canada must be prepared for a case to come here. Provincial and local health officials are the lead on any Ebola case in Canada, but the Public Health Agency of Canada continues to assist. The Government of Canada has a number of systems in place in Canada to identify and prevent the spread of infectious disease like Ebola, and will continue to work with the provinces and territories to ensure that we are prepared to protect Canadians in the unlikely event that a case were to arrive in Canada. We also have 5 Ebola rapid response teams in place, which include epidemiologists, lab expertise to quickly confirm diagnosis, and emergency supplies from our national strategic stockpile, such as masks, gloves, and gowns. These rapid response teams would support the provincial and territorial authorities in their response should a case of Ebola occur. Internationally, we are supportive of the leadership role being played by the World Health Organization and remain committed to working effectively with them and other key partners, including Médecins Sans Frontières and the Red Cross, to respond effectively to this public health emergency. Canada has been providing financial and in-kind support of humanitarian, security, and public health measures since April to address the spread of the Ebola virus in the West Africa region. On October 17th, the government announced an additional $30 million to support international efforts led by the United Nations Mission for Ebola Emergency Response, or UNMIR, to help strengthen global efforts to stop the outbreak, treat the infected, and prevent the spread of the Ebola virus disease in West Africa. With this most recent announcement, Canada has committed a total of $65.4 million to the global efforts to support health, humanitarian, and security interventions to address the spread of the disease. Mr. Speaker, the government continues to assess the needs identified by the WHO and to explore what else Canada can do to support global efforts in response to the outbreak. As you are aware, the agency's National Microbiology Laboratory in Winnipeg is on the cutting edge of global research and testing capabilities for Ebola, and the lab recently sent a second mobile laboratory to help provide on-the-ground rapid diagnostics and testing infection control measures. In response to the World Health Organization's appeal to member states for the donation of personal protective equipment to support the ongoing Ebola virus disease outbreak response in West Africa, the Government of Canada offered to the WHO a donation of over $2.5 million in personal protective equipment, including gowns, masks, respirators, and gloves. 2 shipments have already been delivered to West Africa, in part by Royal Canadian Air Force Hercules aircraft. This personal equipment will make a difference on the ground in helping to reduce the risk of transmission and infection. The Government of Canada is also donating up to 1,000 vials of an experimental Ebola vaccine developed by the Public Health Agency of Canada to the WHO to support the response to the ongoing Ebola outbreak in West Africa. The Government of Canada owns the intellectual property of this vaccine. The vaccine is the product of more than 10 years of scientific research and innovation by Public Health Agency of Canada scientists at the National Microbiology Laboratory, and could be an important tool in curbing the outbreak. The experimental Ebola vaccine has never been tested in humans, but has shown great promise in animal research. This donation represents up to 2/3 of the total vials of this experimental vaccine currently in the possession of the Public Health Agency of Canada. The remainder will be kept in Canada for further research and in the unlikely case that it is needed for compassionate use. The Government of Canada has begun to ship 800 of these donated vials of its experimental Ebola vaccine to the WHO. The first shipment left yesterday by air from Winnipeg to the University Hospital of Geneva. The vaccine vials are being sent in 3 separate shipments as a precautionary measure due to the challenges of moving a vaccine that must be kept at a very low temperature at all times. The vaccine must be packed in dry ice and kept at -80 degrees Celsius, which is similar to the conditions required for transplanting human organs. Mr. Speaker, the Public Health Agency of Canada is supplying the vaccine to the WHO in its role as the international coordinating body for the Ebola outbreak, in the hopes that the vaccine can be made available as an international resource. The Government of Canada views this experimental Ebola vaccine as a global resource, and in the interest of global public health, we are sharing it with our international partners to help address the outbreak. The WHO, in consultation with partners, including health authorities from the affected countries, will guide and facilitate how the vaccine is distributed and used. There are both ethical and logistical challenges with the use of experimental vaccines and treatments in humans, and the WHO will need to consider those carefully before using this vaccine in this outbreak. We are mindful that the vaccine is experimental. There have only been a handful of people in the world who have received it to date. It has not yet been tested in humans for safety or effectiveness. All of that to say we expect the WHO to deploy these doses as ethically, quickly, and safely as possible. To this end, the WHO organized an expert consultation in late September to assess the status of work to test and eventually license this Ebola vaccine, along with another developed in the United States. More than 70 experts, including many from affected and neighboring countries in West Africa as well as Canada, attended this event. Participants had varied backgrounds and were able to provide expertise ranging from the virology of emerging infections to regulatory requirements to medical ethics, public health, and infectious diseases. Some participants came with more than 3 decades of experience working in Africa on other infectious diseases. In order to clarify the safety of the vaccines, the WHO, these experts, and other partners have helped to facilitate the expected evaluation of the 2 vaccine candidates in order to generate Phase 1 safety and dosage data for decision-making. A series of coordinated Phase 1 trials is currently underway, and others will soon be initiated with international partners at more than 10 sites in Africa, Europe, and North America. These trials, which are being conducted in healthy volunteers, will provide critical information about the safety of the vaccine and the appropriate dose is required to stimulate a person's immune system to produce Ebola antibodies. Results from the clinical trial are expected in December 2014. Mr. Speaker, our government is committed to supporting our international partners' efforts to control the Ebola outbreak and hopes that the experimental vaccine will be able to address this global crisis. In conclusion, Mr. Speaker, that we recognize that the Ebola outbreak currently ravaging parts of West Africa is the most severe acute public health emergency in modern times. Canada, with its partners, is well prepared and ready to support international efforts in West Africa. Thank you, Mr. Speaker.
Questions and comments? The Honourable Member for Timmins James Bay.
Thank you, Mr. Speaker. I listened with great interest to my colleague and very much interested in this very important vaccine. Of course, we don't know how effective it will be, but this could be a lifesaver for tens of thousands of people. I'd like to ask him, though, about the decision to sell the vaccine to New Links Genetics for $200,000. That seems to be an absurdly low figure. we also are seeing that questions are being raised about the ability of this company to deliver the vaccine. In fact, some international health organizations are calling on Canada to withdraw that agreement, which we have the right, apparently, and I'd like to ask my honourable colleague to confirm whether that right exists, to withdraw the rights that this company was able to get the vaccine for such an outrageously low price, so that we can get it to a larger company that can actually deliver the vaccine in a timely manner, because we are potentially facing 10,000 new cases a week appearing in Africa.
The honourable member for Don Valley West.
Well, thank you, Mr. Speaker, and I thank my colleague opposite for the question. As I stated in my speech, Mr. Speaker, the vaccine, the IP, the intellectual property of the vaccine remains the property of the Canadian government and public health. And clearly, it is important that this vaccine be tested quickly and put to work in West Africa, where it can curb the tide of this devastating disease. Obviously, this is, as I stated, the worst health crisis, the worst public health crisis we've seen in modern times, and we must be able to find a solution that will bring an end to the spread of this terrible disease. And I think that we've demonstrated that Canada, with its biology labs in Winnipeg, have demonstrated the development over 10 years of this remarkable product, and now to bring it to market after testing and hopefully final test results in December will bring an end to the spread of this disease. Thank you, Mr. Speaker.
Questions and comments? Honourable member for Etobicoke North.
Mr. Speaker, I'd like to thank my honourable colleague for the speech. I'd like to know if the government accepts that mere announcements cannot help the people of West Africa. And right now, that's largely what we have. With respect to personal protective equipment, the government auctioned gloves and masks for a fraction of what they were worth. Only 2 shipments of personal protective equipment have gone to the World Health Organization, and the government's not even sure if that equipment has reached those who need it most in West Africa. Of the $65 million pledged, and I want to point out that that money was pledged after the first case had come to North America. Why didn't we have that kind of commitment before then? Of the $65 million pledged, only 4.3 are actually are committed funding. Canada's actual financial contributions come in at 17th place. Does the government accept that commitments are not enough and we actually have to get the money, personnel, supplies to the people in West Africa who need it the most?
The honourable member for Don Valley West.
Well, thank you, Mr. Speaker, and I thank my colleague for her passion on this issue and for her question. Clearly, statements don't deliver results, and so to that end, our government has committed $65 million, but as the honourable member knows, there are processes and protocols to ensuring, Mr. Speaker, that the money gets to the place that it's intended to be used. And our government has been working with the WHO and related partners to ensure that those monies that are committed are delivered, as are the additional resources delivered to the place where they're going to be best used, best utilized, and to the benefit of those that are suffering from this tremendous health crisis. Thank you.
Resuming debate, the honourable member for Elmwood Transcona.
Mr. Speaker, I'm pleased to have this opportunity today to take part in this important discussion on the outbreak of Ebola in West Africa and a response both at home and abroad. I'd first like to highlight that there are no confirmed cases of Ebola in Canada, but Canada must be prepared for a case to come here. Provincial and local health officials are the lead on any Ebola case in Canada, but the Public Health Agency of Canada continues to assist them to ensure that they remain prepared. We have 5 Ebola rapid response teams in place, which include lab expertise, which can quickly confirm diagnosis, and emergency supplies from our national strategic stockpile, such as masks, gloves, and gowns. These rapid response teams would support the provincial and territorial authorities in the response should a case of Ebola occur. Technical guidance and protocols have also been shared with provinces and territories and with the transportation sector to detect and manage suspected cases of Ebola infection. Frontline staff have been trained to screen international travelers arriving in Canada for communicable diseases and to refer any travelers suspected of being ill to quarantine officers. However, I'd like to focus my remarks today on the availability of vaccines to prevent and combat Ebola, and more specifically, the government's role in the regulation of vaccines. A safe and effective vaccine would be an extremely important public health tool to help prevent Ebola and help prevent or contain future outbreaks. Indeed, Canadian scientists at the Public Health Agency National Microbiology Lab in Winnipeg invented an experimental Ebola vaccine that has shown great promise. And I'm very pleased to see that Canada is making up to 1,000 vials of this vaccine available to the World Health Organization, as they are best suited to determine how and where they can be deployed as safely, quickly, and as ethically as possible. On the home front, I'd like to talk about Health Canada's role as a regulator of vaccines, what it does, and how cooperation with our international partners is beneficial and vital. And most importantly, how the process would work should some of this experimental Canadian vaccine need to be used on compassionate grounds within Canada. Canada, like many other countries worldwide, exercises tight regulatory oversight over all vaccines because they are usually given to very large numbers of healthy individuals to help prevent disease. All vaccines made available to Canadians are subject to a strict approval process which is conducted by Health Canada. Health Canada is the national authority responsible for evaluating the quality, safety, and efficacy of vaccines for human use in Canada. Prior to the approval of a new vaccine, the manufacturer must file a submission with scientific and clinical evidence that demonstrates that the vaccine's health benefits outweigh the risks and that the vaccine is effective and of a suitable quality for Canadians. Clinical trials which take place in Canada must also be approved by Health Canada prior to their commencement. However, it is not necessary for trials to be conducted in Canada in order for a vaccine to eventually be authorized here. Adherence to the internationally accepted standards of good clinical practice helps ensure that clinical trials conducted in other countries meet the high standards of evidence needed to support authorization in Canada. With clinical trials, the issue is the quality of the science, not where the science is done. This is especially important in the context of the current Ebola outbreak, as the supplies of investigational products are extremely limited. Furthermore, as part of the overall approval process, Health Canada conducts an evaluation of the manufacturer's facilities to assess the quality of the vaccine manufacturing process and to determine that the manufacturer is able to carry out the necessary quality controls for the vaccine. The manufacturer must also provide samples of the vaccine for testing in Health Canada laboratories. After Health Canada's evaluation, if the conclusion is that the benefits of the vaccine outweigh any potential risks, then the vaccine is granted market authorization and can be sold in Canada. After approval, Health Canada continues its regulatory oversight by conducting a lot release program and regular inspections of the manufacturer's facilities to make sure that best practices for drug manufacturing are being followed. Potential adverse events associated with the vaccine are monitored by Health Canada and the Public Health Agency of Canada through active and passive surveillance systems. Mr. Speaker, the Ebola outbreak in West Africa is a global issue that requires a collaborative international response. Health Canada and the Public Health Agency of Canada are working in close collaboration with other national regulatory and public health authorities to respond. Ebola vaccines under consideration are at an early investigational stage of development. There are no approved interventions available at this time. Vaccines are only now starting to be evaluated for safety or efficacy in human trials for the prevention of Ebola. In addition, supplies are currently extremely limited. As I mentioned earlier, Canada has donated doses of our experimental Ebola vaccine, originally developed by the Public Health Agency of Canada, to the World Health Organization to help respond to the outbreak. While many of the potential vaccines and therapies for Ebola have shown promising results from animal studies, Evaluation in humans is necessary to confirm that these benefits are also seen in humans and that benefits outweigh the risks. This is a critical component of product development and approval. Accelerating the development and approval of Ebola vaccines requires a concerted effort by many different players, including product manufacturers, regulatory authorities, and the World Health Organization. Mr. Speaker, there should also be balance between the need to provide access to Ebola vaccines in a timely manner and the need to gather as much information as we can on vaccine quality, safety, and effectiveness. Health Canada is a member of the International Coalition of Medicines Regulatory Authorities. In September, the members of this coalition jointly released a statement on international regulatory cooperation regarding Ebola. Participating regulatory authorities pledged to join their expertise and enhance collaboration to help accelerate access to investigational products. Some of the challenges that regulatory authorities worldwide are dealing with include how to help accelerate the development and regulatory approval of Ebola vaccines and therapies, how to facilitate access to those most in need in the affected countries, and how to ensure that data on the quality, safety, and effectiveness of the vaccines are available as quickly as possible for decision-making. All of this should be done without compromising the regulatory system in place to protect the health and safety of vaccine recipients. These efforts are being led by the WHO, to whom we have donated a significant portion of our vaccine stockpile. In addition, Health Canada is collaborating specifically with other national regulatory authorities to harmonize the data requirements on the quality, safety, and efficacy of the vaccines that would be required for approval. This work is of benefit to decision makers in the affected countries in Africa, as well as to Canadians. Most importantly, there is a global commitment amongst regulatory authorities to share clinical and safety data on candidate Ebola vaccines in real time. This enables countries to maximize the amount of data available to support vaccine assessment and approval and rapidly share any information on potential adverse events following immunization. This has already started happening and is expected to help inform vaccine policy decisions worldwide. Health Canada is also a member of the African Vaccine Regulatory Forum, which is a World Health Organization initiative aimed at strengthening vaccine regulatory capacity for national regulatory authorities in Africa. Representatives from 19 African countries constitute the membership. Health Canada is using this network to provide assistance and regulatory advice to regulatory authorities in the affected African countries. Canada is also preparing in the event a Canadian needs access to a treatment or vaccine for Ebola. Health Canada has regulatory options available that will accelerate the approval process if needed to ensure the health and safety of Canadians. Let me conclude by saying that the health and safety of Canadians is paramount. Health Canada, as regulator, is working collaboratively with its national and international partners and the World Health Organization to support product development and facilitate regulatory evaluation of Ebola vaccines. Thank you, Mr. Speaker.
Questions and comments? The Honourable Member for Etobicoke North.
Mr. Speaker, I'd like to thank my honourable colleague for the speech. The UN mission responsible for Ebola response, or UNMIR, says the number of infected are growing exponentially each day, and that new caseloads of approximately 10,000 per week are possible by December 1st, meaning they need 7,000 beds for treatment. Unfortunately, the UN mission is expected to have only 4,300 beds in treatment centres by that date. More difficult still, there are no staff to operate them under current plans. The World Health Organization has been calling for more healthcare workers in West Africa. Canadians on the ground are calling for more personnel, but Canada obviously would have a duty to ensure proper medical evacuation of any of their citizens. Is the government considering more personnel, and what exploration is the government taking with respect to evacuation?
The Honourable Member for Elmont-Transcona.
Thank you, Mr. Speaker, and I thank my colleague for her question. And of course, the safety of Canadians is paramount. We talk about the safety of Canadians here in Canada regarding the Ebola crisis, and should it come to Canada, unfortunately it has not at this time, But we also must be aware of the safety of Canadians, as my colleague has mentioned, safety of the Canadians that would be deployed to Africa, and to make sure that we have ways of getting them out of the area if they do contract the Ebola virus. We need to be able to get them out of that area. We also need to have the proper safety measures in place for them as they do their work there. So those will be things that we continue to work on as a government, to make sure that our safety and the protection of Canadian citizens that are working in West Africa is also paramount, as much as the safety of the Canadians here on Canadian soil is paramount to us.
Questions and comments? Questions et commentaires? Resuming debate, the Honourable Member for Scarborough Agincourt.
Thank you, Mr. Speaker. I'm very pleased to rise today to speak in favor of the motion on Ebola that was moved by my colleague from Vancouver Centre. This is, Mr. Speaker, a motion that is very simple and frankly should be supported by all members on all sides of this House for two basic reasons. One is about public accountability and awareness. Second, Mr. Speaker, this pandemic raises, I think, the critical importance of investments in public health, including investments in global public health. Let me first start my thesis on the first point with respect to public awareness and accountability. As I indicated, there's a basic reason for supporting this motion because the public needs to know about the acute risks attached to this Ebola virus. The public basically needs to know the following. First, what is this disease? Second, what are the steps necessary to prevent the spread of this disease? And third, what steps public officials are taking to contain it? We've seen this crisis grow quickly in West Africa. And despite the fact that Ebola has existed for some period of time, this is the first time we faced a significant situation where Ebola has reached a large urban population in an area that has a highly eroded system of public infrastructure and public services, namely that in Liberia, and where unfortunately this disease can spread very quickly to epidemic proportions. As a result, Mr. Speaker, we have a collective responsibility to address this challenge quickly and aggressively, because a failure to do so can lead to much wider global implications and, frankly, can lead to global widespread panic and concern. In fact, as we've heard, Mr. Speaker, and seen in the last few weeks, cases have started to emerge in the West, including a case of a nurse being affected from Spain. And, of course, we have our 3 cases that have emerged in Texas. Even here in Canada, we are not, Mr. Speaker, immune to the potential risks of this particular Ebola virus. In Canada, we've had situations arise where patients have been isolated in communities such as Brampton, Toronto, Ottawa, and Belleville, just to name a few, with the possible symptoms of Ebola. And thankfully, so far, we have determined through testing that they have not contracted this horrible disease. But we've seen, as a result, the importance of our public health system and investing in it and making sure that we have the necessary tools so that we can identify quickly the potential that, in fact, Ebola may exist on our shores. We've also seen in the United States the director of the Center for Disease Control testify before the House committee about the possible impacts of an Ebola outbreak in the United States. And this is particularly important because the government in the United States has made public pronouncements in making sure that the public is aware of the potential consequences, an important part of its overall communications effort. Unfortunately, here in Canada, certainly as this disease was breaking out, the government unfortunately seemed to be somewhat tight-lipped about the possible consequences of this deadly disease. Now, I do want to give credit where credit is due, that I've certainly observed myself in the last few days that the Minister of Health has been much more forthright and open with her and her officials in giving out public briefings, including the public briefing that we have seen over the last couple of days, one on the weekend and one yesterday. But I think the reason why my colleague from Vancouver Centre has moved this important motion before the House is that we need to have more constant public communications from our public officials that are in charge of pandemic responses to communicate in a clear and calm fashion necessary information to the public so that they can have confidence in our healthcare system and, more importantly, confidence in our healthcare response should an unfortunate case of Ebola emerge here in Canada. This is certainly something that we have been, I think, seeing around the world. And again, I think the real rationale behind this particular motion is to encourage much clearer communication coming from those who are in the know about the situation on the ground. As you heard in the question and comments from my colleague from Etobicoke North, Mr. Speaker, we're talking about a disease that has a very high mortality rate, and that, of course, experts have been providing possible projections that could see by the end of December that we could be seeing as many as 10,000 cases, new cases emerging per week if we do not take a much more aggressive interventionist response globally to what is occurring in West Africa. And should this unfortunate circumstance arise, and where we end up with a situation where the levels of proliferation of disease hit these types of proportions, unfortunately that also consequently means that we are facing a situation that increases the risk of this pandemic, of Ebola, actually reaching us here in Western countries. And notwithstanding the fact that we probably have far superior healthcare systems to manage an Ebola outbreak here in the West, it does have profound public health and economic implications. Mr. Speaker, I am an individual who, like many Torontonians, had, I guess, the misfortune of dealing with another pandemic crisis that came up in 2003. And, of course, I am talking about the SARS crisis. And I can remember from that particular experience the profound effects that a pandemic can have on a city like Toronto and on its economy. At the time when this crisis took place, I actually happened to be working at Queen's Park at the time, so I had basically a front row seat when this crisis arose, and it had profound consequences to Toronto at the time. For example, I certainly recall that we had, when the World Health Organization imposed a travel ban on the city of Toronto after the disease came to our shores from Asia, it had a tremendous impact on tourism and as well on things like hotel visits or hotel stays within the city of Toronto. We've recently seen that particular impact taking place in the airline sector, for example, and on the impact on the Dallas economy that has occurred as a result of the more recent outbreak of Ebola that's taken place there. But what we learned, Mr. Speaker, on the local front from the SARS crisis was really, frankly, the importance of conveying clear information, frankly, to stop public hysteria. During the SARS crisis, health and government officials held daily briefings. They kept the public up to speed with the latest developments that occurred in the SARS crisis. In fact, if I recall correctly, at that time, the current president of the Treasury Board was serving as Ontario's health minister at the time, and for Canadians, it was a particularly challenging time that we were facing, and as a result of that, I think we have the benefit of that particular experience that we faced in Ontario, and particularly in the city of Toronto, and of course the expertise and the protocols that were developed by the then Minister of Health and now the President of the Treasury Board, along with his public officials, that I think help inform us today about how we should manage the Ebola crisis should we ultimately be faced with a situation here in Canada. And I think some of the things that we have heard, particularly from healthcare workers, from doctors and so forth, that we need to share some of those best practices with our provincial and territorial colleagues across the country. In fact, this morning I was watching Linda Sillis, who is the president of the Canadian Federation of Nurses Union, talk about the fact that she felt that the government of Ontario and Ontario had probably the best practices, particularly as it relates to the protocols surrounding protective equipment that need to be shared around this country and with public officials from the other 12 provincial and territorial systems that exist around Canada. We have, I think, and the federal government ultimately bears an important responsibility in coordinating that effort so that we have a unified set of protocols and systems in place should we face an outbreak somewhere within Canada. But in addition to the issue of the protocols, I also want to stress the tremendous difference that we learned from the SARS crisis of that importance of public communications, particularly by our public health officials. I think of individuals like the late Dr. Sheila Basur, who was at that time who was the City of Toronto's Chief Medical Officer of Health, and of course later subsequently became the province's Chief Medical Officer of Health. The late Dr. Donald Lowe, a microbiologist from Mount Sinai Hospital, and Dr. Colin DeCuna, who at that time was serving as our Chief Medical Officer of Health for Ontario, that gave those daily briefings. But what was critical, what was absolutely important, Mr. Speaker, was the fact that they communicated that information in a calm manner and in a manner that was easily understood by the public. And that's what I strongly want to encourage the government to do, and really I think is the basis for this particular motion, which is to educate the public, understand what this disease is and what steps we need to take to prevent it. So instead of focusing on simple photo ops and announcements for political advantage, these public health officials conveyed a critical sense of calm, presented the facts, and gave the information to the public so that they could understand how to respond to the SARS crisis. And these are important learnings that I think we need to take in respect of the situation on Ebola here today. So what we're basically urging on this side of the House is that the Minister of Health, that the Minister of Public Safety, and that the Chief Medical Officer for Canada, Dr. Gregory Taylor, provide to Canadians information necessary to take appropriate steps and precautions. And frankly, I think in so doing, we'll avoid widespread hysteria about this pandemic. So, Mr. Speaker, that's the first issue. good public communications. The second, I think, point in support of this particular motion is really the importance of investing in public health, and in particular, investing in global public health. Investments now in stopping this pandemic ultimately may save us a lot more lives and lead to a lot less significant consequences if we make investments in global public health a priority. Unfortunately, our Western democracies did not probably adequately invest in the World Health Organization, and when faced with a challenge in terms of managing its budget, focused more on the delivery of primary health care delivery than on its response for pandemics. And as a result of gutting those particular services, we're now faced potentially with the situation that we have today. And had we not, or had the World Health Organization not made some of those choices, we might be in a better situation to cope with Ebola in West Africa today. Here in Canada, this government likes to laud its investments in public health. But I want to challenge them to think clearly about what has actually sometimes happened. For example, this government chose not to renew the 10-year health accord, which was part of the Canada Health Transfer that had been brought in 2004 under Prime Minister Martin. They've also made certain other decisions, such as the elimination or the amalgamation of the Canadian International Development Agency and folding that into the Department of Foreign Affairs and Trade. And again, Mr. Speaker, makes me wonder whether, in fact, some of these choices have impacted the effectiveness of our country in delivering foreign aid since the elimination or the folding of this particular agency into DFATE. We've seen, for example, this government make announcements designed to show that they're taking action, such as, for example, their commitment for the $2.5 million for protective equipment getting to a hard-hit West Africa. Sadly, it took, unfortunately, nearly a month to get that equipment over to that region. We've also heard in this House, for example, the same thing applied to the new experimental Ebola vaccine that was developed by our National Microbiology Lab in Winnipeg. And while this is a significant achievement, a significant Canadian achievement, unfortunately, those vaccines could not be shipped until recently to Africa because we couldn't find a plane to get the vaccines over there. I contrast that, for example, Mr. Speaker, to something I raised in question period, that this government, however, managed to find an Airbus on short notice to fly EU delegates to Brussels as a result of celebrating its Canada-EU free trade agreement. So, to some degree, I question the government's priorities in terms of dealing with this pandemic crisis that's taking place in West Africa. Mr. Speaker, let me simply summarize by highlighting the two really important considerations that I think are necessary in support of this particular motion. Again, first, it's an importance and a clarity and a need for clear public communications. Second, we need to rethink our position and our importance in investing in public health, including investing in global public health. We need to reassure Canadians that we are doing all that needs to be done. And this can only be done through clear and consistent communications. Finally, we need to understand that there are clear consequences for eroding our public health capacity and leaving our public institutions unable to meet their fiscal challenges, including meeting our obligations under our national public health system. Mr. Speaker, it's very much like taking an annual fiscal checkup. It's better to spend a little money on preventive health measures than to avoid costly treatment down the line. Mr. Speaker, we are right now facing and witnessing today a crisis of global proportions, and we in Canada need to do our part, because either we invest now or we will pay later, where the price, in fact, will be much more dear. Mr. Speaker, we've much to learn. We've learned much from our SARS crisis in 2003, and I strongly urge the government to take that experience forward as we address this particular issue here today. Thank you, Mr. Speaker.
Questions and comments?
Thank you, Mr. Speaker. I listened with great interest to our honourable colleague. I think what's frustrating with the debate that we're having today is there's nothing surprising that Ebola would have hit in the way that it did. We saw numerous patterns of this disease starting and stopping in Central Africa. The World Health Organization has been aware of this, and yet when we saw the latest outbreak begin, there seemed to have been a lack of political will or interest in the larger Western powers who could have brought aid at the very beginning. And now we're in a situation where we're facing the possibility of 10,000 new cases a week in West Africa, and I'm certainly hoping we don't reach that number. But I'd like to ask my honourable colleague about the fact that the need for a coherent international health strategy has been known for decades. We've seen this with outbreak after outbreak, and we see the consequences of the failure of governments to act, and this could certainly be another wake-up call for us. But I'd like to ask my honourable colleague what he thinks is at the root of the fact that it seems that the Western governments have dropped the ball, that they're not paying attention on the need to do the preventative work and to spend the money that in the short term maybe seem costly, but it will be much cheaper and much more beneficial for humanity if we spend it in the prevention rather than now scrambling as we are at the 11th hour and dealing with an outbreak that has really gotten out of hand.
The honourable member for Scarborough Agincourt.
I want to thank my honourable colleague from Timmins James Bay for his question, and I simply can't agree more. I think to sort of address the roots of his question is really a function of where I think a lot of Western democracies, our government included, have to some degree lost a significant amount of faith in our international organizations like the United Nations, like WHO, and as a result have been somewhat more parsimonious in terms of its willingness to contribute funds and investments in global public health than might have taken place in the past. And I think we're beginning to see what the consequences of that clearly are. I certainly highlighted that in my speech. That things like what's happened in the World Health Organization and its pandemic response capacity has been significantly eroded because of the budgetary challenges that they're facing. But again, I think it gets right down to a fundamental choice that governments need to make. Are we going to make those investments now, or are we simply going to pay the price later?
Questions and comments? The honourable member for Vancouver Centre.
Thank you very much, Mr. Speaker. I want to thank my colleague for an excellent speech. He has laid out the problems very clearly. And I think, again, I would like to ask him a question, and I think it's this. We've seen that this quote-unquote epidemic started in September. There were outbreaks of Ebola. Then the World Health Organization didn't pay attention. Then it worsened in December. It wasn't until April that our Canadian government even began to pay attention, and they gave about $1.2 million to start off. The problem here is that this has come to the place where it is now because people have dragged their feet. We talk about SARS. We didn't learn anything from SARS, obviously, because we continued. Timeliness of response in a public health crisis, in any epidemic, is key. There was no timely response here from our government. Yes, I commend the Minister and the Chief Public Health Officer for standing up on Friday and this week on Monday and telling us kind of a bit too little too late, because the problem is we need to contain the problem as soon as it begins to happen. So I would like to ask the honourable member if he thinks that this particular motion that we've just brought today is out of line, or is it because we have seen everyone drop the ball over the last few years that we have begun to decide that we need to have some clarity and some transparency around public health?
The honourable member for Scarborough Agincourt.
I want to thank my my honourable colleagues from Vancouver Centre, frankly, first for bringing this motion before the House today for its consideration, and for her leadership in advancing public health, and frankly in her role as a physician. Again, I happen to, Mr. Speaker, to have a brother who actually practices in the area of global public health. Although he right now serves as a pediatrician in St. John's, Newfoundland, he's the clinical chief there. He spent a significant part of his career in places like Africa, focused on trying to get to the roots of in his case, in childhood health, but trying to deal with the very basic infrastructure investments that are necessary to avoid the outbreak of these kinds of global pandemics. As I said, you either make the investments now or you make the investment, you pay the price later. And very small, simple investments in basic public health infrastructure, clean water, a basic capacity of healthcare systems, those investments now can avoid the potential of greater emergence of these types of issues today.
Questions and comments? Questions and commentaires? L'honorable député de Hochelaga.
The Honourable Member for Hochelaga. Thank you, Mr. Speaker. My colleague from Vancouver East sent a letter to the Minister asking her all types of questions. For example, who is responsible for watching over the quarantine and health safety protocol measures? What are the responsibilities of hospitals? She asked questions about screening protocols at entry points in Canada, and these are all questions that we need to get answers to. And I was listening to a report this morning on CBC where a doctor talked about a wave of panic throughout the Canadian public, and there's an article here called
"Coverage of the Outbreak Causing Undue Fear and Panic."
So I'm wondering if my colleague thinks, I think that he agrees with me, that there's not enough information out there, despite what the parliamentary secretary said. So we need much more information to ensure that the Canadian public is sure that it is protected against this virus.
The honourable member for Scarborough Agincourt.
I want to thank my honourable colleague for the question. To even answer that, I think if you look at the motion that's before the House today, I think it's actually a fairly modest motion. We're asking for simply the Minister of Health and the Minister of Public Safety and the Chief Medical Officer of Health to come once every 2 weeks to inform parliamentarians. But I think they have the broader, you hit it on the nose, they have the broader obligation to inform Canadians about the seriousness of this disease and to convey a sense of first, most importantly, clear information, clear steps for prevention, and what we will do should there be ultimately an outbreak in here, and how our healthcare system will handle it. I think they're starting to make some of those steps, but the point you raise is absolutely correct, and they need to do it more frequently.
Questions and comments? Resuming debate. The honourable member for Vickerville Wainwright.
Thank you very much, Mr. Speaker. Mr. Speaker, I'm very pleased today to have this opportunity to address the Ebola crisis in West Africa and to talk a little bit about our government's response to that to date. I want to note from the start, though, that I'll be splitting my time with the honourable member from Mississauga East Cooksville. I start today by expressing heartfelt sympathy to all of those affected by the Ebola situation in West Africa. Although the outbreak is taking place beyond our borders, Canada is committed to playing an important and valuable role and part in the global response, as well as engaging in extensive preparedness measures at home to protect Canadians. There are no confirmed cases of Ebola in Canada, Mr. Speaker, and I think it's important to stress that, but it's also important to stress that we must be prepared in case we actually have an Ebola situation here in Canada. Provincial and local health officials are the lead on any Ebola case in Canada, but the Public Health Agency of Canada continues to assist them to ensure that they remain prepared. On August 8, 2014, the World Health Organization declared the recent outbreak of Ebola in West Africa a public health emergency of international concern. The World Health Organization also determined that a coordinated response from the international community is required to prevent further spread of the disease. Effective response and management to this emergency requires a rapid diagnosis, good infection control practices, and tight coordination amongst partners, Mr. Speaker, of whom, of course, Canada is a very important one. From the outset, our government has been at the forefront of the international response to this Ebola outbreak. Canada is working with other countries and with our international organizations, including the World Health Organization, to assist in the overall response to this public health emergency. Canada should be proud of its support to address the spread of Ebola in West Africa. Canada has contributed more than $65 million in support of humanitarian, security, and public health interventions to address the disease in West Africa. This funding is being used to improve prevention efforts across the affected regions, including social mobilization and health education to prevent the disease from spreading further, Mr. Speaker, and this is very important work indeed. Canada has been on the front line of the response efforts since June, has been providing world-leading laboratory expertise to help in West Africa. The Public Health Agency of Canada recently deployed a second mobile lab team to West Africa to assist in the Ebola outbreak. The lab and the 3 additional scientists from the agency are joining the agency's existing team in the field in Calhoun. One mobile lab team will continue to provide rapid diagnostic support to help local healthcare workers to quickly diagnose Ebola. The second mobile lab team will work with our Doctors Without Borders to take samples of the healthcare environment to help determine how Ebola continues to spread. There's a lot to learn about this disease still, Mr. Speaker. This information will be invaluable in helping end the outbreak. Both teams have the capacity to quickly deploy to other areas in and out of the country to provide support if required. On-site laboratory support produces results in only a few hours, which in turn allows for faster isolation of Ebola cases and patient care. It is pivotal to an effective response, Mr. Speaker. We know that some healthcare workers have become infected. This is a key reason behind the work of the second mobile laboratory sent from Canada. Scientists are looking for explanations relating to the working environment of all those trying desperately to help in difficult conditions. We are very proud of the efforts of the agency's employees, and of course, we want to ensure their safety as much as is possible. Employees on the ground have been well trained in preventative and protective measures. Nevertheless, if there is any doubt as to their safety, we will take every measure to evacuate them on medical grounds in a timely manner. Mr. Speaker, protective equipment is absolutely vital in helping to prevent the spread of Ebola. In response to the World Health Organization's appeal to member states for the donation of personal protective equipment to support the ongoing outbreak response in West Africa, the government recently made available for donation more than $2.5 million in personal protective equipment. This includes gowns, respirator masks, face shields, and gloves, and are of great need in the affected area, Mr. Speaker. These efforts offer much-needed assistance to workers on the front lines and to ensure the health and safety of workers. We're proud to support the international partners to help stop the spread of this disease. On the testing front, the agency's National Microbiology Laboratory has also been very active. Laboratory diagnostic materials to support testing has been provided to other African countries such as Nigeria, Sierra Leone, Senegal, Liberia, Cameroon, the Central African Republic, Cote d'Ivoire, Gabon, Ghana, Guinea, Kenya, Madagascar, Algeria, and Uganda, Mr. Speaker. The NML has also shared its expertise and materials with the Caribbean Public Health Agency in Trinidad and Chile as part of the worldwide effort. Here at home, the health and safety of Canadians has always been and continues to be a top priority, Mr. Speaker. Well, there's never been a case of Ebola in Canada. The government remains vigilant and is taking concerted action at home to ensure Canadians are protected against the Ebola virus in the event that a case were to appear here at home in Canada. The Public Health Agency of Canada was created in response to SARS to enhance Canada's preparedness to respond to situations just like the one that is before us today, Mr. Speaker. As a result, Canada is more prepared to address infectious disease risk today than ever before, in spite of what many opposition members have been incorrectly saying, Mr. Speaker. As a result, Canada is more prepared to address the agency works in close collaboration with the provinces and territories, Mr. Speaker, who are the lead in any response, and all interested parties to address infectious disease risks. Canada's healthcare system and frontline medical staff are well prepared to deal with the identification and treatment of diseases. In Canada, hospitals have sophisticated infection control systems in place that are designed to limit the spread of infection, protect healthcare workers, and provide state-of-the-art care for Canadians right across the country, Mr. Speaker. The agency's National Microbiology Lab has been working with provincial and territorial labs to increase their capacity to test the infectious diseases, and recently in particular the Ebola virus. This further improves Canada's ability to identify Ebola quickly so the right steps can be taken, Mr. Speaker, to protect the patient and the community. Canada has the capacity to respond and manage ill travelers. The Quarantine Act, which was introduced to prevent the introduction of infectious or contagious disease into Canada, is administered 24 hours a day, 7 days a week, Mr. Speaker, 365 days a year. Canada requires travelers to report to a Canada Border Services Agency agent if they are ill upon arrival in Canada. Frontline staff at the Canadian Border Services Agency and Transport Canada are also trained to screen arriving international travels for signs and symptoms of infectious disease, Mr. Speaker. Any travelers showing symptoms are referred to quarantine officers from the Public Health Agency of Canada for follow-up, Mr. Speaker. So, in fact, Canada is well prepared. In conclusion, Mr. Speaker, our government has taken steps to assist the people of West Africa and will continue to monitor the situation closely. We've also taken action to prepare for and protect Canadians against infectious disease threats. Mr. Speaker, our government, I think, has been on top of this from the start, and Canadians should take pride in the way this has been handled. And again, Mr. Speaker, I remind Canadians not a single Ebola case in Canada to date. Thank you very much, Mr. Speaker.
Questions and comments? The Honourable Member for Vancouver Centre.
Thank you very much, Mr. Speaker. I think what we're hearing is what we already know. This is what we heard from the Minister of Health and the Chief Public Health Officer on Friday, with an update yesterday on Monday. The gist of this motion isn't that. It is to ensure that we get some questions answered about some really important problems. this government only put in a little over $1 million in April. And this was well after Ebola had been going on for quite a while. We have to admit that the World Health Organization dropped the ball and didn't take it seriously either. But we came on in April. We now have been told by this government that they've put $65 million in all into helping the regions that are affected. Yet we only see that 4.3 million of that money has actually been spent, or has actually been sent, or has actually been given or committed. Where is the rest of the money? Timeliness is important. I'd like to get some answers about why the foot dragging. That's what I'd like to get some answers on.
The honourable member for Vegreville Wainwright.
Well, Mr. Speaker, I see two fundamental differences between this member and members of the Conservative Party. First is that although this member has said that she wouldn't make this issue a partisan issue all day from members of the opposition from both parties, I have heard partisan comments, and that's shocking with a situation like this, Mr. Speaker. The second fundamental difference is that this government will not spend money until they know the money is going to be spent effectively. That is different from what the past governments did, Mr. Speaker. So all of the money hasn't been spent because, simply put, all of the different conditions that have to be put in place to make sure it's actually going to do some good aren't there yet. So as time moves on, as the situation changes, as the international agencies do their job better, then our government will provide what's needed to make sure that we deal with this situation and spend the rest of the money in an effective way, Mr. Speaker.
Questions and commentaires.
Questions and comments. The honourable member for Laurier-Sainte-Marie.
Mr. President and Mr. Speaker, sorry, it's my French coming up. Mr. Speaker, and I hear my colleague saying that Canada has taken steps to help the people in West Africa. Unfortunately, Mr. Speaker, it's baby steps. And what we need now is leaps and bounds. And given the latest comments of that we'll wait to make sure and check and this before providing the necessary resources to very well-known and recognized organizations such as Médecins Sans Frontières, the International Red Cross, the Canadian Red Cross, the World Health Organization. Does he realize that with every day we wait, the cost in terms of human lives and in terms of money is just increasing exponentially? So by waiting to spend $10, we will be faced with a bill of $100. Does he realize that? Thank you, Mr. Speaker.
The honourable member for Vegreville Wainwright.
Yes, thank you, Mr. Speaker. You know, Mr. Speaker, if the member had listened to my speech and to speeches before mine, she would know that Canada, in fact, was on the top of this from the start. We provided, Mr. Speaker, protective equipment to those who are using this, who need this protective equipment in Africa. We provided laboratory results and laboratory expertise. We provided vaccine to try to help prevent new cases from developing, Mr. Speaker. We've done a lot of things, and we've committed $65 million, Mr. Speaker. We're a world leader in that regard, and that money will be spent, not just quickly, so you can say you spent the money, Mr. Speaker, but it's really important that it's spent to actually do the job of helping to deal with the terrible situation in West Africa and to prevent a future disease and to prevent spread here to Canada and elsewhere around the world as much as is possible, Mr. Speaker. So we believe in spending money wisely.
Resuming debate, the honourable member for Mississauga East, Cooksville.
Thank you very much, Mr. Speaker. And I welcome the opportunity, Mr. Speaker, to speak about the motion from the Liberal Party on the outbreak of the Ebola virus. And I'll be using my time to talk about what our government is doing to keep Canadians safe, specifically at our ports of entry. While there are no confirmed cases of Ebola in Canada, Canada must be prepared for a case to come here. Provincial and local health officials are the lead on any Ebola case in Canada. But the Public Health Agency of Canada continues to assist them to ensure that they remain prepared. We all have taken notice of the advance of Ebola in West Africa and have followed its spread in that part of the world with great concern. We understand the toll this has taken in the affected countries, and we offer our support to the victims of the disease, their families, and the healthcare workers who are on the scene dealing with this horrible situation. To date, Canada has committed over $65 million to the global effort to address the spread of the disease in West Africa. In addition, we have financed the deployment of humanitarian and medical experts in support of the International Federation of the Red Cross and Red Crescent Societies, as well as United Nations humanitarian operations. These are just some of the actions we are taking to address this outbreak. Mr. Speaker, we take the potential spread of the disease very seriously, and we must rely on the advice provided to us by public health officials who've told us that the virus does not spread easily from person to person. It is not spread through casual contact. It is spread through a direct contact with an individual with symptoms. It is worth underscoring that Canada is well prepared should an Ebola case arise here, though I must stress that there has not been no cases of Ebola in Canada to date. That said, Mr. Speaker, our government is taking all appropriate precautions to keep Canadians safe and to prevent Ebola from reaching our shores. The Public Health Agency of Canada is the lead government agency responsible for monitoring and screening travelers for the Ebola virus. In doing so, PHAC is working closely with the Canada Border Services Agency to identify travelers arriving in Canada with symptoms of Ebola virus or any communicable disease for that matter. It is a part of CBSA responsibilities to provide the full suite of border services that support public security and safety priorities. Mr. Speaker, CBSA officers who work at our ports of entry are designated as screening officers under the Quarantine Act. As such, they have received training on how to respond to a traveler displaying the symptoms of illness. With respect to the current outbreak, CBSA officers, at the recommendations of the Public Health Agency, are directing all travelers arriving in Canada from whose travel itinerary included Liberia, Guinea, or Sierra Leone to secondary examinations for more detailed questioning. CBSA officers are also taking all travelers entering Canada if they have traveled to one of the affected West African countries or been in contact with someone who has, and they also ask travelers if they've been exposed to someone suspected of being infected with the Ebola virus. However, once they've answered these questions, all travelers from these regions will be automatically referred to a quarantine officer for further questioning and examination. This is how the CBSA is working collaboratively with the Public Health Agency in enforcing the Quarantine Act to ensure the safety of Canadians. In cases where a referral for health reasons coincides with a referral on an immigration or custom matter, the referral on the quarantine to the quarantine officer takes precedence. Once cleared by the quarantine officer, any other potential reason for secondary questioning will be taken at that time. The health concern, Mr. Speaker, is the #1 concern for these travelers. In addition to this specific questioning of travelers, CBSA officers are acting under usual health screening protocol with even greater care and vigilance. As part of the regular screening, officers are looking for travelers with signs of illness as they approach the primary inspection lane. CBSA officers are referring any travelers displaying disease symptoms to the Public Health Agency as quarantine officers, as per usual protocol. Mr. Speaker, along with the extra care being taken at our international airports, the CBSA is also monitoring marine vessel traffic from the affected areas. All vessels are required to supply a maritime declaration of health 24 hours prior to arrival in Canada. The CBSA reviews the declaration, and if there is an illness on the vessel reported, The information is conveyed to the public health agencies' quarantine officers for their actions. Mr. Speaker, I would like to say again that while we are monitoring the outbreak of Ebola in West Africa, Canada is well prepared. Canadian hospitals have sophisticated infection control systems and procedures in place that are designed to limit the spread of infection, protect healthcare workers, and provide the best possible care for our patients. The Public Health Agency meets regularly with colleagues in the provinces and territories to share information and data and to update and distribute guidance documents on Ebola, including for healthcare workers to help detect and respond locally. Examples of these guidance documents include infection prevention and control measures for borders, healthcare settings, and self-monitoring at home, interim biosafety guidelines for laboratories handling specimens from patients under investigation for Ebola virus disease, and environmental sanitation practices to control the spread of communicable diseases in passenger conveyances and terminals. To date, there have been several patients with Ebola-like symptoms in Canadian hospitals, but thankfully none tested positive. And we know our testing is a global gold standard. We also have 5 Ebola rapid response teams in place, which include epidemiologists, lab expertise to quickly confirm diagnosis, and emergency supplies from our national strategic stockpile, such as masks, gloves, and gowns. These rapid response teams would support the provincial and territorial health authorities in this response should the case of Ebola occur. I would also point out that the Public Health Agency and the Department of Foreign Affairs and International Trade have noted in travel advisories that Canadians should avoid all non-essential travel to Guinea, Sierra Leone, and Liberia. The Minister of Health also highlighted that the Department of Foreign Affairs is advising that Canadians in these countries should return home immediately while commercial options remain available to them. Even so, we are taking additional precautions at our ports of entry to help ensure this terrible disease does not reach our shores. The Public Health Agency of Canada and the Canada Border Services Agency are taking proactive measures to help keep Canadians safe. The CBSA's Border Operations Center is providing officers with the latest information through regularly updated bulletins so they can act accordingly. CBSA officers are working 24/7 to protect the border against this threat. Mr. Speaker, for over 10 years, the CBSA has been on Canada's front line, keeping our country safe from threats. The men and women of CBSA are dedicated, well-trained professionals who exercise their responsibilities with utmost care. Yes, the outbreak of Ebola in West Africa is a cause for concern, but with the efforts being taken by the Public Health Agency of Canada, the Canada Border Services Agency, and other government departments and agencies, we have the people in place ready to detect and respond quickly if necessary. The situation abroad is serious, but it is in hand here at home. Whatever our political affiliations are, I think we can all applaud the work of the Canadian Border Services Agency and the Public Health Agency of Canada, who work on the front lines to keep us and all Canadians safe. Thank you, Mr. Speaker.
Questions and comments? Questions et commentaires? Resuming debate, the Honourable Member for Winnipeg North.
Yes, thank you, Mr. Speaker. It's with pleasure that I actually rise today to talk on what I believe is a very important issue. It's an issue in which the Liberal Party already, since the session has begun, has had the opportunity to raise on numerous occasions. We brought forward this motion believing that the government would be, in fact, open to the need to have better communications with all Canadians through having biweekly or two meetings every month, Mr. Speaker. Canadians want to have a better understanding in terms of what's taking place, what, in fact, the government of the day is doing to be able to deal with this particular virus. It's important that we recognize that the Ebola virus is a severe and far too often, Mr. Speaker, leads to death. And if we put it in the perspective of time, it started really back in September 2013 when we started to first see some cases coming to light. By the time we rolled into December 2013, the world started to recognize that this is a very serious, growing issue, Mr. Speaker. And the Government of Canada then recognized, even though there were a lot of signals in terms of the need for Canada to get more engaged, the government in Canada actually acknowledged its involvement and interest in the issue back in April of 2014. And at the time, as the critic for the Liberal Party has talked about, Mr. Speaker, invested, I believe it was just over $1 million in regards to this particular file. We need to recognize where it originates from and the costs that have been there, Mr. Speaker, as a direct result from West Africa. So the motion that we have today, I would argue, is exceptionally timing, good timing. And I'm encouraged in the sense that the government seems to be receptive to voting in favor of what the amendment is proposing to do. And if, in fact, they do end up voting in favor of it, Mr. Speaker, I would give them a compliment in recognizing what we have been calling for, and that ultimately is more a sense of accountability and, most importantly, a more timely display of information for Canadians to get a better understanding in terms of the impact that Ebola is having, not only here in Canada as a potential threat, but what's happening around the world, in particular in West Africa and a number of specific countries where many thousands of people have actually died because of this virus. Mr. Speaker, if I may, I'll just read what the motion actually states. And I'm going to go with the amendment because the amendment actually captures the essence of our motion, and it was further amended, Mr. Speaker, by replacing the words the Minister of Health, the Chief Public Health Officer of Canada, and the Minister of Public Safety to appear before a Standing Committee of Health twice monthly, with the words the relevant minister or ministers to appear twice monthly, and the Chief Public Health Officer of Canada to appear monthly before the Standing Committee on Health. Mr. Speaker, I believe in good faith the Liberal Party has worked in cooperation with the Conservative government to try to come up with a motion that in essence captures the principle of what it is that the Liberal Party was wanting to see, and ultimately coming up with an amendment that we could support and endorse, Mr. Speaker. So, I'll ultimately wait and see how things transpire in terms of a vote, but I do expect that the motion will, in fact, pass. And ultimately, I think it makes a very strong statement in terms of what it is and how it is that members of this House and from my perspective within the Liberal Party caucus has been approaching this issue. We want, Mr. Speaker, very much to put the party politics to the side, and we showed that in the sense of working with the government to come up with something in which they could ultimately support. What we have been pushing for, Mr. Speaker, is within this motion is to ensure that the government, in particular some specific ministers, the Minister of Health, the Minister of Public Safety, there's other stakeholders that are out there within the different ministries that might also want to participate in this. But at the very least, we recognize those two ministries as ministries that need to be able to come before a standing committee in order to make reports twice a month. Mr. Speaker, along with, of course, the Chief Public Health Officer of Canada. By doing that, what we're really doing, Mr. Speaker, is we're calling for this standing committee, and through the standing committee, the opportunity for the ministers and the staff in question to be able to appear before the committee over a number of hours twice a month, where they can provide an update in terms of what is actually taking place and what Canada is doing currently, and what it is that we hope to be able to contribute to the fighting of this brutal and deadly virus, Mr. Speaker. So this is ultimately what we wanted to see, and it would appear as if there is a very good chance that that's in fact what we will be getting. And we look forward to seeing the committee, or ultimately the vote in the committee, actually designating some days as to when these first meetings will in fact occur. Mr. Speaker, we talked about West Africa. There's been a lot of discussion. Members have commented on West Africa at great length. For me, just very briefly, I just highlight that that's where we know that the virus came into being in this situation, where literally it's been estimated as high as, from what I understand, somewhere in the neighborhood of 10,000 individuals that have been identified, or as high as 10,000. There's just over 4,000 fatalities, from what I understand, Mr. Speaker, which clearly shows just how deadly of a virus this can be. Different nations in West Africa have a different approach. I've heard a lot about the infrastructure, our healthcare infrastructure. And we need to recognize that there is a substantial difference in healthcare infrastructure if you take a look at a country like Canada versus a country in West Africa, Mr. Speaker, where we have seen this virus grow and become such a deadly force. So we need to emphasize a lot of the discussion on the infrastructure of healthcare resources. When we talk about that infrastructure, what are we really talking about? It's issues as simple as having gloves, healthcare professionals being able to, and volunteers to be able to have some of the basics, such as gloves. I've heard comments in regards to running water. These are things in which virtually every healthcare clinic across Canada has. That's just an absolute given. But in many of these third world countries, Mr. Speaker, that is a given that's just not there. They don't have the gloves in the running water. What about issues like isolation rooms, facilities, in areas where you don't even have adequate lighting in order to be able to deal with it, Mr. Speaker? There's issues surrounding needles. And the list is actually fairly lengthy in terms of one that one could actually talk about in terms of the actual need. And many of these third world countries that are so harshly affected by this particular virus, there is a huge shortage, and the demand is truly amazing in terms of what needs to take place in order for many of these countries to be able to deal with this outbreak. There have been some cases of success. My colleague, member from Vancouver, the Liberal Party health critic, made reference to Nigeria. Nigeria had a plan, and it would appear, Mr. Speaker, to be working. I believe she had mentioned it was 42 days now since there has been a case that has been detected, Mr. Speaker. That's important to recognize, that there is reason for us to have hope, even in countries where that healthcare infrastructure is in great need. And Nigeria has actually demonstrated fairly clearly that we can, in fact, have hope if, in fact, we can develop a plan. And a plan is of the utmost importance, Mr. Speaker. And I suspect that if we take a look at what went well in Nigeria, what we would find is that the government, with the assistance of other organizations, were very successful at communication and education. They made sure that the public had an understanding of what was actually taking place, what the Ebola virus was, what sort of symptoms are seen if someone captures the virus or is infected by the virus. You could be infected by the virus today and 2 weeks later have no idea that you were actually infested with the virus. It could take 21 days before you could start to see some symptoms. We need to recognize that the world is, in fact, a small place. You know, I've heard comments that you can't get a direct flight, quite possibly, from some of these countries in question coming to Canada. But it doesn't take a direct flight. Someone that's coming from a country where there's a higher risk, or where there's infections that are currently there, could very easily transfer from one plane to another plane and ultimately end up in Canada. And it's not to say that Canadians have to be overly fearful. We're not suggesting that at all. We don't want the Canadian population to get panicked over the issue, Mr. Speaker. But we want the government to start talking a lot more about what it is and what their plan is going forward, Mr. Speaker. And this is what the challenge really is for this government. That if you take a look at it, throughout Canada, we have provinces, we have territories, we have First Nations. There is a great deal of coordination that needs to take place. You know, it's not a question of if, it's a question of when these types of viruses will, in fact, at some point in time, ultimately arrive in Canada. And hopefully, Mr. Speaker, that we're able to avoid the Ebola virus. That would be a wonderful thing. And I don't think that there's anyone inside the House of Commons today that would disagree with that. But Canada does have a lot to play in terms of world health. But we also have to ensure that Canada itself as a nation is ready and capable to be able to fend off a virus of this nature. We have some of the very best scientists in the world. In fact, in Winnipeg, we have the high-tech lab, which is located on Arlington, just south of Winnipeg North, the riding in which I represent, Mr. Speaker. That's our national microbiology laboratory. It is actually responsible for the identification, control, and prevention of infectious diseases, and has played a very important role in terms of the Ebola virus that we have today in Africa, in helping being able to save lives. We have some brilliant minds in Canada. And, Mr. Speaker, we have different departments in different provinces that have done some amazing work. We have some great stakeholders, associations that are out there that have also done some amazing work. You know, I think of organizations such as the Doctors Without Borders. The role for the federal government is that of leadership. And by leadership, what I mean is that at the end of the day, they need to recognize that we have all of this expertise throughout our country and in certain ways outside of our national borders. And they have to be able to take note of that expertise and ultimately act on it where they can. And that's what it is and why it is, in good part, we believe, by having the minister coming before a standing committee where you get more questions and answers related to the Ebola crisis, that is a positive thing, Mr. Speaker. I would like, for example, to know from the government to what degree it has been in contact with provincial ministries of health. You know, a number of years ago, I've had the opportunity to have in-camera type of discussions with the provincial Minister of Health related to healthcare crisis in the province of Manitoba. And I know Manitoba in itself has a protocol. I heard other members talk about the province of Ontario and how progressively that government is moving forward in terms of doing what it can to protect its population. There's very little doubt in my mind, Mr. Speaker, that you will find some provinces have likely done a little bit more, and it could be because of simply of treasury boards, the size of purse that they have, the type of scientific work that's being done within that province currently, that there is no doubt a huge need for the Ministry of Health nationally to be working with the provincial entities so that there is one protocol for all of us. And yes, there will be situations where there will be some uniqueness to it, but establishing a protocol is very important. I've had the opportunity to talk about protocols in the past while I was an MLA. And we need to understand that there are certain people in society that are put at a greater risk than others because of viruses of this nature. A few examples: in any given province, you have a hospital facility. What happens in regards to nurses and doctors if something were to break out here in Canada? You know, I made reference to aircraft travel. We have border control officers, Mr. Speaker, that are manning or being at our borders, at our airports, wonderful individuals, and what sort of protections are being put into place for them. The point is that there is a litany of questions that oppositions and even government backbenchers might have that affect their own communities, their own capital infrastructures, Mr. Speaker, and those questions can often be put in the form of a standing committee. But more importantly, it provides the Minister of Health, our Chief Public Health Officer, and other ministers to become before the committee and through the committee explain to all Canadians in a very public and open way what is actually happening on the Ebola front. How is Canada contributing to the betterment of world health? Canada does have a role to play, Mr. Speaker. We all know that. And there is a huge expectation that we will demonstrate strong leadership, Mr. Speaker. That's something in which the Liberal Party wants to see. A strong leadership coming from the government showing that we truly do care about this virus and the thousands of people that it is affecting throughout the world. We also need to hear from the Minister of Health and Public Safety in terms of how Canadians are being protected. What about the issue of the vaccine, Mr. Speaker? And how important it is that if there is something that comes in Canada, that Canadians do not have to worry in fear because the Canadian government is in fact doing what it needs to do. And this is why, if I can conclude, Mr. Speaker, why it is that I believe that this is a motion that should receive the support of all members of this House, and I look forward to the government's vote. Thank you.
Questions and comments? The honourable member for Kelowna Lake Country.
Well, thank you, Mr. Speaker. I'd like to thank my honourable colleague across the way for his comments on this very important issue. Like himself and all Canadians, very concerned about the Ebola outbreak in Africa, and we have the assurance of the public health Officer in the Agency of Canada, that they're working very closely with our provincial and territorial ministers and World Health Organization, and been on the leading front. I know I'm Minister of Health, Minister of Public Safety, Minister of Foreign Affairs, and other officials have been working closely as well with the colleagues to ensure that everything we can do to help bring this disease to a containment and quickly as possible is accomplished. My question, Mr. Speaker, for my colleague across the way, I think it's the best use of our public health officials' time to be sort of forced to come to listen to and these public meetings and spend time in Parliament Hill when they should be actually focusing on working on a resolution and helping Canadians and disseminate this information through national press conferences and working with our provincial and territorial meetings. Do you think that's the best use of their time? Thank you, Mr. Speaker.
The honourable member for Winnipeg North.
Absolutely, Mr. Speaker. This is something in which they should be mandated to do. It is all about communication. And the government has a role to play by allowing standing committees to be able to meet, to have the Minister of Health be able to present her case in this situation as to what it is that the government is doing. It provides the opportunity for opposition members to be able to bring forward their ideas and their thoughts. You know, there's ways in which we can actually cooperate together to make our communities a safer place to be, not only here in Canada, but also, Mr. Speaker, I would suggest to you, in the world. I have experience in terms of my own province of Manitoba, and I would welcome an opportunity, and I know there would be a high demand. After all, we're only given one spot on that particular committee, but I think that there's members of the House of Commons have a lot to contribute, and the Minister of Health and others would benefit by that contribution, and so will the Minister of Health benefit by being able to explain things, Mr. Speaker, to the public through the committee.
Time for one more short question. The honourable member for Timmins, James Bay.
Yes, Mr. Speaker. I think the question in terms of how we got here, we know how quickly the international community responds when we have H1N1 start to appear. And yet in Africa, where we've seen Marburg virus, we saw HIV that apparently had been in Kinshasa since the 1920s. We're looking at Ebola and the lack of the international response, the fact that there were only 51 doctors in Liberia, most of them who have died from Ebola, that there's got to be an awareness that just because it's in Sierra Leone, just because it's in Liberia, does not mean it's not going to affect us. That if we do not have the investments in international health, that if we do not have international development, and if we do not have a strong WHO involved with all the Western powers to support medical teams in Africa, these kind of crises will continue. And I'd like to ask my honourable colleague, are we in this Parliament willing to look at the big picture and the failure of the West to deal with the incubation of these pathogens in Africa and provide the kind of support?
Order. The honourable member for Winnipeg North, 1 minute answer, please.
Yes, Mr. Speaker, I think it's the reason why we have this debate here today is because I like to think collectively, I can assure you, from within the Liberal Party, really believe that Canada has a leadership role to play in fighting this virus. There is a moral obligation. We have some of the brightest minds in the world and some of the very best laboratories in the world that can help fight this particular virus, Mr. Speaker, and they have done a phenomenal job. We should be proud of the way in which Canada can actually play a leading role in preventing this virus, Mr. Speaker, from expanding. And that's what this motion is really all about. Let's start the dialogue or a part of the dialogue should occur at the Standing Committee where the Minister of Health, Minister of Public Safety, and others can actually contribute to assuring the minds of Canadians that we're dealing with our world obligation and we're also dealing with the safety of Canadians throughout. Thank you, Mr. Speaker.
The time for government orders has expired. The honourable member for Winnipeg North will have 5 minutes remaining in questions and comments when this matter returns before the House following question periods. Déclaration de député, statements by members. The honourable member for Peterborough.
Mr. Speaker, today at Rideau Hall, the Governor-General recognized a special group of Canadians for acts of bravery. During the ceremony, His Excellency the Right Honourable David Johnson remarked that those recognized had shown extraordinary courage when called upon by circumstance to act, and that their actions represent the most extreme example of philanthropy, which literally translates as love of mankind. On May 2, 2011, Haley Menard and paramedics Mark Cameron and Gregory Landon rescued Haley's younger sister, whose foot became trapped in a piece of farm machinery near Havelock, Ontario. Haley jumped into a gutter filled with animal waste to prevent her 3-year-old sister from drowning while waiting for help to arrive. After an hour of struggling in a most difficult situation which put her own health at risk, paramedics Cameron and Landon were able to loosen the conveyor's mechanism and free the child. On behalf of all the residents of the Peterborough riding, I salute each of them for their bravery and thank them for inspiring each and every Canadian with their incredible courage.
Declaration, the honourable member for Sault Ste. Marie.
Mr. Speaker, proposed major oil and gas pipeline projects need approval if the Canadian economy and the manufacturing sector in my riding of Sault Ste. Marie are to prosper. Steel pipes produced by Tenaris Algoma Tubes, which employs 650 people and contributes 14% of the Sault's GDP, are sold to Canadian and U.S. customers for a variety of oil and gas drilling applications, including oil and gas pipelines. However, with the American demand for oil and gas being increasingly satisfied by American production, there is no denying that Canada needs alternate markets like Asia. Developing pipelines for the oil and gas needed by China, South Korea, and Japan creates demand for the manufactured products that deliver the oil and gas, which creates demand for the pipes we develop in Sault Ste. Marie. Mr. Speaker, approval of pipeline projects is vital to the economy of my riding. According to Tenaris' Dave McCaddy, Asia is our opportunity. Thank you, Mr. Speaker.
The honourable member for York South Weston.
Mr. Speaker, residents in my riding of York South Weston and across Canada continue to express their opposition to this government's ill-thought-out plan to end Canada Post home mail delivery. Yesterday, 11 communities across Canada, from Fort McMurray to Calgary to Winnipeg to here in Ottawa, lost their home mail delivery. Other communities are to follow in the months ahead. For a person with MS, like my brother Chris, who lives in nearby Canada, our winter means that from November to April, he will not be able to access his mail. He will become more dependent on others. Canada Post says that for those who can prove their disability and show they have no one else to rely on, it may deliver their mail once a week. This loss of mail service further isolates and discriminates against the disabled. Every day, my office receives letters, cards, and petitions opposing the government's plan, as do other MPs. Hundreds of thousands of Canadians have expressed their wish to keep door-to-door mail delivery. Mr. Speaker, why won't the government listen to what Canadians are saying and provide the service they are asking for? Thank you.
The honourable member for Kamloops, Thompson, Caribou.
Mr. Speaker, earlier today I had the honour of attending a ceremony at Rideau Hall in which 45 medals of bravery were bestowed upon deserving Canadians by the Governor-General of Canada, the Right Honourable David Johnson. Decorations for bravery recognize people who risk their lives to try and save or protect the lives of others. The Medal of Bravery recognizes acts of bravery in hazardous circumstances. One of these 45 admirable recipients was Tyler Allen Fowler of Valemount, British Columbia. On April 27, 2012, Tyler Fowler, along with co-recipients Eli Day and Dion Lefebvre, pulled 4 people from their burning vehicles following a violent head-on collision near Wandering River, Alberta. The rescuers managed to extricate the victims despite the rapidly spreading fire. Sadly, several occupants of both vehicles did not survive. Tyler's courage and willingness to risk his own life to save another is both admirable and extraordinary. His actions inspire our nation and command our deepest gratitude.
The Honourable Member for Beauséjour. Mr. Speaker, earlier today the Governor-General bestowed an award on Joy Leblanc of McDougall Settlement in New Brunswick, who is a young student from Clément Cormier. He was awarded the Medal of Bravery.
Joey risked his own life to help a woman trapped in a burning car. The car was surrounded by flames, the smoke was thick, but when it came to saving someone else's life, this young man did not hesitate at all. His bravery allowed this 37-year-old woman to be alive today. L'héroïsme de Joey démontre...
Joey's heroism also shows the community spirit that exists in New Brunswick. We are fortunate to be surrounded by courageous people like Joey, whose actions give us inspiration to be better neighbors and to help people in need.
House, Mr. Speaker, I want to congratulate Joey LeBlanc. Our country is stronger because of brave young men like him.
The honourable member for Calgary Centre.
Mr. Speaker, I stand here in the House today proudly alongside many female colleagues. You know, women who are fully recognized under Canadian law as being equal to men, having the ability to run for any political office in this country. It's with great pride as an Albertan as well that we commemorate the 85th anniversary of the Persons case. Nellie McClung, Louise McKinley, Irene Parlby, Henrietta Edwards, and Emily Murphy, all fellow Albertans, changed the course of Canadian history for women. Most recently, our Prime Minister hosted the Saving Every Woman, Every Child Within Arm's Reach Summit that commits $3.5 billion to our government's priority of improving maternal and newborn health worldwide. Our strong Conservative majority has more female members of Cabinet than any other in history. And I join with the great Emily Murphy in saying we want women leaders today as never before, leaders who are not afraid to be called names and who are willing to go out and fight. I think women can save civilization. Women are persons.
The honourable member for Windsor West.
Thank you, Mr. Speaker. Today, 2 Windsor police officers, Constable Sean Rogan and Constable Charles Sasso, were awarded with the Medals of Bravery by Governor General David Johnson. In September 2011, both of these officers approached a rolled-over vehicle which had caught fire. The injured and unconscious driver was saved by these 2 courageous officers who fought the fire and removed him from the vehicle through the sunroof. The Governor General's declarations for bravery were created in 1972. They recognize people who risk their lives and choose to defy their own instinct of survival to try to save a loved one or a perfect stranger whose life is in immediate danger. The Medal of Bravery recognizes acts of bravery in hazardous circumstances. On behalf of the constituents of Windsor West, I would like to congratulate these 2 outstanding officers for their dedication, service, and bravery. We are honored to recognize their heroism and their commitment to protecting our community. Thank you, Constables Rogan and Sasso, for your unrelenting fearlessness, and we're very grateful, and thanks to the entire Windsor Police Service for doing an outstanding job serving and protecting our community, Windsor.
The honourable member for Edmonton Centre.
Mr. Speaker, I rise today to recognize the winners of the annual Hetman Awards in Edmonton and the excellent work done by the Ukrainian Canadian Congress Alberta Provincial Council, or UCC-APC. The Hetman Awards acknowledge significant volunteer achievements by outstanding Ukrainian Albertans who have chosen to give their time, effort, and expertise in order to keep the Ukrainian Canadian community in Alberta strong, vibrant, and active. 3 youth, 3 adult, 3 senior, and 1 posthumous awards were given out to very deserving people, one of whom is Eileen Uchuk, who was the first Alberta woman inducted into the Hockey Hall of Fame. The UCC-APC is celebrating 40 years of community service to the Alberta Ukrainian community, and today officially represents over 330,000 Albertans of Ukrainian descent. It addresses the needs of the Ukrainian community and coordinates its activities, fosters unity and cooperation, preserves Ukrainian heritage, history, culture, and language, and encourages participation of youth and newcomers from Ukraine. Mr. Speaker, I want to thank the UCC-APC as one of the many such organizations that effectively represent the wonderful cultural mosaic that is Canada. Thank you, Mr. Speaker.
The honourable member for Prince Edward Hastings.
Well, thank you, Mr. Speaker. I rise today to congratulate Restaurants Canada for 70 years of service to Canada's food service industry. Canada's restaurant industry is a cornerstone of our economy, and the numbers speak for themselves. With 4% of our GDP of the country and an impressive $68 billion in sales, restaurants stimulate activity in various industries from tourism to agribusiness. Globally, they put our cities on the map as a must-see culinary destination, and locally they support our farmers and our fishers. Restaurants also create 1.1 million jobs across the country and generate 250,000 jobs in diverse industries such as agriculture, manufacturing, wholesale trade, finance, and insurance. As a former restaurant owner and hospitality professional for over 30 years, I believe a successful and growing restaurant industry is vital for our economic and social well-being. So whether you're an owner, a franchisee, a manager, a server, or support staff, thank you for your dedication to the Canadian industry, and we look forward to many years of working with Restaurants Canada to help this fine industry grow and prosper.
The Honourable Member for Pontiac.
Monsieur le Président,
Mr. Speaker, when it comes time to represent the families and workers abandoned by the Conservatives, nobody does a better job than the NDP. We led the fight against cuts at Canada Post. We defended workers in the light of EI. And in the event of situations like Kakuna, it's not the Conservatives and the Liberals who are doing any work on it. They're so prepared to sacrifice the belugas for profits. The NDP works together. We will work together to replace the Conservative government. Mr. Speaker, I'm of the view that when we vote in favour of a bill, word should be kept. And that's why I ask what happened with the member for Repentigny, who would force people who cross the floor to resign. I would call on that member to do so in order to launch an election in Repentigny.
The honourable member for Etobicoke Centre. Mr. Speaker, the current world security situation presents Canada and its allies with very serious challenges. It is therefore incumbent upon us to provide the best possible training for our military leaders. The National Security Program at Canadian Forces College in Toronto provides professional military development of selected Canadian officers identified to progress to senior command positions at the global strategic level. This year, the NSP includes members of foreign and allied militaries and senior public servants addressing future strategic responsibilities in a complex global security environment from a whole-of-government approach. The NSP is led by retired generals in a mentor role instructed by some of Canada's leading defence academics. The National Security Program is visiting Ottawa this week on their annual field study exercise. They visit key federal departments and meet with experts in a variety of fields. As a former staff member at CFC and a graduate of the Joint Command and Staff Program, I am delighted to advise all Canadians about the Canadian Forces College and let them know that the caliber of their defence institutions, Mr. Speaker, is second to none.
The Honourable Member for Rosemont, La Petite Patrie. Mr. Speaker, today I'd like to take time to thank the thousands of people in our ridings who are involved in our communities. You believe that it's possible to change the world. You have the conviction to make these changes. I also want to talk about volunteers who work in my office, and I'm thinking about Sylvie, Francine, Josiane, and Falmata, Hélène, Eric, who meet with constituents and citizens to make them aware of important issues like affordable life, employment insurance, the environment, Canada Post. You speak with passion. You know that it's possible to live in a better world. You're convinced that we will leave our children with a healthy planet. You will continue to work for essential service like the distribution of mail to all citizens. I'm very pleased to go door to door with you, my volunteers. Let's remain optimistic today, and together we will make changes in this world.
The honourable member for Saskatoon, Rosetown, Bigger.
This week, through the coordinated efforts of our Speaker and our federal and provincial governments, senior diplomats from more than 50 countries are in Saskatchewan to attend the largest economic forum ever hosted in Saskatchewan for ambassadors and heads of missions. These senior diplomats will learn about the many opportunities our province has to offer, as well as foster and build positive trade relations. Indeed, trade is very important to Saskatchewan, as we have a resource-rich province. We have cattle, grain, oilseeds, and pulse crops. We have potash, uranium, oil, coal, and forest products. And finally, we have new and exciting innovations and technologies that countries need to grow and prosper. In referring to my home province of Saskatchewan, an esteemed parliamentarian recently said, "We're an export province in an exporting nation." Who said that? Why, it was our very own Speaker, and he couldn't be more correct.
The honourable member for Kings Hants.
Speaker, I rise today to celebrate the 70th anniversary of Restaurants Canada, the leading voice of Canada's diverse and dynamic restaurant and food service industry. Canada's restaurant industry is a key economic driver and job creator. With 89,000 restaurants, bars and caterers across the country, this industry is a leading provider of that all-important first job for youth and newcomers to Canada. In fact, 22% of Canadians had their first job in the restaurant business, the highest of any industry. With 18 million customer visits every day, the restaurant industry is the backbone of communities across the country, feeding Canadians from big cities to remote regions. In my riding of King's Hants, the industry is an important source of jobs and growth. Next month, Wolfville will host the 4th annual Devour Food Film Festival, a celebration founded by Chef Michael Howell that will highlight our great restaurants and wineries. Restaurants Canada has been a powerful advocate for this vital industry. We wish them many more decades of success.
The honourable member for Elmwood, Transcona.
Mr. Speaker, Small Business Week is a time to recognize the many successes of our local small businesses and communities from coast to coast to coast.
Hear, hear.
It is no secret that small businesses are the backbone of our economy and are Canada's job creators.
They sure are.
Together, small and medium businesses across the country employ 90% of our workforce and are responsible for generating 39% of our GDP.
It's amazing.
Since 2006, our government has been dedicated to creating an environment where our businesses can grow and succeed in the increasingly competitive global economy. Today, Canada has an 11% tax rate for small businesses.
That's just great.
And according to KPMG, Canada ranks first among G7 countries for our positive environment in which to start a business.
Wow.
We also took further action to support Canadian small business owners in early September by introducing the Small Business Tax Credit, which is expected to save small businesses more than $550 million over the next 2 years.
That's just great.
To all the small business owners across Canada, thank you for all your hard work. Happy Small Business Week.
Here, here.
Very good.
The Honourable Member for Saint-Jean. Thank you, Mr. Speaker. The tragic events that occurred yesterday in Saint-Jean-sur-Richelieu and the constant life of Patrice Vincent is something that affected us deeply from sea to sea as Quebecers and Canadians. As a member for Saint-Jean and the representative of the NDP, and I'm sure on behalf of all members in this House, I want to extend my condolences to the victim's family and loved ones. My thoughts are also with the other CF member who remains hospitalized, and I wish him a prompt recovery. I also have some special thoughts for all those people working within the military community in Saint-Jean-sur-Richelieu who are affected by this tragedy.
And indeed, all Canadians stand with the Canadian forces following this tragic event.
Mr. Speaker, the allegations surrounding yesterday's incident are serious. As the police officers continue to work to recreate the circumstances surrounding this tragedy, we must remain united in the face of adversity. Together, we will overcome this difficult situation.
The honourable member for Nipissing-Timiskaming.
Thank you, Mr. Speaker. I am pleased to report that in the 2014 edition of the Melbourne Mercer Global Pension Index released today, Canada's retirement income system maintained the top rating for 6 years in a row. Indeed, under our Conservative government, Canada has one of the best retirement income systems in the world. Mr. Speaker, our government believes that Canadians deserve a secure and dignified retirement. That's why we cut taxes for seniors and pensioners by more than $2 billion annually, including pension income splitting, introduced the pooled registered pension plan, introduced the tax-free savings account. Mr. Speaker, our government is supporting the Canadians who have built this country. Thank you, Mr. Speaker.
Oral questions, question orale.
The Honourable Leader of the Opposition.
Mr. Speaker, yesterday Canadians saw a tragedy play out in the community of Saint-Jean-sur-Richelieu. This morning that tragedy, of course, was only magnified when we learned that Patrice Vincent, one of the Canadian Forces members who was attacked yesterday, has now died. I know that the thoughts of all members of this House, indeed of all Canadians, are with the family and friends of Patrice Vincent. Can the Prime Minister please update Canadians on the heartbreaking and shocking events yesterday in Saint-Jean-sur-Richelieu?
The Right Honourable Prime Minister.
Mr. Speaker, Warrant Officer Patrice Vincent was a member of the Canadian Armed Forces, distinguished service over 28 years. He served all across the country. Obviously, our thoughts and prayers are with his family members, his friends, and his colleagues. Mr. Speaker, this was a despicable act of violence that strikes against not just this soldier and his colleagues, but frankly against our very values as a civilized democracy. And Mr. Speaker, we will continue to stand with the men and women of the armed forces who defend us against these threats.
Honourable Leader of the Opposition.
Mr. Speaker, yesterday the government took everyone by surprise, including the Sûreté du Québec police force, by divulging unconfirmed information in this House. A tragic event like the one in Saint-Jean-sur-Richelieu should be a moment to rise above partisanship. If this is an incident that threatens national security, the national security of Canada, when will the government offer a full briefing to parliamentarians on this situation?
Right Honourable Prime Minister.
Mr. Speaker, I informed the House of these tragic events as soon as I learned of the situation, and I would like to repeat, Mr. Speaker, that Warrant Officer Patrice Vincent was a member of the Canadian Forces for 28 years, and he offered distinguished service across this country, and we are always with our armed forces who protect us from threats like this. And, Mr. Speaker, we will continue to fight threats to our armed forces and to our democratic society. The Honourable Leader of the Opposition. Mr. Speaker, according to several reports, documents from the U.S. Securities and Exchange Commission show that the Conservative government did indeed sold the commercial rights for the Canadian Ebola vaccine to New Link Genetics for the sum of $250,000. $205,000. Can the Prime Minister confirm this? Once again, Mr. Speaker, as I've said on several occasions, Canada holds the rights to this vaccine, and, Mr. Speaker, this vaccine was made available to the World Health Organization very early in this crisis, and obviously, Mr. Speaker, it's up to the WHO to determine how it will be used.
The Honourable Leader of the Opposition.
In fact, Mr. Speaker, on several occasions, he has refused to answer.
The outbreak began, the Minister of Health has sold off $1.5 million worth of protective gear for just $30,000. The Conservative government was carelessly getting rid of needed medical supplies for 2 cents on the dollar. Why was the minister giving this equipment away to private middlemen instead of giving it to the people who need it fighting Ebola in Africa?
The Right Honourable Prime Minister. Order.
Well, once again, Mr. Speaker, as I think has been explained to the Leader of the Opposition several times, as soon as the World Health Organization requested supplies, the government made has made any surplus supplies available. We are making available to them 1.5 million gloves, 2 million face shields, and 1.2 million isolation gowns, and obviously we will continue, not just with vaccine and with equipment, but to continue to assist the World Health Organization and other international organizations as they fight against what is a very dangerous and troubling pandemic for all of us.
The Honourable Leader of the Opposition.
Mr. Speaker, the Minister of Health claims that the WHO didn't request protective gear from Canada until September 4th. But that was a full month after the WHO had already declared an international public health emergency. How can the Prime Minister explain that it took his minister so long to realize that medical protective gear was actually needed when fighting Ebola?
The Right Honourable Prime Minister.
Mr. Speaker, of course, I recently met in New York with the Director General of the World Health Organization, who has complimented Canada on coming forward as soon as requested with all needed assistance. And I congratulate the Minister of Health, the Minister of International Development, and others for continuing to respond with their international colleagues to this crisis in West Africa.
The Honourable Member for Papineau. Mr. Speaker, I would like to offer my sincere condolences to the family and the friends of Warrant Officer Patrice Vincent. And we would also like to wish a swift recovery to the member who was wounded. We support the police forces who are investigating this file and who protect Canadians. The government has said that several dozen Canadians have become radicalized and could represent a threat to other Canadians. Are they all under surveillance? And can the Prime Minister update this House on the next steps that will be taken?
Right Honourable Prime Minister.
Mr. Speaker, as the security agencies have said on several occasions, there are a number of individuals who are under surveillance for terrorist activities, possible terrorist activities. And, Mr. Speaker, these agents are seeking ways to bring charges against these individuals. We are currently examining the possibilities through which we can give more tools to our security organizations to bring charges as soon as possible.
Honourable Member for Papineau.
Mr. Speaker, today the House debates a motion to ensure ministerial transparency and accountability in Canada's response to the Ebola crisis. Will the Prime Minister confirm his party's support for this motion and therefore the regular participation of his ministers at the Standing Committee on Health?
Right Honourable Prime Minister.
Well, Mr. Speaker, ministers, of course, have remained available throughout this particular international pandemic. They've been available not only to the House, they've been available constantly to Canadians. I'm sure they will also be available on occasion to committee when required. Mr. Speaker, I would encourage the members of the Liberal Party to work with the government to work on a motion that we could both agree to, but I can certainly assure the House, the Minister of Health, Minister of International Development, and others who are involved will continue to communicate actively with parliamentarians.
The Honourable Member for Papineau. Mr. Speaker, the United Nations say that they still need $1 billion to fight against the Ebola crisis. Will the government encourage Canadians to make donations like they did for Haiti, and will they match those donations? The Right Honourable Prime Minister. Mr. Speaker, we always encourage Canadians to donate to charitable organizations in any circumstances. But it's important to reiterate, Mr. Speaker, that the Government of Canada is one of the most generous donors in the world against the Ebola crisis, and we will continue to take our responsibility seriously.
Ottawa Centre.
Mr. Speaker, just 2 weeks ago, the Prime Minister announced that Canada's participation in the Iraq War will last 6 months. Already, new details are emerging that defense officials believe the combat mission in Iraq could take up to a year. We've gone from 30 days of non-combat to 6 months of airstrikes and now to a year. Is the government looking at a year-long combat mission in Iraq?
The Honourable Minister of External Affairs.
Speaker, what the government has done is authorized members of the Canadian Air Force and the Canadian Armed Forces to participate in an international effort to try to halt the spread of a barbaric terrorist regime who is selling women into slavery, who is decapitating outsiders and humanitarian aid workers, who is summarily executing hundreds and thousands of people. We believe that a solution, the air campaign, is one area, providing training, providing heavy lift support. An inclusive government in Baghdad is something that is tremendously important. Diplomatic work, humanitarian effort, the engagement of the Sunni Arab world, all these things will be tremendously important, but Canada is prepared to do its share.
The Honourable Member for Laurier Sainte Marie. Mr. Speaker, we knew from the very beginning that the Conservatives' combat mission would become a quagmire. With just a few weeks in, we've gone from a support mission to a combat mission. And if my colleagues across the way could show a little bit of respect for an important question, that would be nice. And now, even now, as our fighter jets are readying to leave, the government is already suggesting that the mission will be extended beyond 6 months. Why are the Conservatives once again refusing to be honest and transparent with Canadians?
Honourable Minister of Foreign Affairs.
Mr. Speaker, the combat mission hasn't even begun, and yet the NDP is already contemplating a quagmire. Mr. Speaker, what is important is it is imperative that we act with our allies to halt ISIL spread and to reduce its capacity. We have authorized for up to 6 months an air campaign to participate with President Obama, with the United Kingdom, with France, and with our allies in the Arab world in this regard. It will be tremendously important that there be diplomatic and political work. The establishment of an inclusive government in Baghdad and the appointment of the last 2 members of that cabinet are another important step forward.
The honourable member for Laurier Sainte Marie. Mr. Speaker, their lack of transparency isn't just about the length of the mission, but also about its cost. Last Friday, we learned that the Department of National Defence gave the minister an estimate of the cost of the combat mission. The minister has that information. First, why has this information not been made public? And second, can the minister tell us today how much this mission will cost?
The Honourable Minister of Foreign Affairs.
Well, Mr. Speaker, the Minister of National Defence is right now in Cold Lake, Alberta, to see off the members of the Canadian Forces who have volunteered to be able to stand up for freedom, liberty, against barbarism and against external threats to Canada. And we wish him well, as we wish those members of the Canadian Armed Forces well as they undertake this mission. We will, of course, do ordinary measures, Parliament and accountability, ensure that all the costs come before this House at the appropriate time.
The honourable member for Portneuf-Jacques-Cartier. Mr. Speaker, when Lieutenant Shauna Rogers took her own life in 2012, her parents wanted to understand what had led her to do such a thing. After collecting information and documents, Rick and Ellen Rogers were asked by the Department of National Defence to hand over the documents. And they refused, and now they're being hauled before the courts and are risking jail time. Why is the government out to punish the families of veterans instead of dealing with mental health issues in the armed forces?
Honourable Parliamentary Secretary to the Minister of National Defence.
Mr. Speaker, our thoughts and prayers are with all military families who have lost loved ones. What transpired in this case is not acceptable. As soon as our government learned of this, the Minister of National Defence asked the Department of National Defence to respect the family's wishes and turn over the necessary documents to allow for an inquest by the Alberta government. The Minister will also be meeting with the Defence Ombudsman this week to discuss how the Department of National Defence can better respect the wishes of families in the Board of Inquiry's process. The Minister has streamlined these boards of inquiry because military families who have lost their loved ones need and deserve closure.
The honourable member for St. John's East.
Mr. Speaker, once again, the parents of a soldier who committed suicide are being treated with total disrespect. This time, the government was trying to force them to participate in a secret hearing with no legal counsel under the legal threat of a summons. Thankfully, they backed off when their lawyer filed a court application. Will the minister apologise to Rick and Ellen Rogers for this abusive process? And will the government finally fix this broken military board of inquiry system and have an open and accountable process?
The honourable Parliamentary Secretary.
Mr. Speaker, as I just said, we found that this process was unacceptable, and that's why we've interjected and asked the department to turn over all the documents to the Alberta government so that can respect the family's wishes and that they can have a proper inquiry. We will be meeting with the Department Ombudsman to ensure that the department is respecting the wishes of this family and all families that are going through the Board of Inquiry's process, and we have streamlined it and expedited the way the boards of inquiry are reporting back to military families.
The honourable member for Burnaby Douglas.
Mr. Speaker, the Conservative record on science is once again drawing international criticism. More than 800 scientists from 32 countries signed a joint letter urging Conservatives to stop muzzling scientists and stop cutting public science budgets. They warn that Conservative censorship and cuts hurt our ability to collaborate internationally. Canada once had a reputation as a science leader, but now we are falling further and further behind. Will the Conservatives stop the muzzling and start the repair of Canada's public science reputation?
The Honourable Minister of State for Science and Technology.
Well, thank you, Mr. Speaker. This is a chance again to give facts. Since being elected, our government has made record investments in science, technology and innovation. In fact, Canada is ranked first in the G7 for research and development in our colleges, universities and other research institutes. Mr. Speaker, that's why our government has invested $1.5 billion of new money for the creation of the Canada First Research Excellence Fund, which allows institutions to leverage world-class strengths into world-leading research that will create long-term benefits for Canada. Those are the facts.
Member for Rivière-des-Mille-Îles. Mr. Speaker, the government can no longer deny that by cutting science budgets and muzzling Canadian scientists, they're damaging Canada's international reputation. And it's not just the NDP who've noticed. In an open letter, over 800 respected scientists from 32 different countries criticized the Conservative government's treatment of its scientists. Will the government finally wake up and stop treating scientists like enemies?
Honourable Minister of State.
Mr. Speaker, once again, here are the facts. We have made record investments in science, technology and innovation. Canada is first in the G7 for investments in research and development in our colleges and universities and other learning institutions. Mr. Speaker, this is why the government has invested $1.5 billion for the creation of the Canada First Fund that will allow post-secondary educations to continue working on world-class research. The Honourable Member for Rimouski-Neigette-Témiscouata-Les-Basques. Mr. Speaker, we already knew that the Conservatives have organized a witch hunt against charities that don't share their views. Now a new report is suggesting that they are deliberately ignoring the political activities of right-leaning organizations. They're looking the other way for the political activities of the Fraser Institute and the Montreal Economic Institute, and they're going after environmentalists and bird watchers. Can the minister explain this double standard, where the CRA is only targeting progressive groups while leaving the government's friends a free hand?
The Honourable Minister of National Revenue.
Mr. Speaker, the CRA has been fully transparent on this while respecting the strict privacy provisions of the Income Tax Act. In fact, in a recent message to all CRA employees, the Commissioner and Deputy Commissioner said, quote, "To be clear, the process for identifying which charities will be audited for any reason is handled by the Charities Directorate alone, and like all our audit activities, is not subject to political direction." Further, the Director told the media neither the Prime Minister's office nor Revenue Minister Carrie Lynn Finley's office had any say in the audit.
Order. Order. The minister knows not to use the proper name of the individual, even if it is her own. The Honourable Member for Victoria.
So whatever happened to ministerial responsibility? We've seen the Conservatives go after environmentalists, human rights groups, international development groups, and yes, even bird watchers. Pretty well anyone that may disagree with them. But a new report suggests right-wing charities, well, they get a different ride.
Yeah, free ride.
Annual filings from 10 right-wing charities show no political activities on their part. None, in spite of the fact that their websites are full of advocacy. Can the minister explain this double standard?
Order. The Honourable Minister of National Revenue.
The opposition critic for the CRA received a full technical briefing from CRA Charity Directorate officials, including the Director General, on how charities are selected for audit and how these audits are conducted. As the Director General said publicly, "As I have made clear in the past, the process for identifying which charities will be audited for any reason is handled by the Directorate itself and is not subject to political direction. It is shameful that this member and his party are using their own political agenda over the backs of hardworking public.
Order.
The honourable member for Bourassa. Mr. Speaker, Canada has promised $60 million to the fight against Ebola in West Africa, and only $4.3 million have been paid out. Why? We're talking about 4,500 dead and over 9,000 cases of Ebola. Is the situation not bad enough? What is the Conservative government waiting for to release this money? The Honourable Minister. Mr. Speaker, since the month of April, when we began working in this crisis, we have been a leader, and we are working with the World Health Organization and with Doctors Without Borders, the Canadian Red Cross, and the International Federation of the Red Cross. And we are continuing to work with credible organizations such as the World Food Programme and UNICEF. Mr. Speaker, Canadians can be proud of the contribution that we have made. It's one of the biggest contributions in the world, and we will be there to meet the needs of this crisis.
Mr. Speaker, the WHO and UN have calls for more medical personnel to fight Ebola in West Africa, and the international community has accepted the call. Yesterday, the health minister said no Canadian personnel would be sent without an evacuation plan. So far, the United States, European Commission, and WHO have engaged contractors to facilitate emergency transport of medical personnel if needed. Who has the minister met with respect to developing an evacuation plan? What steps has the minister taken to put a plan in place?
The Honourable Minister of Health.
Mr. Speaker, I can reassure the member that we have taken many steps and we've evaluated many options, including commercial options with the Department of National Defense, with the Department of Defense in the United States. We do currently have an agreement with the U.S. with a commercial operator contractor that they use called Phoenix Air, and we appreciate the generosity and access to those planes, but they are very limited, and we will not send any more medical personnel unless we have guaranteed medical evacuation.
The Honourable Member for Kingston and the Islands.
Thank you, Mr. Speaker. Bloomberg reports that the Gates Foundation and 2 U.S. companies want to expand U.S. production of monoclonal antibodies to treat Ebola by using CHO cells. But we have the capacity to manufacture it in Canada as well. Our Public Health Agency of Canada developed Ebola antibodies, and our National Research Council owns a CHO cell line. There are Canadian companies who could take these two and manufacture a supply. So should the government mandate that Canada have its own supply of this Ebola treatment?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I appreciate that the member recognizes the great work that has gone on over the last 10 years by Public Health Agency of Canada researchers and scientists to develop not only the treatments that he's mentioning, but also the vaccine. And I'm happy to inform the member that, yes, we are pursuing all options to make sure that Canada can have a domestic supply. And, of course, in doing that, we will also look to Canadian companies.
The Honourable Member for Nanaimo, Cowichan.
Mr. Speaker, the Prime Minister himself promised reconciliation with the 2008 residential school apology, yet this Conservative government is facing an unprecedented human rights tribunal for systematically discriminating against First Nations children on reserve, providing them with 22% less funding for child welfare services than what other children receive. Their own experts have confirmed this shortfall. How can this Prime Minister justify treating children on reserve as second-class citizens?
The Honourable Minister.
The Honourable Member is totally false, Mr. Speaker. Protecting women and children remains and is a priority of our government, especially those on reserve. And that is why, since 2006, we have introduced a prevention-based approach to delivering child and family services. And I know that the opposing party often measures the need by the size of the investment. Well, since 2006, we have increased our investment by 40% to over $400 million for these services.
The Honourable Member for Nanaimo, Cowichan.
Mr. Speaker, the failure of this government to protect the basic rights of First Nations children on reserve is an absolute shame. We have have more First Nations children removed from their homes and put in foster care than at the height of the residential school era. This is unacceptable in a country as rich as Canada. When will this government stop discriminating against First Nations children and start funding child welfare at the same standards and quality as all other services in this country?
The Honourable Minister of Aboriginal Affairs. Order.
Again, Mr. Speaker, the health and safety and well-being of First Nation children is a priority. I remember that very party opposing, for example, the matrimonial property legislation we introduced to protect women and children on reserve. And, you know, they ignore the fact that our government invested close to $630 million on child and family services on reserve, which represent an increase of 40% since 2006. And we will continue, Mr. Speaker, to take action to ensure that children and families have the support they need.
The Honourable Member for Newton North Delta.
Sadly, it's not just First Nations children the government treats as second-class citizens. In First Nations communities struggling with high unemployment, the government is still allowing employers to bring in temporary foreign workers. Why? Because the government is simply not counting First Nations unemployment. The Conservatives' latest round of program reforms do nothing to address this gaping loophole. So what is this minister going to do to ensure that job opportunities in their own communities actually benefit Aboriginal Canadians?
The Honourable Minister of Employment and Social Development.
The preamble to the question was the opposite of the truth. In fact, employers, in applying for labour market impact assessments to invite temporary foreign workers, have to demonstrate first that they have reached out to groups that are underrepresented in the Canadian labour force, including persons with disabilities, Canadian youth, recent immigrants, and specifically Aboriginal Canadians, Mr. Speaker. Our message consistently to employers is they must redouble their efforts to hire and train unemployed Canadians, particularly Aboriginal and other Canadians, before we'll even consider their applications to bring in temporary foreign workers.
The Honourable Member for St. Lambert. Mr. Speaker, the facts remain. Across Canada, First Nations are particularly hard hit by unemployment. However, the government acts as if these unemployed Canadians don't exist, as denounced by a researcher at McMaster University. In some regions, they are not even part of the calculations of the unemployment rate. Because of these poor statistics, temporary foreign workers are brought in, whereas First Nations people don't have jobs. Will the government intervene to remedy this problem and avoid having the temporary foreign worker program increase Canadian unemployment? The Honourable Minister. Mr. Speaker, if the opposition was serious, maybe they'd listen to what I have to say about this. Every time I talk about the temporary foreign worker program, every time I talk about the so-called labor shortage, I say that we have to train, hire, bring together First Nations people who are unemployed to link them up with the available jobs. This is urgent. This is a message that we do communicate to employers every day, and it's an obligation for employers who apply for temporary foreign workers. They have to make an effort to hire Aboriginals first.
For Westlock. St. Paul.
Mr. Speaker, I ask all Canadians to take a moment today to think about the men and women of the Canadian Forces, and particularly 4 Wing Cold Lake, who are currently deploying to combat ISIL. This terrorist group of ISIL has been carrying out a murderous rampage across Iraq, seizing territory and killing men, women, and children in the most brutal ways imaginable. Make no mistake, if left unchecked, these terrorists represent a threat to Canada and to Canadians. Canada will do its part in fighting this threat. Can the Parliamentary Secretary to the Minister of National Defence please update the House on Operation Impact and Canada's contribution to fighting ISIL?
The Parliamentary Secretary.
Thank you, Mr. Speaker, and I want to thank the member for Westlock St. Paul for his unwavering support for the members of the Canadian Armed Forces. Mr. Speaker, preparations for Operation Impact are well underway. Today, a group of CF-18 Hornet fighter jets departed from 4 Wing Cold Lake to be deployed in Kuwait, where combat operations against ISIL will soon begin. Our government has a duty to protect Canadians and to stand firm with our allies in opposition to the unspeakable atrocities being carried out by ISIL against innocent children, women, and men. Our pilots, air crew, and serving members are amongst the best in the world. All Canadians are proud of our men and women in uniform who are dedicated to providing safety and security wherever they are called upon.
The honourable member. The honourable member for Sudbury.
Thank you, Mr. Speaker. CBC Marketplace has identified the dumbest charges that Canadian consumers pay. ATM fees, pay-to-pay fees, airline fees, touch-tone fees, but every time we raise the issue, the response is the same. The minister crosses his fingers, hoping for corporate knights in shining armour to ride in with voluntary codes and save the day. Well, Mr. Speaker, the minister knows, just as Canadians know, this isn't happening. So why the failure to stop companies from charging these dumb fees? So, Mr. Speaker, when will the government stop the nickel and diming of Canadians?
The Honourable Minister of State for Finance.
Mr. Speaker, Canadian consumers deserve access to credit on fair and transparent terms. That's why we've taken action to protect Canadian consumers by banning unsolicited credit card checks, requiring clear and simple information, providing timely advance notice of rates and fee changes, limiting anti-consumer business practices, and ensuring prepaid cards never expire. Our Conservative government believes that with better information, Canadian consumers can make informed decisions in their best interest.
The Honourable Member for Quebec. Mr. Speaker, in its throne speech over a year ago, the government made a commitment to eliminating these kinds of excessive fees. It has done nothing. Consumers have had enough of these abusive fees from banks and telecoms. We're even now being billed in order to get access to our own bills. Imagine that. Despite Conservative promises, many large corporations continue to attack consumers this way with various abusive fees. When are the Conservatives going to take concrete action and support NDP proposals so that Canadians can have a more affordable life?
Order. Honourable Minister d'Industrie.
Honourable Minister of Industry. That's not at all the case, Mr. Speaker. In the past, we've taken action. We will certainly continue to take action.
Issue of pay-to-pay billing, Mr. Speaker. It is true our government is taking action. We made a commitment in the throne speech. This Parliament passed that throne speech with the votes of the government side, and we will be introducing legislation to realize that this week. So if the NDP are true, lots of noise from the NDP side. I look forward to the NDP actually voting for the Conservative motion that will stand up for Canadian consumers.
The Honourable Member for Rivière-du-Nord. Mr. Speaker, the ministers responsible for the francophonie in Quebec and Ontario are denouncing Conservative cutbacks at Radio-Canada. Like us, they deplore the fact that this reduces news broadcasts in French and threatens the survival of francophonie in Canada. The law is clear. The public broadcaster has a mandate to help the francophonie flourish across Canada. Will the Minister of Canadian Heritage recognize that these savage cuts prevent Radio-Canada from fulfilling its mandate for francophones in minority situations? Thank you, Mr. Speaker, and I understand the important role that Radio-Canada plays in official language communities in minority situations and isolated ones as well. Our government and all Canadians expect Radio-Canada to fulfill its mandate to provide high-quality programming to these communities. The Quebec and Ontario ministers should know, however, that the CRTC already has the power to make sure that Radio-Canada fulfill its mandate under the legislation. It's up to Radio-Canada to offer that programming for to satisfy its mandate. The Honourable Member for Longueuil-Pierre-Boucher. The government should make sure Radio-Canada has the funds to do that. The cuts at Radio-Canada imperil the minority francophone situations, and yet Parliament gave a clear mandate to the broadcaster which is to reflect the different needs and circumstances of each official language community. The Minister of Canadian Heritage cannot use the budget to circumvent the law and the mandate. When will the minister recognize that the cutbacks at Radio Canada prevent the broadcaster from assuming its responsibilities? She should know she lives in St. Boniface. The Honourable Minister of Canadian Heritage.
What I just said. In fact, CBC has a mandate that they must satisfy. All Canadians and this government expect the CBC to satisfy that mandate. And in fact, the Official Language Act and the Broadcasting Act impose that obligation onto the CBC. But listen to what, of course, our president of the CBC had to say about satisfying his mandate. He says the following: our conditions of license require us to hold consultations with Francophone minority communities, and our commitment to the regions is also reflected in our new CRTC conditions of license. They will, according to the President, follow that obligation, and we intend to support that.
The Honourable Member for Markham, Unionville.
Mr. Speaker, in the past, all governments have matched the contributions of charities to assist with natural disasters. Given the unprecedented refugee crisis in Syria and Iraq, will the government adopt a similar approach and match the funds raised by organizations that are struggling to bring refugees to Canada? The government can make taxpayer dollars go a lot further if it matches the private sector. Why won't the government do this to help thousands of desperate refugees?
Mr. Speaker, we played a leadership role in this. I'd like to remind my colleague that in Iraq, we are now the 5th largest donor to provide assistance to people in need. We announced just last Friday $8 million for UNICEF to help needy children. They are the ones who are in conflict regions, who can continue to go to school and aspire to a better life. Being the 5th in the world, I think all Canadians can be proud of these concrete actions.
Mr. Speaker, media speculation is growing in the West about the final disposal of the Canadian Wheat Board. The deadline isn't until 2017, but it does appear to be happening more quickly. Can the minister say how many potential buyers have signed confidentiality agreements to gain access to CWB's detailed data? How many of those buyers are Canadian? How many are foreigners? And how many are farmers? And since all the assets of the CWB come from farmers' money, not government money, how will the proceeds of any sale be returned to farmers?
The Honourable Minister of Agriculture.
Well, I think, Mr. Speaker, the member opposite answered his own question. We talked about confidentiality agreements. I'm not going to talk about that either. But I will say at the end of the day, Mr. Speaker, the CWB is alive and well because this government undertook to keep them alive and well. We put forward some $300 million to make sure that farmers weren't bridled or saddled with the costs that the CWB was carrying. There was no assets, Mr. Speaker. All of the assets were so heavily leveraged that they had to be paid out by Canadian taxpayers' money to give them a fair shot at becoming a viable entity as they move forward. They're continuing to do that, Mr. Speaker. They're doing extremely well out there in Western Canada. They're starting to move across into Eastern Canada with the purchase of mission terminals. We look forward to future success of the CWB.
The Honourable Member for Notre-Dame-de-Grâce-Lachine. Mr. Speaker, once again the government is letting down Canadians with reduced mobility by putting an end to door-to-door mail delivery and forcing them to go to court to have their rights respected. Can the minister finally recognize that she has obligations under the UN Convention on the Rights of the Disabled and reverse this bad decision by Canada Post to put an end to home mail delivery?
Parliamentary Secretary to the Minister of Transport.
Because the member knows that in 2013, Canada Post delivered 1.2 billion fewer letters than it did in just 2006. She may also know that under that business model, 2/3 of Canadian households already don't receive door-to-door, and under their 5-point plan, that will be true for all Canadians. Mr. Speaker, they have a financial responsibility in legislation to not be given to taxpayers. Canada Post is taking action, Mr. Speaker, and they're doing so by communicating with Canadians about what their needs may be in this transition.
The Honourable Member for York South Weston.
Mr. Speaker, when this government signed the UN Charter on the Rights of the Disabled, it promised to improve things by ending home mail delivery and telling the disabled they should be satisfied with weekly delivery. Conservatives are breaking that promise. It's not right. Canadians living with disabilities have now joined with others to challenge this decision in the courts. Will the minister agree to delay the end of home delivery until the court rules?
Honourable Parliamentary Secretary.
Mr. Speaker, as the member should have heard in the last answer, 2/3 of Canadians currently do not receive home delivery. And Canada Post, in order to deal with its financial crisis and the plummeting business case in terms of plummeting rates of individual mail, are taking action under a 5-point plan, Mr. Speaker, to ensure that daily mail will be preserved in a way that's equitable to all Canadians.
The honourable member for Miramichi.
Mr. Speaker, the lobster fishery is crucial to Atlantic Canada's economy, specifically in rural and coastal areas. In order to grow this industry, it's essential that measures be taken to ensure its sustainability and provide access to new markets. Can the Minister of Fisheries and Oceans tell this House what she is doing to foster growth in the lobster fishery and provide access to new markets?
The Honourable Minister of Fisheries and Oceans.
Thank you, Mr. Speaker. When we formed government, the lobster fishery was facing a number of challenges. We took action, we worked with the industry, and we invested $50 million in the Atlantic Lobster Sustainability Program. The results are undeniable, Mr. Speaker. Since 2007, total lobster landings have increased by 93%. And our lobster exports were a high of $1.1 billion last year. Our government, Mr. Speaker, led by my seatmate, has worked to secure trade agreements that will expand markets for Canadian lobster and create more demand for a delicious Canadian lobster.
The honourable member for Toronto Centre.
Mr. Speaker, today in Dnipropetrovsk, Ukrainian President Petro Poroshenko urgently called for the OSCE mission that is monitoring the ceasefire in eastern Ukraine to be enlarged. Speaking on Friday, Italian Foreign Minister Federica Mogherini said Italy, France, and Germany are willing to send drones and military personnel to operate them. But Canada was not on her list. Why is Canada, with its special relationship with Ukraine, not participating in this essential expansion of the OSCE monitoring mission?
The Honourable Minister of Foreign Affairs.
Mr. Speaker, I don't think we have drones.
The Honourable Member for Algoma, Manitoulin, Kapuskasing.
Mr. Speaker, after the deadly collapse of the Algo Centre Mall, the Elliott Lake Commission of Inquiry concluded that urban search and rescue is critical to save lives. Yesterday, the Parliamentary Secretary to the Minister of Public Safety said she would convey my question about conservative cuts to urban search and rescue to the Minister. She's had a day now. What's the Minister's response? Will he implement the Elliott Lake Commission of Inquiry's recommendation of restoring funding to heavy urban search and rescue to help save lives?
Honourable Minister.
The majority of emergencies in Canada are local in nature and managed by local or provincial governments. The original objective of the Joint Emergency Preparedness Program was met. It was to enhance local emergency preparedness, and we will continue to invest in programs such as the $200 million to prepare communities to tackle with the natural disasters. Thank you.
Honourable Member for Don Valley West.
Mr. Speaker, this week is National Science and Technology Week, which gives us the opportunity to recognize the efforts of our highly talented Canadian scientists. Will the Minister of State for Science and Technology please tell this House what our government is doing to support Canadian scientists whose groundbreaking research impacts the lives of Canadians?
Order. The Honourable Minister of State for Science and Technology.
Mr. Speaker, let me thank the member for Don Valley West for his honourable question. Our government's committed to developing, attracting and retaining the world's most talented researchers in Canada. That just makes sense. Last week I met with Canada Research Chair Dr. Goldie Desjot, who works in robotics, advanced robotics at the University of Toronto. She provides forward-looking solutions in healthcare and emergency response situations. Mr. Speaker, Our government's committed to providing record investments in research to push the boundaries of knowledge, create jobs, and improve the quality of life for all Canadians. I hope all members of this House join me as we honour Canadian scientists during National Science and Technology Week.
The honourable member for Trois-Rivières. Mr. Speaker, in our regions, many families are bracing themselves to get through difficult months with the reduction of available jobs in seasonal industries. During that time, the Conservatives are getting ready to generate surpluses in the EI fund, but not one penny more for families affected by unemployment. In the NDP, we believe it is necessary to protect the EI fund to prevent that premiums be used for other purposes. My question is very simple. Why is the government letting down the workers in seasonal industries and regions when the EI fund is stockpiling surpluses?
Honourable Minister of Social Development.
Mr. Speaker, we're not doing that. On the contrary, EI is there. It's available for the unemployed who've lost their jobs without due cause. Whether they're seasonal workers or not, if they've worked the compulsory number of weeks, they can receive benefits from EI.
Député de Richmond.
Member for Richmond-Tabasca. The National Assembly of Quebec recently adopted a unanimous motion asking the federal government to give a construction contract to the Navy Naval Yard in Lévis for $33 billion. It was the only one excluded. The government apparently decided to change its shipbuilding strategy. Will the Minister of Public Works confirm the change in this naval construction strategy? And Davy, which has converted operations, can it expect to get its share of the pie? The Honourable Minister. Well, Mr. Speaker, the strategy for the supply of Navy ships continues. The process has to make it timely and affordable. We will continue under this strategy to ensure that the Canadian Forces receives the equipment it needs. That will put an end to question period.
We have a statement now from the Right Honourable Prime Minister.
Thank you, Mr. Speaker. On a happy note, tomorrow we will welcome to Canada Malala Yousafzai. As our government set out just over 1 year ago in the speech from the throne, we intend to bestow honorary citizenship on this remarkable young woman. Therefore, on behalf of all Canadians, I'm proud to rise in the House today to seek consent to propose the following motion, which is jointly seconded by the Leader of the official opposition of the New Democratic Party and by the Leader of the third party, the Liberal Party.
Whereas more than 57 million children throughout the world are refused access to primary education,
disproportionately denied access to basic education around the world,
whereas Canada supports international action to ensure that all girls and boys have access to basic education.
Malala Yousafzai fearlessly documented her challenges simply to attend school under the barbaric rule of the Taliban, a listed terrorist organization under Canadian law.
Whereas she was a victim of a horrible attack committed by the Taliban.
Whereas Canadians in the civilized world were united in standing against this attack and are intent on honoring the bravery of Malala Yousafzai.
Whereas she was recognized on many occasions as a champion of fundamental human rights and access to education, including recently when she received the Nobel Peace Prize in recognition for her efforts to spread education to make it universal.
Empowerment of girls and women.
Whereas she serves as a model and an inspiration for Canadians and the entire world in her fight for universal education.
The House of Commons resolved to bestow the title of Honorary Canadian Citizen on Malala Yousafzai, and that a message be sent to the Senate requesting that House unite with this House in the said resolution by filling in the blank with the words, the Senate ended.
Does the Right Honourable Prime Minister have the unanimous consent of the House to move the motion? The
House has heard the motion. Is it the pleasure of the House to adopt the motion?
Adopted. Adopté. Orders of the day. Could I ask members to take their conversations outside? The honourable member for Winnipeg North has 5 more minutes of questions and comments. Questions et commentaires, questions and comments. The honourable member for Malpeque.
Thank you, Mr. Speaker. The member for Winnipeg North went through the amendment to the motion, but I wonder if he might expand on that amendment and why it's so important that the motion before the House be amended in that way.
The honourable member for Winnipeg North.
Yes, thank you, Mr. Speaker. And maybe what I can do is I can just reinforce what the amendment is, because it is important that we recognize what the Liberal Party is attempting to do here, Mr. Speaker, is to try to get an understanding amongst all the members of Parliament that there is a need for us to have the Standing Committee deal with the Ebola crisis on a bi-weekly basis or twice a month. And that's what the motion is actually asking for. We want the Minister of the Health, the Minister of Public Safety, the Chief Public Health Officer of Canada, to recognize that there is an obligation to be able to come before a standing committee of the House so that by doing that they're able to explain in details what Canada is doing, not only on the home front, Mr. Speaker, but also in terms of on the world stage. Because we would ultimately argue within the Liberal Party that in dealing with the Ebola virus, that there is in fact a strong leadership role that needs to be played by the Prime Minister and by Canada, Mr. Speaker. And so, therefore, what we're asking for, and maybe what I'll do is I'll just cite the motion itself, Mr. Speaker, or the amendment to the motion, which in essence says that the relevant minister or ministers to appear twice monthly and the Chief Public Health Officer of Canada to appear monthly before the Standing Committee on Healthcare. It's about strong national leadership
to fight the Ebola virus, Mr. Speaker, and to provide peace of mind and safety to all Canadians. And at the very most important issue is the issue of transparency and education, and that's why we want to do this, Mr. Speaker.
Questions and comments? Question et commentaire. The honourable member for Skeena-Buckley Valley.
Thank you very much, Mr. Speaker. I've been listening with some interest to my friend's comments. One of the things that we've found frustrating to this point is that the reaction from the federal government to the Ebola crisis was rather initially loud, was not forthcoming to Canadians about what was actually being done. We've seen some recent actions from the Minister of Health, but one of the things that we know about epidemics like this is that public information is one of the most important things that government can provide. Reassurance to the public that their government is involved, is engaged with the issue, and is helping those that need help most. Because as the government says about international terrorism, it may come here. Well, certainly with something like Ebola, the treatment has not been to the same veracity and the same strength. And we question, and I put this through to my friend, why just the simple provision of vaccines and medicines has taken so long. We've known about this outbreak for almost 60 days now, that the world has been calling on us, and particularly those from West Africa, for Canada to use its very ample resources to be able to provide some benefit, security, not just in vaccinations, but in equipment. And yet we still hear in the House today the government seeking this procedure and that procedure and looking to cast blame rather than provide information. So I'm wondering if my friend can comment on what he thinks the barrier has been for the Conservatives to actually move the medicines to people who need it most and to provide some of the protective equipment that they've been calling for almost 2 months now. Thank you.
Honourable member for Winnipeg North.
Yes, thank you, Mr. Speaker, and I appreciate the question. I think that what we need to recognize here is that this has actually been an issue since September of 2013, Mr. Speaker. In fact, it was December 2013 where it became really well known and understood to be a serious problem, and the virus has grown. The government of Canada, or Canadian government, didn't really get engaged until the April 2014. There's no doubt, Mr. Speaker, that we have been slow in terms of trying to address this particular issue. But having said that, the purpose of this particular motion that the Liberal Party has put forward today is to ensure that there is going to be twice a month a standing committee that's going to be reviewing exactly what it is that Canada has done, what it is doing, and just going forward. Mr. Speaker, it is of the critical importance that we recognize that Canada as a country does have a leading role to play in the world in fighting the Ebola virus. I made reference to even my own home city of Winnipeg in terms of the lab and the vaccine that is, in essence, coming out because of fine work by many brilliant minds here in Canada. We have a role.
Resuming debate. Reprise de débat. The honourable member for Mississauga South.
Thank you, Mr. Speaker. Let me begin by letting you know that I'll be splitting my time with the member for Huron-Bruce. And I will also tell you, Mr. Speaker, how pleased I am to address the House today on this critically important issue. Canada is fortunate to be among the countries that remain free of Ebola, and as a country we have been at the forefront of the international response efforts in West Africa. There are overwhelming reasons to help the countries that are not as fortunate as our own. It's also very clear that by helping our Ebola-affected West African partners, the government is also further safeguarding Canadians' health and safety. As you know, the Ebola outbreak in West Africa is unprecedented in its scale, geographic reach, and humanitarian impact, as well as social and economic impact, which will be felt for a long time to come. The developing world is ill-equipped to manage a health emergency of this kind. The crisis is evolving in a context of chronic fragility in places of high poverty and after decades of conflict and civil strife. While there are no confirmed cases of Ebola in Canada, Canada must be prepared for a case to come here. Provincial and local health officials are the lead on any Ebola case in Canada, but the Public Health Agency of Canada continues to assist them to ensure that they remain prepared. Mr. Speaker, the increase in the number of cases continues to accelerate, particularly in Liberia and Sierra Leone, where weak healthcare systems are ineffective in controlling the spread of the virus and treating those who are infected. People are dying of Ebola, but they are also dying of other health problems such as malaria because they don't have access to the basic services they need. It has become nearly impossible to keep up with the growing medical needs of populations which grow sicker by the day. In addition to the health burden, the disease and efforts to contain it have disrupted trade and the rain-fed agricultural season, both primary livelihood sources in the region. The Ebola virus is reversing hard-won progress after difficult chapters in the history of some of the affected countries and keeping people from supporting themselves and their families. Mr. Speaker, according to the World Health Organization, as of October 17th, more than 9,211 cases of Ebola and there have been that many, and more than 4,554 deaths from the disease were reported in Guinea, Liberia, and Sierra Leone. I would also like to acknowledge the valiant work of West African countries, many of whose healthcare workers have tragically died as they worked to contain this outbreak. As of October 14th, Ebola had affected 423 healthcare workers, killing 239 of them. The World Health Organization has warned that there could be 5,000 to 10,000 new Ebola cases per week by December of this year if the international community fails to act. Right now, this outbreak has the world's attention, and deservedly so. There are very sound reasons to treat this situation with great urgency and seriousness. But if history has taught us anything, Mr. Speaker, it is that few challenges cannot be overcome by the determination and resources of a united and committed global community. And in the face of an unprecedented challenge, the world is capable of unprecedented action. We know what needs to be done, and the tools exist to do it. We are at a turning point where it is critical to respond to the rallying cry for help if we hope to contain this devastating disease and treat those who have been affected. I've been very proud to see that Canada has been at the forefront of the international response to this outbreak. We have committed over $65 million to the United Nations and others to improve treatment and prevention, improve health capacity to save lives, and support basics such as nutrition. We need to combat the disease as well as the fear and ignorance that surround it if we are to be successful. On September the 18th, the United Nations Security Council declared the Ebola outbreak to be a threat to peace and security in West Africa. As UN Secretary General Ban Ki-moon acknowledged last month, this has become more than a health issue. It is now a social and economic one as well, with regional implications. As a result, the UN announced the deployment of a new Ebola emergency health mission to bring together the full range of UN actors and expertise in order to support national efforts in affected country. UNMIR is the first ever UN emergency health mission set up in response to the unprecedented outbreak. The United Nations, and the World Health Organization have declared the outbreak of Ebola virus disease in West Africa both a public health emergency and a complex crisis requiring a range of measures. With our recent announcements, Canada is among the key donors to the Ebola crisis response. Canada recognized early the risks that this Ebola outbreak represents and has already made significant contributions in support of humanitarian and security interventions to help contain its spread. Ours is a whole-of-government approach, which includes contributions from our embassies in affected regions, the Department of Foreign Affairs, Trade and Development, the Public Health Agency of Canada, and Transport Canada. Canada's funding will support the international efforts to stop the outbreak, treat patients, ensure essential services, preserve stability, and prevent outbreaks in surrounding but as of yet unaffected countries. Up to $18 million of this new funding will go to the WHO and the International Federation of the Red Cross and Red Crescent Societies to strengthen the medical response in Ebola-affected countries, as well as assisting non-affected neighboring countries. They will also help prepare local health structures in how to deal with people who have contracted Ebola. Up to $13.5 million will be contributed to the World Food Program and the UN Ebola Multi-Partner Trust Fund to meet critical gaps in the response, as well as the logistics and transportation needs of responders. And finally, Mr. Speaker, up to $20.5 million will go to UN and World Food Program to provide health education to communities and improve access to basic services, including food and water. This will provide a foundation for greater local engagement on the dispelling of fears surrounding the disease, as well as expanding prevention and community care services for Ebola patients. We are providing on-the-ground laboratory diagnostic support in Sierra Leone through the deployment of scientists from the Public Health Agency of Canada, and also supporting experts to be sent through the Red Cross and UN operations. In addition, Canada donated up to 1,000 doses of experimental vaccine developed in labs in Canada to the WHO so that they can be made available as an international resource. The vials represent 2/3 of the total vials of this experimental vaccine currently in the possession of the Public Health Agency of Canada. Canada will keep a small supply of the experimental vaccine to conduct research and clinical trials on safety and efficacy. We will also keep some vials in the unlikely event they are needed in Canada. Already these vials offered for donation are on their way to the WHO in Geneva. The first shipment left yesterday. The vaccine vials are being sent in 3 separate shipments as a precautionary measure due to the challenges in moving a vaccine that must be kept at a very low temperature, minus 80 degrees is my understanding, at all times, and in the event that there is an accident during shipping. The WHO has determined that there are some important safety and ethical considerations that it needs to resolve before the vaccine vials can be given to people. The global community, under the leadership of the WHO, are making progress addressing those issues. There are also logistical challenges. Canada stands ready to support the WHO, and we expect to see our donated experimental vaccine deployed as quickly, ethically, and as safely as possible. Canada welcomes efforts to strengthen the coordination of efforts through the new UN mission for Ebola emergency response, and we have called for an integrated plan that outlines the roles of all groups and countries involved. Canada will continue to explore how we can further respond, acting on the humanitarian assistance that is the clearest expression of our shared Canadian values. Mr. Speaker, Canadians stand with the people of West Africa during these extraordinarily challenging times, and with all those on the front line fighting the Ebola outbreak in this region. And in that context, Canada remains committed to working with our partners in the international community to help stop the outbreak, treat patients, and meet humanitarian needs. Thank you, Mr. Speaker.
Questions and comments? Questions et commentaires?
The Honourable Member for Charlevoix-Saint-Charles. Thank you, Mr. Speaker. I would like to ask some questions to the member. The NDP believes that it's important that the Canadian public be informed and that this information be as exact as possible. I attended a press conference from the Minister of Health of Quebec earlier this morning, who was accompanied by several doctors and groups, and they gave a lot of very detailed information on the way that they would react if ever there were Ebola cases here in Canada, and particularly in Quebec, given that it was the Quebec minister. Canadians need to be able to trust the government and the Public Health Agency of Canada to ensure their safety. Can the member please tell us what they have proposed to inform Canadians?
Member for Mississauga South.
Well, thank you, Mr. Speaker. I would agree with the honourable member that Canadians do need to be kept informed. Certainly, we are doing so in many ways. Not only this House, but this government. In particular, the Public Health Agency has provided a series of infection control guidelines, including Ebola-specific guidance. But as far as the measures that the Canadian government has taken, those are absolutely available online, public information, because Canadians want to know that Canada has committed over $65 million in support of humanitarian effort as well as security interventions related to the spread of the virus. They want to know that we've provided 2 mobile lab units in Sierra Leone and scientific expertise on the ground in the countries in West Africa that are most affected. They want to know about the personal protective equipment that we've sent. So absolutely we're doing everything we can as is the government of Canada to let Canadians know that Canada is at the forefront of helping in this terrible crisis.
Questions and comments? The Honourable Member for Kingston and the Islands.
If I could follow up on something that the Prime Minister said during question period, which it sounded like there was some uncertainty as to whether the government would be voting in favour or against the motion today. And I was wondering if by now, which is, some time has passed, I was wondering if the member knows whether she will be voting for or against the motion.
The Honourable Member for Mississauga South.
I thank the member from Kingston and the Islands for that question, and I did note with interest today his question in question period about medical personnel, and so I wanted to thank him for both of those questions. I certainly think that the motion on the table has merit, and I think he'll have to wait to see how we're going to vote, see how I'm going to vote until the vote occurs. Thank you, Mr. Speaker.
The Honourable Member for Don Valley East.
My colleague for her Thank you, Mr. Speaker, and I thank my colleague for such a succinct report on what we as Canadians are doing for Ebola and to control it, etc. I have to say that having visited my own local hospital, the North York General Hospital, they have set up laboratories available with ready set to take care of any Ebola issues, and they have their own units for isolating people if anything else like that happens. And so my question to my colleague is, how prepared does she think that we in Canada are, particularly in the larger centres, in actually dealing with these issues of Ebola entering our country? Thank you.
The Honourable Member for Mississauga South. You have about a minute.
Thank you, Mr. Speaker. I want to reassure the member for Don Valley East that indeed Canada is well prepared and is continuing to be vigilant in the face of this very serious problem, and we are improving our systems and our level of preparedness every day. Canadian hospitals have strong systems and checks in place, control systems designed to control the spread of the infection, to protect healthcare workers, and to provide the best possible care. We have had in the past experience with SARS and H1N1, which has increased our level of in preparation for these types of emergencies. And the Public Health Agency of Canada has provided a series of guidelines which will be followed as well in the case of an outbreak or any kind of case in Canada. Thank you.
Resuming debate. Reprise de débat. The Honourable Member for Huron-Bruce.
Thank you very much, Mr. Speaker. It's a pleasure to rise in the House today and discuss this motion. Just to review it, the motion is that the House recognize the devastation that Ebola is wreaking in Western Africa and the serious threat to public health that the virus could pose to Canada, and call on the Minister of Health, the Chief Public Health Officer of Canada, and the Minister of Public Safety to appear before the Standing Committee on Health twice monthly to report on Canada's efforts at home and abroad to ensure that the outbreak does not pose a threat to the health and safety of Canadians. So that's the motion that we're looking at, and I guess the attempt from the Liberal Party here is to have these people come to committee, which I'm a member of the Health Committee, and report back to the committee twice a month until further notice, I guess. There's no start time. There's no end time. There's no nothing in the motion that mentions that the Minister of Development appear, who would also be a liaison in this. I really disagree with basically the entire portion of the motion itself. And the reason I say this is the fact that if you go on the website of Health Canada, they have everything they're doing. It's right there in real time. The minister and the chief public health, they've had press conferences. They put out press releases. It's in the news every evening. So the information is out there. The information is getting to Canadians. The province, all the provinces are working together. They're working with the minister. They're working with the public health units, the local health units as well. And actually, in Ontario, the Liberal government and the Liberal minister, Dr. Eric Hoskins, actually complimented the minister on television a few days ago and pointed out what a great working relationship they have on this issue, and how provinces, ministers, public servants, everybody involved, and obviously all the health officials are working to make sure, A, that Ebola doesn't come to Canada, but most importantly, if it does come, that they have the ability to recognize it, detect it, treat it, and make sure that the healthcare officials that are providing frontline care are protected when doing their job. That is, I think, an important comment, that when you hear somebody from a province who, in this case, is a different party than ours, complimenting and rising above partisanship and actually stating the facts as what is taking place. I feel that's what I feel, and I feel that the idea behind a lot of this is recognizing the fact, what's the federal government's role and what are the province's roles and the local health units and the local hospitals. So I think each area is doing their job, and they're working collaboratively. Just the other day, the response team, federal response team, was in Nova Scotia doing a trial run. And again, a further example of how each level of government is working, each agency is working to make sure that it is done correctly. We have been doing what's been asked of us by the WHO. We have delivered both in dollars, in personal protective equipment that we've sent over. So we've been there. Obviously, we want to work with the WHO to make sure that we're addressing the issues in Africa, that we're trying to contain the issues there so that they don't spread to Canada. Travel advisories are obviously been set up, and other air traffic coming into Canada, direct flights are not available in many cases. So these are important facts to show what we have done. But back to the point about the actual process that the parties brought forward, the Liberal Party, on this motion. The committees themselves, the actual mechanics of the committee is maybe not the best avenue in my mind for this work to be done, and I'll point out why. Because the way they're set up in the standing orders in the committees, basically you'd have the minister there, as it would read, the chief public health officer there, and the public safety minister would be there, and they would each have 10 minutes or 15 minutes to present their information. Well, that information is already in the public domain, all that information, and it's available. And the Liberal Party would have 7 minutes to ask questions. Canadians are being informed. That's the point. Canadians are being informed. Anything that would be presented at the committee is already in the public domain. If members of Parliament, and specifically the Liberal Party, if they need information or they want information, the minister literally sits right across from them. If they had a question, they could come over and ask her during question period. They know all the minister's staff. They could contact their staff. The information is flowing. There's not a problem with information. All the information is in the public domain. The other important thing is that we're not resting on our laurels. We are working, like I said, with World Health Organization, but we're also monitoring very closely what has taken place in Texas and working with the Centers for Disease Control to make sure that if there are any areas for improvement, that we are taking those actions. So it's important to recognize that you can always improve, you can always do better, you can always find ways to make those important frontline healthcare officials as safe as possible, because we do know how these are transmitted. We do know how it is transmitted. Now, one thing I wanted to talk about here with prepared notes is was one of the institutions or institutes, and it's the Institute of Infection and Immunity, or III, and CIHR supports the research and helps build capacity in the area of infectious disease and the body's immune system. In addition to supporting research, III plays an important role on infectious disease issues in Canada, including helping to coordinate Canada's rapid research response to infectious disease outbreaks, especially those caused by new and emerging pathogens. To respond to these emerging threats, CIHR's III has led the effort to strengthen Canada's vaccine research landscape through strategic investments, leadership, and partnership activities. For example, starting in 2006, CIHR III led the development of the Pandemic Preparedness Strategic Response Initiative, and our government made an investment of $21.5 million. So you see, a lot of these investments have been made some time ago so that we are prepared as a country to protect our citizens from these outbreaks. It showed tremendous leadership in developing this initiative by forming linkages and building partnerships with provincial, federal, and international stakeholders. Like I mentioned earlier in my comments, these partnerships increased the total amount of available funds for research from $21.5 million to $43.3 million. This investment allowed CIHR to support more than 92 projects involving 345 researchers across the country. These projects supported through this initiative produced a variety of research and commercialization outcomes. For example, over a third of the projects researching vaccines and immunization produced results that could lead to a new drug or vaccine. So, Mr. Speaker, there's no doubt about it. We have done a great job both working with our partners abroad and locally, and I think all should be commended to this point. I do have an amendment to the motion, and I move, seconded by the member from Yukon, that the amendment be amended by A, replacing the words "the relevant minister and ministers" to appear twice monthly with "the Minister of Health," and B, replacing the words "monthly" with "as soon as possible" before. Thank you, Mr. Speaker. I'll now take questions.
Order, please. In order for an amendment to an opposition day motion to be put forward, the mover must have the approval of the mover of the original motion. I see that the honourable member from Vancouver Centre is here. Does she give consent for the amendment?
No, Mr. Speaker.
In that case, questions and comments. Questions and comments. The honourable member for Winnipeg North.
Thank you, Mr. Speaker. I know that it's interesting in terms of the presentation the member has made in regards to the motion. I think it's a genuine attempt to try to recognize that the government does have a responsibility, and all indications, at least in some of the discussions I've had with some of his colleagues, is that they're at the very least open to the amended motion as it's currently being debated. My question to the member is, does he not recognize that there's a totally different atmosphere in terms of going into a standing committee when you're meeting with for 2 hours, and there's an opportunity to create a lot more dialogue than there would be during a question period or something of that nature, that in fact Canadians would benefit by having a committee where you get these different ministers dealing with an issue that is of great importance?
The honourable member for Huron-Bruce.
I thank the member for his question, but I'll go back to the point I made. If they want any information that they somehow can't get a hold of, the minister sits right in front of them. They could go over at any time and ask, and if they still feel like they need more time, they could arrange for a meeting with her in her office, her staff, the parliamentary secretary. Any information that isn't, or they have questions about, they can do it. And my point was, if they have questions, they have 7 minutes in that committee meeting. Well, I've witnessed for years the questions, and usually they have a 6-minute, 59-second question and 1 second for an answer. What I'm trying to tell them is, why don't you just arrange, if you want to have a meeting, meet with the minister, meet with their staff. They're always willing and available to have a meeting, and it's a far better use of everybody's time, and they're going to have the ability to ask more questions. I think it's a great thing.
Questions and comments, honourable member for Parkdale High Park.
Thank you, Mr. Speaker. And obviously, the NDP believes that the Canadian public needs to be well informed when it comes to situations like a health crisis. People want to know that they and their families are protected by the government, and they need to have faith in the government and their public health agencies to be sure of their safety and security in these situations. And I want to ask a question specifically about the vaccine, because the government was slow to get the vaccine to trials. And with respect, the member opposite has said, well, you can ask a question of the minister, but we have not, the leader of the opposition has been asking this question. We've not been able to get the answer. The government sold the rights to a made-in-Canada vaccine for Ebola for only $200,000, and the Americans were able to get their vaccine to trials 1 month before Canada did. And the minister has done nothing to expedite the trials. So my question is, what steps did the government take to get the vaccine to trials before September? And why did they fail to intervene and ensure that this vaccine was available?
The honourable member for Huron-Bruce.
I thank the member for the question. And my thoughts are, a lot of the time, the NDP just get it plain wrong. And I think it's been proven through the years that they do get it wrong. And the point is, the front line workers, okay? The front line workers. The vaccine's one thing. The front line workers, okay? They are getting prepared. They are preparing. They're improving every single day to make sure that Canadians are safe and protected if there was a case of an outbreak. Okay, that's the most important thing. The vaccines, that's one thing. Granted, it's one thing, but based on the evidence and the facts that we have today, the priority needs to be sure that if there is an outbreak, that all the frontline workers are protected, they've been educated. It's a big job. And we've heard from the Liberal Health Minister in Ontario, Dr. Eric Hoskins. We've all heard what he's had to say, and he feels very confident. He's obviously concerned. He has a big job to do. But he complimented the way our government is working with their government, and we're doing that from coast to coast. So I think the NDP should get on board and work with the minister a little better in what they do.
Resuming debate, the honourable member for Trinity Spadina.
Mr. Speaker, I rise today to support this motion, but to do it based on my experience, largely based in Latin America and doing development and aid work primarily in El Salvador. And the experience that I had in El Salvador informs the approach that I think is missing on this file, and highlights, I think, some of the challenges we have when we look as a country to what's happening. And it's one of the reasons why bringing responsible ministers to committee and probing them on this issue is about more than just simply addressing the immediate, important, and vital concerns around Ebola and its spread in Africa and the possibilities of spread to other countries, But it's also about trying to figure out how we can change our approach to these situations so we stop having to find ourselves in a position of constantly responding to crisis and rather rearrange and restructure and rethink our foreign policy and our support of developing countries in such a way that we actually are practicing preventative measures so that we protect populations from crisis and protect these situations from arising. I do have some experience with friends who have done work in Africa, and one in particular who has run several large refugee camps in Africa and is now working for an aid organization out of Washington. And one of the things the West continuously does, and countries like Canada and other developed countries constantly do, is that they decide what's best in their interest as their approach to foreign policy and development work, instead of taking a look at what's working and what's effective in the countries where they're trying to do work. And in particular in Africa, what was found through research was that Western countries and European and North American countries were more focused on saving money in the delivery of aid than actually delivering aid effectively, and in particular around food, where Africa has had huge challenges with malaria, with AIDS. But the drought and famine dynamic in Africa has actually fostered the spread of disease. Because we haven't built an infrastructure, a transportation infrastructure, to deliver aid to where people need it and where people are living, what we've done is created centers where people have to come to those towns or centers inside geographic areas to get food, to get medical resources. They get concentrated around these aid camps. They pick up disease that are then shared amongst different people from different regions of the affected area, and then they go back into smaller communities and spread those diseases. In fact, we have become agents of contaminants and of disease because of precisely the way in which we deliver aid. And this is a significant problem, and it needs to change. And the way it needs to change is to switch our foreign policy from one of purely economic development and looking for opportunities to exploit economically on behalf of Canadian companies, and to get back into the process of developing the social and physical infrastructure required in these countries to manage their public health, local government, and social capacities in such a way that we prevent the problems from spreading. I'm a new member, and I neglected to inform the Speaker that I will be splitting my time with the member from Random, Buren, and St. George's, and I apologize for that. But to return to the issue at hand, we need a foreign policy. And in fact, we need in this current situation to develop an aid policy that actually builds capacity. If you take a look at the on-site conditions in places like Liberia, there are no public ambulances. Not a single ambulance in that country is operated by a public entity. I recognize that perhaps there's some on the other side that think that all health care should be privatized, but the trouble with having a privatized health care system like that is there's no effective way in an epidemic to deliver patients to hospitals safely, to deliver medicine and goods to hospitals across a country safely if you don't have effective public intervention in the transportation system. This is a problem. We've also seen with the ravages of AIDS and the dynamic of depleted professional populations through these various epidemics, what we've seen is that doctors and the intellectual capacity of some of these countries has been significantly challenged by the way in which they have to manage these crises. And as a result of that, doctors, laboratory assistants, the very expertise we need to combat this on the ground is not present in some of these countries, and the hopes of developing it are extinguished when we invest not in universities and training, but rather simply look to exploit minerals or other economic opportunities. We need to change the way we do foreign policy and reinvest our dollars and our capacity as a country and share our intellectual knowledge and our financial capacity into restructuring, rebuilding, and reinvigorating the social capacity in these countries. That isn't happening. When you have a foreign policy driven by trade and not by development, what ends up happening is that when one of these tragedies emerges, the capacity for the country to respond isn't there. It's why we send a field laboratory into Africa rather than simply facilitate the construction and arrival of a permanent laboratory in this part of the country that could do other work after Ebola disappears, hopefully. It's also why when you see, in these sorts of catastrophes, in a country like Liberia, one of the largest producers of rubber, they have no capacity to manufacture their own rubber gloves or protective gear. It's mind-blowing in terms of the simplicity that you could drive into a situation like this by actually moving to create capacity, as I said, in these countries. Canada has other things it can share beyond simply sending drugs here, there, and everywhere, and sending temporary support to these countries. For example, the SARS epidemic, which took root in Toronto when the epidemic spread to this country, we have developed some of the finest public health protocols. But those health protocols are contained within our borders. We have not set up the capacity to train public health workers in other countries. We have not used our acquired intelligence on these things to pursue a policy of actually developing capacity in these countries. Again, we return to a trade-based foreign policy instead of a social development policy, and as a result of that, these crises emerge, and they emerge unchecked in countries that are struggling to provide the basic services to their very people. I said I worked in El Salvador, and I've delivered aid directly to municipalities in El Salvador. It was not a program supported by the federal government. It was a program supported by the City of Toronto that saw us taking decommissioned ambulances, repairing them, driving them to El Salvador, and building the only public ambulance capacity in that developing country as a city-to-city initiative. We as a country have the capacity, have the resources, and have the expertise to build and develop this capacity in Africa in places where not only Ebola, but other diseases and famine and civil war are destroying civil society. We need to reinvest in our capacity to create civil society. And one of the reasons bringing the right ministers, and the one comment that was made across the aisle that I think is an important one, is bringing more than just simply the health ministers to bear, bringing the development minister and the foreign affairs contingent of the executive branch of government is critically important, because we need to start to reorient our approach to foreign aid in such a way that, as I said, we build capacity. That's missing from this debate, and a focused and a sustained conversation through committee is the way to start to change the way this government, our country, responds to international dynamics. We need to do this, and we need to do it in a way that allows for this country's capacity and this country's talent to shine on the international stage, rather than simply respond and deliver the same message time and time again, that it's all about trade, that somehow trade is going to stop a disease from spreading, that somehow trade is going to build capacity in a country where quite clearly the capacity has not been built, despite the fact that Liberia's gross domestic product has been outpacing most of Africa, growing at a rate close to China for the last 5 years. That growth is now significantly threatened. And so to close and to wrap up my comments, this is the direction that the Liberal Party hopes to take foreign policy. This is the direction that we hope to focus debate through committee with, and that's why we're asking members of this House to support the member's motion.
Questions and comments? The Honourable Parliamentary Secretary to the Minister of the Environment.
Thank you very much, Mr. Speaker, and I want to thank my colleague for his speech. I was listening carefully. And one of the things we learned in the House, I think you, Mr. Speaker, remember the H1N1 and the importance of communications and getting the messages out to Canadians. Now, the member opposite, I'm going to ask him, does he feel that the all-parliamentarian briefings, the numerous press conferences, daily question period appearances are insufficient to keep Canadians updated? Because I feel, Mr. Speaker, and from experience, that our public health officials should be actually working at their jobs during issues like this. They should be out there working to communicate with Canadians directly and their international partners, to work internationally to see if we can work together to solve these issues. So why does he think that everything that's out there that's being done is not sufficient enough to keep Canadians updated?
The Honourable Member for Trinity-Spadina.
I thank the member for the question. I think that one of the great challenges in the modern world is effective communication, and I think that while we have sometimes pat answers to very complex questions posed in question period, the inability to probably even follow up and to get detailed answers beyond talking points is frustrating many of us who are trying to communicate with our constituents, but communicate more importantly with all Canadians. I think that the committee allows for us not to necessarily communicate directly, not to frustrate the rank and file and the members of the public service that are doing the work day in and day out, but to talk to the leadership from the parliamentarians of this country, specifically about ideas, strategies, and emerging issues, as well as explore new courses of action which are cropping up around the world and are being presented to us from different locales right around the globe, and allows us to focus efforts and communicate and explore the issue, but also to create more effective policy. And I think the problem with simply relying on a website or relying on sitting down in private with the minister and talking about this is that new ideas don't see the light of day, and as a result of that, our approach stays locked in a process which, quite frankly, has failed these countries and has failed this country in terms of its international reputation.
Questions and comments? The Honourable Member for Parkdale High Park.
And I thank my colleague from Toronto for his presentation. And I have to say that the way we deliver aid certainly is an area where Canada can improve greatly, and it's something that I also have experience in, and share the concern about that. I just want to take a moment and thank both the Leader of the Opposition, the official opposition, and the Member of Parliament for Vancouver East for all their work on this file. And specifically, the member from Vancouver East has raised a number of very, very serious, specific, important questions that I think this motion is trying to get answers to. And it was regarding Canada's emergency preparedness. And I'd like to cite just quickly from a letter that the member from Vancouver East has sent to the Health Minister, and she asks a number of very practical questions we still don't have answers to. Who's responsible for ensuring quarantine and treatment protocols for Canadians? What communications have been undertaken by the Public Health Agency to inform Canadians? What kind of screening protocols are currently in use at ports of entry? What kind of precautions will protect Canadians in West who are returning?
If the member has a question, she can put it. If not, I'll go to the Minister from Trinity Spadina.
There were just so many questions that remained unanswered.
Right.
I'll ask my question
I
directly.
appreciate that another honourable member had many questions. The question is, does this member have a question for the Speaker?
Thank you, Mr. Speaker. My question is, are these the kinds of questions that the member from Vancouver East has been trying to get answers to that the member from Toronto perceives would be answered by getting the minister to the Health Committee?
The honourable member for Trinity Spadina.
One would hope. And one would have expectations in good faith that those are the sorts of answers that we would receive with the sort of questions that we've composed and tabled in the House as questions that need serious answers. But my speech focused on not just the emergency response and the reactive capacity of government, but we need to also start to probe and start to put together a program which is proactive, which is actively engaged in creating capacity in countries in Africa, but also in Latin America and also in Southeast Asia. It is not good enough to simply keep responding to crises, whether it's the housing crisis or whether it's the crisis in the Middle East or whether it's the crisis here in Liberia and Nigeria and in the countries of West Africa. This country knows that if you prepare for problems ahead of time, you mitigate the impact of disasters. You may not be able to prevent them, but preventative action is just as important, in fact, even more vitally important to invest in, especially in developing countries. And so, yes, there are questions about the reaction of the government, but we also want to steer this government back into a role that traditionally Canada's played, which is being proactive and anticipating the need to build civil capacity in developing countries, a thing we've done proudly in the past, but seem to have abandoned in favor of a trade-based foreign policy.
Before we resume debate, I have the honour to inform the House that a message has been received from the Senate informing this House that the Senate has passed the following bill to which the concurrence of the House is desired, Bill S6, an act to amend the Yukon Environmental and Socio-Economic Assessment Act and the Nunavut Waters and Nunavut Surface Rights Tribunal Act. Resuming debate, the Honourable Member for Random Borough St. George's.
Thank you, Mr. Speaker. I rise today to speak in support of this important motion from my Liberal colleague, the Honourable Member for Vancouver Centre. The Ebola outbreak in West Africa has been described by the United Nations as a crisis unparalleled in modern times. Never before have we seen an outbreak of Ebola this large, severe, or complex. According to the World Health Organization, as of October 12, 2014, a total of 8,973 cases and 4,484 deaths have been reported in Guinea, Liberia, Sierra Leone, Nigeria, with an additional death recorded in both Spain and the United States. Clearly an unprecedented global health crisis requiring an unprecedented international response. And yet, in the words of Doctors Without Borders International President Dr. Joanne Liu, the international response has been lethally inadequate. The disease has taken its toll on healthcare workers in West Africa, with 427 infected and so far 236 dead. After seeing the price being paid by brave healthcare workers in the region, I was deeply concerned to read reports that even after the Ebola outbreak began, the Canadian federal government chose to sell off, rather than donate, roughly $1.5 million worth of stockpiled medical equipment at bargain basement prices, even though this very equipment is urgently needed. Global Medic's Director of Emergency Programs estimates that 130 of the 150 pallets of personal protective equipment his organization has shipped to Sierra Leone and Liberia came from the Public Health Agency of Canada's stockpile that was sold off at an auction. This, Mr. Speaker, is simply unacceptable. How was it allowed to happen? Surely healthcare workers fighting the Ebola crisis in West Africa need masks more than the Canadian government needed the $50 it reportedly received for 500,000 masks sold at an auction. However, as we have seen through the tragic infection of healthcare workers in Dallas and Madrid, even the well-equipped, sophisticated medical systems of the West are not immune. My Liberal colleagues and I are concerned about the recent cases of Ebola that have emerged in North America and the government's minimal communication to the public and to Parliament on the level of Canada's preparedness. At any outbreak, clear and open communication is key to both the coordination of prevention efforts and reducing fear and confusion. That is why I'm calling on members of this House to support the motion from my Liberal colleague, the Honourable Member for Vancouver Centre. Providing regular and frequent updates are essential measures to keep Canadians safe and informed about the Ebola virus disease. Having key members of the federal government appear before the Health Committee on a twice-monthly basis to inform Parliament and Canadians on the specific measures they are taking to ensure the Ebola virus does not pose a threat to the health and safety of Canadians is an important part of that motion. Hearing from experts such as the Chief Public Health Officer of Canada and from the ministers responsible for Canada's response would help to ensure Parliament is kept informed and that Canadians receive timely updates on the government's actions. Having the ministers and the Chief Public Health Officer appear before the Health Committee would also allow members to question the government on, for example, what precautions are being taken for the Canadian Border Service Agency at land and marine crossings, in addition to airports. These are areas the government has not been clear about. Being open and transparent are essential to keeping the public informed and reducing confusion about the dangers these diseases pose to our country. Recent false alarms throughout Canada, however, have shown the strength of the Canadian medical system and the professionalism of our public health professionals when they have the information and the resources they need. Earlier this month, for instance, Eastern Health in Newfoundland and Labrador undertook a series of simulated emergency preparedness exercises in 3 hospitals in St. John's. According to Dr. David Allison, Eastern's Health Medical Officer of Health, the purpose of this exercise is to further challenge and validate our procedures to ensure that possible cases of Ebola or other infectious diseases are correctly contained, diagnosed appropriately, and treated quickly. This past weekend, the Public Health Agency of Canada conducted a practice drill deploying one of its Ebola rapid response teams to Nova Scotia. This is an important exercise, and we believe that the agency must continue to work with provincial and territorial governments to ensure that regional hospitals are set up with the highest level of isolation protocols and treatment units if a case should reach Canada. Mr. Speaker, I know that I and all residents of Newfoundland and Labrador are comforted that we have such capable and dedicated public health professionals guarding against Ebola in our province. We should not, however, be complacent. This government has shown little regard for public health in the past. It was only this September that the government finally appointed Dr. Gregory Taylor as Chief Medical Officer, 16 months after his predecessor stepped down. To leave that critical job vacant for 16 months, even as the health crisis gripped West Africa and potential Ebola patients were being isolated in Canadian hospitals, is deeply troubling. The Canadian Federation of Nurses Union has also raised concerns about the lack of training and protective equipment in some areas. Every frontline health care worker throughout the country should be provided with training, and personal protective equipment should be made available. The recent exercise by the Public Health Agency of Canada in Nova Scotia is an excellent start, but these emergency preparedness drills should be held throughout the country to ensure coordinated responses in all provinces and territories. Furthermore, the Public Health Agency of Canada must coordinate regular meetings of professional groups like the Canadian Public Health Association, Canadian Medical Association, Canadian Nurses Association, and the Association of Medical Microbiology and Infectious Diseases Canada, to ensure members and member associations, such as the Newfoundland and Labrador Medical Association, are kept informed of updated protocols, evolving medical best practices, and risk assessments. These organizations have a vital role to play in making sure medical personnel on the ground are aware of early signs and symptoms of Ebola and how to deal with suspected cases in a way that protects them and everyone around them. I commend the selfless efforts of the many Canadian public health professionals who have already answered the call for assistance and have been taking on leadership roles in the medical response in West Africa. Currently, Dr. Ailish Cleary, New Brunswick's Chief Medical Officer of Health, is in West Africa working with a World Health Organization team to contain the outbreak. So far, 14 employees of the National Microbiology Laboratory in Winnipeg have gone overseas to assist with disaster response. And Doctors Without Borders and the Canadian Red Cross have mobilized Canadian healthcare workers to aid in the response. We owe them an enormous debt of gratitude and wish them a safe return home when their work is finished. These Canadians have put themselves at risk, Mr. Speaker, and have made incredible personal sacrifices to help fight this devastating epidemic at its source. Despite their efforts, the number of Ebola cases in West Africa is growing every day, and humanitarian organizations' capacity to respond is diminishing. This government has made many promises, but of the $35 million pledged this September, only $4.3 million has been committed, according to the UN Office for the Coordination of Humanitarian Affairs. Both at home and abroad, we need more transparency in the federal government's response to this public health crisis, and that is patently obvious when you watch the news, Mr. Speaker. And last night I watched a piece by CBC, it was on the CBC, by Adrian Arsenault. And it was heartbreaking when you look at what is happening in countries abroad with respect to Ebola. And to see people who are helpless, who are looking for help, and that help is not there. We have to do our part as Canadians. We have to do what Canada is known for doing, and that is being there to help in times of crisis. And unfortunately, it doesn't appear that we have been doing what people expect Canada to do, and that is be at the forefront of fighting a crisis like the one we're now experiencing with Ebola. This motion is an important step in the direction of making sure that we are aware of what's going on a daily basis, that reports are being made by those in a position to give us the information and to give Canadians, more importantly, the information so that we're able to deal with this crisis in a manner that will save lives, not see more lives lost. Thank you.
Questions and comments? Honourable Member for Vancouver Centre.
Mr. Speaker, thank you. Thank my colleague for a very, actually, well-researched and moving speech. I wanted to ask the member a question. We know that the Chief Public Health Officer of Canada actually has to report to Parliament as a Public Health Officer of Canada, and to report to Parliament through the Health Committee is an appropriate way to do so. I think this is about openness. This is about transparency, and this is about public accountability, because there are many questions that have not been answered in this House. There are many questions that have not been answered in both of the public press conferences that the Minister and the Chief Public Health Officer have had on Friday and on Monday. And those have to do, we've heard them, Mr. Speaker, they're about the vaccines, why did it take so long? They're about why is only a little over $4 million of $65 million promised received, and where is the rest, and why isn't it there? And we know that timeliness is important. So my question to my colleague is simply this. How else, let us imagine that no one else wanted to accept this motion, how else can we get accountability, transparency, and openness in the Chief Public Health Officer and in the Minister of Health, whose duty it is to actually coordinate and manage any infection that occurs in Canada and abroad?
The Honourable Member for Vandenberg, St. George's.
Thank you, Mr. Speaker. And I thank my colleague, the member for Vancouver Centre. First, I thank her for this motion, which is so important. And it is about transparency, and it is about knowing what is happening, and it is about knowing how the crisis, the Ebola crisis, is being dealt with. Never before have we seen a crisis as complex as this when it comes to Ebola. And as the member said, the reporting to Parliament is very important. But what it also does, it provides information to Canadians from coast to coast to coast, so that they have a level of comfort about what is happening in terms of how their country is dealing with this issue, and how, as a country, we're reaching out and helping in other parts of the world, which is our responsibility to do as a part of this global nation, Mr. Speaker. So yes, we need to have more transparency, more accountability, and in doing that, this is what this motion will do. And I'm hoping that everybody in the House will recognize that and support the motion by my honourable member for Vancouver Centre.
Hear, hear. Questions and comments? L'honorable député.
The Honourable Member for Montmorency, Charlebourg, Haute-Côte-Nord. Thank you, Mr. Speaker. First of all, do the Liberals really believe that calling on the Minister of Health to appear twice a month to protect Canadians is a good idea? I think this motion lacks some teeth. Would they be open to this, to amending it or to strengthening it so that it has more teeth, so that it, in fact, will do a better job of protecting Canadians?
The Honourable Member for Vandenberg and St. George's.
Mr. Speaker, I thank my honourable member for his question. I'm not sure what he's proposing, but at least what this motion is doing is bringing the minister front and centre and getting the answers that we're seeking, desperately seeking, to a lot of the questions that still remain with respect to this crisis. Let's bring all of the ministers who have a responsibility for public safety, and let's bring them in front along with the Public Safety Health Officer. So let's at least make that first step and see where we go from there. But when we're talking about transparency, accountability, openness, Mr. Speaker, this motion is certainly a step in the right direction, and if we have to build on that, we can. But right now, that is what we have on the floor before us, and let's do everything we can to provide Canadians that level of comfort as well as the rest of the world.
Great eye.
Resuming debate, the Honourable Member for York South Weston.
Thank you, Mr. Speaker, and I appreciate this opportunity to speak on a world crisis. I'll be splitting my time with the member from Saint Bruno, Saint-Hubert. Mr. Speaker, 11 years ago, Toronto was overwhelmed by a virus that arrived from Hong Kong called SARS. And I just wanted to give the House some appreciation of the impact. It is estimated that it cost the world $40 billion in healthcare and productivity costs, and we're coming close now to that figure for the Ebola crisis. Estimates of a $30 billion cost just in trying to corral the disease have come to light. And Canadians are saying to us in great numbers that Canada should be doing as much as it possibly can, including sending military response teams, which so far this government has refused to do. But I want to come back to the SARS experience, because my wife had a very personal experience with the SARS outbreak. She was diagnosed with breast cancer just after the hospital started closing in Toronto. And the hospital started closing in Toronto because the SARS outbreak was impossible to corral. People didn't really understand it. They didn't know what to do. So all of a sudden, her surgery to remove part of her breast was canceled because the hospitals were no longer accepting patients. Now she has a rapidly growing tumor in her body that can't be removed. Somehow, our family doctor managed to find a doctor willing to do the operation at a hospital in Toronto, and it was one of the most eerie and kind of disturbing experiences anybody could hope to imagine. I had to, late in the evening, pull up to the outside of the hospital, let her go in on her own. I was not allowed in. She had to check in with a security guard and then find her own way to the 11th floor, where she was the only person on the floor. She had to go to her own bed and wait there in the hopes that somebody would show up. That's how empty that hospital was. The next day, a surgeon and a small surgical team came and operated. And that experience was repeated over and over and over again in Toronto as Toronto tried to deal with the very real problem of trying to maintain a health system while the health system itself is under attack. And that's something that I'm not sure everybody here understands is one of the potential problems with this disease. This disease apparently is so easily spread that even healthcare workers who are taking extreme precautions, as has been the case in Dallas and in Spain, have become infected. That no one is really certain why these healthcare workers became infected because they shouldn't have been. They've been taking precautions. If that's the ease with which this disease can spread, Mr. Speaker, how are hospitals in my city of Toronto going to cope when and if a case of Ebola, and I don't think it's a matter of when, I think it is a matter of when, cases of Ebola start arriving in greater numbers than we've already experienced. There are currently 9,000 or so reported cases of Ebola in West Africa, and there is no travel ban. There is no limit on people actually traveling out of that country. The incubation period of this disease before any symptoms arrive is between 2 and 21 days, Mr. Speaker, and that means that people can be traveling while infected and not know it. And so we are apparently conducting some voluntary screening of some passengers who are coming from these affected places. But I'm very, very afraid that we are going to have a very serious problem should more of this disease make its inexorable travel to more countries, and including Canada. Mr. Speaker, the mayor of my city has learned, as have I, that the government has declared at least one hospital in Toronto and 10 in Ontario as special hospitals to deal with potential Ebola cases. And what the mayor is asking in a letter to the Prime Minister that I don't believe has been responded to yet, that he's asking for more details on the Government of Canada's plans to protect residents of Toronto and the GTA should any cases of the Ebola virus be positively identified in Canada and in Toronto. And a Toronto hospital has been designated to care for Canadian responders if any become infected in the Ebola zone in West Africa and are transferred back to Canada for care. So we have a situation, Mr. Speaker, in which the government has decided, absent the City of Toronto, that they will designate a hospital with all good intentions, I'm sure, but the people of Toronto should know what's going on. There should be some transparency, and the mayor has asked for that transparency, and we too would like that transparency. The member for Vancouver East has asked similar questions of the Minister of Health, questions about who is responsible for ensuring quarantine, about who is responsible for hospitals and the medical practitioners have the appropriate equipment. It's become clear that the appropriate equipment that we thought was appropriate isn't working because 20% of the victims of this virus are healthcare workers. That means that they are not being able to protect themselves. And as we found out, two, one in Texas and one in Spain, have become infected while caring for a patient with all of the West's most modern equipment. So something is wrong with the approach we are taking, Mr. Speaker. And there are a number of other questions that I won't go through reading, but those questions deserve an answer, Mr. Speaker, and the Minister of Health needs to respond to our critic for health to be able, so that we can have a dialogue, so that we can begin the process that this Liberal Opposition Day motion would like to continue, which is to continue the process of providing information to members of Parliament through the committee on a twice-monthly basis. Now, that in itself isn't enough. There will need to be a whole lot more done, Mr. Speaker, but it is a good start, and we will be supporting this bill. The other thing I wanted to mention, Mr. Speaker, is that in my riding of York South-Weston, there is a company called Tag Designs that 2 years ago developed a system for hospitals to use to protect themselves, to protect healthcare workers and others from the transmission of infectious diseases inside the hospital. And that system was a system of signage. It was a system of making sure that that doors were sealed, that doors had signs on them to say this patient behind this door requires this kind of protection for the healthcare workers. And we wrote to the Minister of Health at the time and asked for a meeting to discuss whether or not this kind of system, which the WHO is very interested in, which Canadian hospitals that have tried it have found to be very effective. And we've asked the Minister for a meeting to discuss how the Government of Canada can assist in promoting this kind of inside the hospital protection against the transmission of infectious diseases. Unfortunately, the Minister refused to meet with us, and so we have an indication from this government that really not interested in proactive measures to protect healthcare workers from the spread of infectious diseases, and not just the healthcare workers, but other people who are using those hospitals, Mr. Speaker. So we have a situation in which we know the government would rather kind of just let things take place. Apparently, they have designated a hospital, we don't know which one, as the place where people will go. We don't know whether that then will require the closure of that hospital. If a hospital is declared as the place that Canadian healthcare workers go if they contract Ebola, and that hospital is in my city, I'd like to know. And I, as the medical staff of that hospital, would probably like to know that that hospital has been so designated so they can start planning around it, so they can start determining whether or not they have to rearrange the schedules of surgeries and of other care for patients who are there, because it's quite likely that, given the experience in Texas and Spain, that if a number of patients of Ebola arrive in a hospital, we're going to see it close. We're going to see that hospital become itself quarantined, Mr. Speaker. And that is an effect of this disease that has yet to be discussed in any forum, that has yet to be discussed. It's been asked about by our mayor and by others, what are the government's plans? But as of this moment, Mr. Speaker, we don't have answers, and we need those answers, and this motion will help give us those answers. Thank you, Mr. Speaker.
Questions and comments? The Honourable Member for Vancouver East.
And I'd like to thank my colleague for his very thoughtful comments on this important debate that we're having today. And I also want to thank him for sharing his own personal family experience, and because I think these things matter a lot in terms of impacts in our healthcare system. Certainly in the NDP, we've been raising this issue of the Ebola crisis almost every day in the House. The member of the official opposition, the member from Outremont, others in our caucus, we've been raising it with the Minister of Health, and there are so many unanswered questions. And I wanted to just make a comment to the member, because I think he does understand very well the importance of healthcare infrastructure, which we do have in this country. We need to have the protocols in place, hence some of the questions in the letter that we sent to the Minister. But in terms of West Africa, this is a very critical issue of not having basic health infrastructure, whether it's clinics, delivery systems, access to healthcare, primary healthcare in place. And I wonder if the member would comment on that in terms of the importance of Canada supporting that kind of long-term initiative.
The Honourable Member for York South-Weston.
Thank you for the question, clearly it is in Canada's best interest as a country and as a people to ensure that diseases such as Ebola are contained where they break out. And they will not be contained if the places they break out don't have the adequate resources and public health systems in place. The U.S. government has actually started supporting the creation of public health systems in third world countries. We have not. Our approach has been to give money to mining companies to create some systems in those countries that are not related to public health. And we need to be ever mindful and ever vigilant that these diseases, which are springing up in more than the usual number, need to be corralled and controlled in the locations where they break out. Thank you, Mr. Speaker.
Questions and comments? The Honourable Member for Winnipeg North.
Mr. Speaker, I appreciate the comments from the member. And I want to pick up when he personalizes in terms of in Toronto, and very sympathetic in terms of what the member and how he was able to relate a very personal story. And it really highlights the importance in us recognizing that in the federation that we live, we have many different jurisdictions. Some, like the province of Ontario, a fairly significant size in terms of a Department of Health, lots of professionals. And we have smaller provincials of provinces that don't maybe have the same sorts of resources. And the reason why I say that, it is important that the federal government play that coordinating role in establishing a protocol so that, in fact, people do have a sense of what is going to happen if, in fact, there is a case that comes to that is discovered in our country. And I'm wondering if you might want to just expand on the importance of the federal government actually working with provincial ministries of health, or the ministries of health working with Health Canada, to ensure that we are all on the same page in dealing with this if, in fact, it is discovered that we have someone that's infected with Ebola, and just using a common protocol that would, in fact, be in the best interest of all.
Mm-hmm. The Honourable Member for York South Weston.
Well, clearly that's in the best interests of all Canadians, that we have a healthcare system that is roughly equal everywhere you go. You don't want to be a person living in Canada and to discover that if you get sick in one province, you are worse off than if you get that same illness in another province. And yet that's part of how our systems have started to devolve over the years. There's been very little effort on the part of the federal government to enforce the Canada Health Act. And this is yet another example of how that the government has a central role to play in actually ensuring that standards, practices, and in the case of infectious disease outbreaks, that the protections that are necessary to protect the public and to protect the healthcare workers are actively followed and are at the best possible quality across the country, so that we don't have situations where you're better off in one province than another.
Conformément à l'article 30.
Pursuant to Standing Order 38, it is my duty to inform the House that the questions to be raised tonight at the time of adjournment are as follows. The Honourable Member for Lac Saint-Louis on the environment, and
for Thunder Bay Superior North regarding democratic reform. Resuming debate, reprise de débat.
Resuming debate, the Honourable Member for Saint-Bruno-Saint-Hubert.
Merci, Monsieur.
Thank you, Mr. Speaker. A month ago, my colleague from Laurier-Sainte-Marie asked for an emergency debate on Canada's response to the Ebola epidemic. A month ago, the World Health Organization had identified over 2,000 victims. Today, there are more than 4,000 victims. In 1 month, the number of victims has doubled. Mr. Speaker, a few simple maths show that if we, and I say if, we cannot put the brakes on this virus, in 18 months, 4 billion people will be affected. This is a transnational health emergency, and we, here in this place, have a feeling of responsibility for all of our fellow world citizens. We are all very concerned by what is happening in West Africa, and we are following the evolution of this crisis, and the international response is essential, not just in terms of vaccines, but also in terms of making sure that medical supplies, protective equipment, and human resources are where they're needed on the ground. Currently, international aid is insufficient. Of the $988 million requested by the United Nations, only 38% has been provided by the international community. And the Conservative government has made some good-sounding announcements to the order of $65 million in international aid, but to date, only $5 million have been paid out. Where is the rest, Mr. Speaker? When will the government release the funds they've promised? So, more empty promises, from this Conservative government. And I would add to that a statement made by the President of the Ontario Council of Hospital Unions, who said yesterday, and I quote, "The federal government's contribution is woefully inadequate. I have seen no proof that Canada's financial and human resources have been mobilized in West Africa." The Harper government's theory that Ebola's coming to Canada is inevitable is true only if it remains committed to doing almost nothing to assist West Africa. Mr. Speaker, the best way to help West Africa is to stop the virus at its source. It must be contained in West Africa. It must not be allowed to cross borders. And deploying military resources under the umbrella of the United Nations must be considered, and access to treatment must be accelerated. The Prime Minister has refused to send the disaster assistance response team, despite the fact that humanitarian organizations working on the ground in West Africa continue to request an emergency military deployment to bring rapid logistical support to the humanitarian response. In Liberia, the WHO has stated that it can only meet 21% of the need for beds, 29% in Sierra Leone and 50% in Guinea. In September, the WHO had identified 300 healthcare workers infected by Ebola, Mr. Speaker. These countries that are affected by the epidemic cannot fight effectively without adequate human and material reinforcements. Mr. Speaker, we have the human, logistical, technological, and even military capacity to help the organizations working on the ground. Canada's response to this crisis should include our specialized disaster assistance response teams, the DART teams that are specialized in managing health and biorisk. So, through the DART team or through another mechanism. Mr. Speaker, why is the Conservative government not considering this possibility? Why is it not considering deploying specialized teams that are specialized in managing health and biological risk? Particularly when we know that we have this capacity, Mr. Speaker. Why do they not want to send reinforcements to help these organizations working on the ground? I understand, Mr. Speaker, that we should not be alarmist, and we should not predict an imminent contagion here in Canada. And that's why the request to have the Health Minister and the Chief Administrator of the Public Health Agency of Canada and the Public Safety Minister appear before committee is not excessive. And this should not be seen as a bad thing by the members across the way. We need to reassure our citizens. Canadians need to know that the Public Health Agency of Canada will be able to adequately respond to an outbreak of the virus in this country. Suspected cases to date have showed that there are gaps and problems with our preparations and with our coordination. The emergency exercises that have been undertaken so far are a step in the right direction, but they're only taking place a month after the first cases were identified in the United States and in Spain. Clear communication with the public, reviewing our investments in public health, being certain that we are doing everything we can to ensure the health of Canadians, that's what we need to do. And that's why the motion that we're debating today is a step in the right direction. The appearance of the Health Minister, the Chief Administrator of the Public Health Agency of Canada, and the Public Safety Minister is necessary to answer Canadians' questions, and especially to make sure that we are following up on the decisions and the taken and the operations undertaken by Canada in West Africa. And on that, I would like to thank you, Mr. Speaker.
Questions and comments? The Honourable Member for Vancouver Centre.
Thank you very much, Mr. Speaker. I would like to thank the member for participating in this debate, and I know that as a physician, she will be able to probably shed light on this question. If in the space of 1 month, after Canada had supposedly sent so much aid, we saw a doubling of the number of deaths, based on evidence, surely that should say to somebody that it wasn't working, because you shouldn't get double the amount of deaths if what you were doing was working and if what you were doing was timely. And we have since found out, due to some disclosure today in this House by this debate, that we cannot account for a lot of the aid that was promised and that didn't get there, including vaccines. But what I wanted to ask the member is this. The World Health Organization has repeatedly asked for more personnel to help on the ground. And we know that Cuba has sent 365. We know that the United States sent 3,000 of their armed forces out there on the ground immediately. Canada has sent 13 people. And the minister has suggested that she would not send anyone unless we have an exit strategy. Now, surely if Cuba can do this, surely if the United States could send 3 million people right off the bat a month ago, 3,000 people right off the bat a month ago, I would like to know, really, couldn't the minister follow what they were doing? Couldn't she follow their exit strategies instead of dragging our feet once again? Since April, we've been dragging our feet on this.
The Honourable Member for Saint-Bruno-Saint-Hubert. Thank you, Mr. Speaker. I thank my colleague for her question, which is a relevant one. I've had the pleasure of working with her at the Health Committee. We have a lot in common. We know full well that, unfortunately, the Conservative government has been dragging its feet in coming to the aid of West Africa. The vaccine vials given to the WHO just left Canada. Only up to $5 million has been paid in aid to date, whereas the promise was $65 million. They've auctioned off medical equipment, and corporations are getting richer, whereas West Africa needs this equipment terribly. There's a lack of coordination in the management of the effort in West Africa, and that's why we asked that the government send a team in place to strengthen aid to people in the field. And as I mentioned, that is the best method of nipping this epidemic in the bud before it hits our shores. Questions and comments? The Honourable Member for Trois-Rivières. Thank you, Mr. Speaker. I listened carefully to my colleague's speech, my colleague from Saint-Bruno-Saint-Hubert. I knew there was a Saint-Hubert in there somewhere. I do appreciate her input and her relevance, especially when it comes to this kind of subject, since she has the expertise. So my question echoes that of our Liberal colleague just now. It deals with urgent aid and more aid that should be offered by Canada to countries stuck with this epidemic in West Africa. The motion tabled today that we're debating is very specific. It says that the Minister of Health and the Chief of Public Health Officer should appear before the Health Committee twice a month. We all know the government's voracious appetite for transparency and disclosure of information, of course. Given my colleague's experience, shouldn't the Liberals open the door to an amendment that would put more teeth into what we really want to obtain, that is specific input, specific action on the ground in these countries? A brief answer from the member for Saint-Hubert-Saint-Bruno. I'd like to thank my colleague for his question, his comments, and his relevant interventions on all topics. Of course, as we said from the outset, we must not wait to act or react. As he just said, we support this motion in the sense that we want to obtain information. Unfortunately, as you know, because of its track record, this government doesn't seem to disclose information or be transparent very easily. I think that this motion is a step forward to force those in charge of this country giving proper information to citizens. The Honourable Member for Ottawa-Vanier, resuming debate. Thank you, Mr. Speaker. I'm pleased to take the floor on this very important and urgent topic. For over a dozen years now, I've been involved with the Canada-Africa Parliamentary Association as co-chair. The other co-chair is Senator Andrewchuk. There are about 100 parliamentarians involved in this group from both chambers who are truly interested in African issues. Therefore, what's going on right now in West Africa is of grave concern to us. Not only because of what's going on in Africa, but the potential consequences for the entire world, the world population. So when I was asked whether I was interested in speaking to this today, I agreed, as I did during the emergency debate on this subject. So, Mr. Speaker, with regard to the motion before us, you know, there are 34 million Canadians represented by the people in this chamber, 308 members of Parliament, or 306 right now. And out of respect for Parliament, I would have hoped that the government would support this motion. And let me elaborate on that. Every member represents tens of thousands of citizens who often want to get information or help from their member of Parliament. At my riding office, as is the case in the offices of all my colleagues of all parties, probably receive calls from their constituents asking about this Ebola crisis and the possible consequences, what they should do, what the government is doing, what public institutions, hospitals are doing, what are doctors doing, etc. So I'm a bit surprised by the comments we got from the government side. They've indicated they're going to vote against this, and I'm disappointed and I'm surprised because at times like these, we should set aside partisanship completely and rely on the fact that the 306 338 after the next election, have a mandate that goes far beyond partisanship. They have a mandate to inform the public and to assist constituents when possible and necessary. In this case, the notion of information and accuracy is very important. For instance, I think that this is the case for all MPs. We all got this MP kit on Ebola. I got it this morning. I should have received it quite some time ago. But I read it quickly, and I see that it is not very complete, Mr. Speaker, because there's missing information. And this is information that you can't obtain during question period. It's not the right vehicle for that. It can be done during some sort of regular briefing or in committee. That's what's being proposed here, so that members of Parliament who have questions can ask them. If I was a member, I could ask my colleague to ask questions if I'm not there. So somebody said this to me: if there is contagion, you cannot pass it on until you get a certain level of fever. Is that true or not? We'd like to know that. If it's in the kit, I haven't seen it yet, but I don't think it is. But that's the kind of information that the public is entitled to have, and that could mitigate the fear that's starting to spread out there, unfortunately. In Texas, we saw the situation that developed there. We saw this in Spain. I think it would be useful for members of Parliament, regardless of their political stripes or if they're independent. It's important for them to have that information and have some mechanism to get answers to their questions. That's the role of a Parliament in a situation like this one. And I think that any government has a responsibility to respect that role and help members of Parliament inform the population objectively, accurately, and so as to not engage in fear-mongering. If we let the media do that job, often they like to sensationalize things, and we'll end up with a population that's worried for nothing. So that's the first reason why I was hoping that this government would support this motion, so that we could have that mechanism every week or every 2 weeks where the responsible ministers appeared before a committee and inform members of Parliament about the situation. These are public meetings that would be broadcast on TV. The media would be there. And that would be a regular way of updating Canadians from coast to coast on what's going on and what the government is doing, the latest developments and initiatives, etc. That would be nothing but good. At one point, the Minister of Health may not be able to be there, but I think that my colleague would certainly agree to have a deputy minister appear, for instance. So this is not a matter of absolute obligation. It's a matter of respect for parliamentarians and their role toward the public and the people they represent. So I'd be very happy if my colleagues across the way listen to me, at least those who are listening to me, and perhaps they could pass on that message to whoever will determine what will happen during the vote and decide whether they'll vote for or against the motion. Mr. Speaker, there's a few other items I'd like to mention. There are positive things that have happened in the past few days. We all heard this on the news. Nigeria has been declared Ebola-free for about 40 days now. That's twice the recognized gestation period for the virus. Apparently there is no more in that country. Senegal as well. We think that the news is good in Spain. The nurse who'd been affected by Ebola is apparently better now. Those are encouraging signs. They're signs that we will manage to contain the virus. When I spoke on the first night after we came back after the summer break, I think that was what we were emphasizing, the need to contain the virus.
Mr. Speaker, as you will, I would think, realize. And in the three countries that are the most affected, Sierra Leone, Liberia, and Guinea, it has not yet been contained. And I think everyone recognizes that. And I think everyone is starting, including the United Nations, WHO, donating countries, they're starting to realize that that is where the effort has to be concentrated. For instance, there's a very valid argument that's going on now as to whether or not we should be, if it's useful to do what we're doing at the airports, or some people are doing at airports, and testing the body temperature of passengers when they arrive. Well, if you've got the virus and it's not yet manifested itself and you don't have a fever, well, they will not detect it, and therefore you'll be going into wherever country you're arriving in and carrying it, and then after that it could develop, and therefore the usefulness of that exercise is somewhat questionable. The suggestions that I've heard that I think are perhaps more stringent and more demanding, but perhaps much more efficient, would be to control those the access to those leaving the three countries where it's not contained yet, whether it's Liberia, Sierra Leone, or Guinea. So anybody getting on a plane there should be subjected to very stringent measures so that we know it's not going to be carried away. And I don't know what kind of measures. I'm not a scientist, Mr. Speaker, but I'm sure that, and it may require some time, so people may not be able to leave the country for a long time. And that is the nature of quarantine. We are prepared to quarantine people here in Canada, and no problems with that if we believe, and if they do have it, if they carry the virus. Why then, Mr. Speaker, are we not putting that question into where the virus now resides, and making sure that, in a way, we are making sure that it's not leaving that area and not spreading? And I think that would be a much more efficient way. And I'm just asking, I'm wondering if the government has even considered that, if there's ways that we could be helping those three countries to make sure that it's not spread. That's the containment portion of this issue. Yes, we have to be prepared in case, unfortunately, something as has happened in Texas or in Spain happens in Canada. And my sense is that finally we're getting to that level, and that's good. And it's got the level of preparedness has to spread and be applied throughout the country. Because if someone arrives here with the virus, non-detected, develops a fever down the road, goes into a hospital, he or she is not going to pick the hospital that's been picked for that province to be the hospital dealing with Ebola. If he or she happens to live in a city where that hospital is not the one. And therefore, the staff, I suspect, of all hospitals are going to have to be better prepared and equipped to deal with it. So that's the second phase of what we need to do, Mr. Speaker. And I would hope that public health facilities and staff and advice will be propagated and rapidly, and the methods that are necessary to ensure that should the virus get here, it would be contained immediately, I think is very important, and I don't think anybody would disagree with that. So let's make sure that is indeed happening. The last thing that we need to deal with is finding a vaccine to this virus. And on that, it's a mixed bag, because I think the fact that D&D in the past developed one, the ZMapp, and another one, is at least encouraging. The fact that no corporation thought it would be profitable to do so, because the previous incidents of Ebola in Africa were in small, isolated areas, and it sort of spread in that small, isolated area and then died or stopped spreading. No one wanted to develop a vaccine because they didn't see a profit from it. Well, I would imagine that there are a number of corporations now that think differently, and even if not, Mr. Speaker, I think governments, including ours, has to think differently and has to make sure that there is a vaccine developed for this virus. Whether we do it or do it in conjunction with other countries, it has to happen, and I would hope that we would put the resources that we have to that effect, and it seems that we're headed that way, so that too is encouraging, Mr. Speaker. There's another, I got a recommendation today from a constituent that I think is also interesting, and my leader asked the question to the Prime Minister during question period, didn't get an answer. So I think at some point I would hope we would consider that seriously. And that is the notion, Mr. Speaker, whenever we've had situations around the world of serious earthquakes or flooding, and people are affected, the whole communities, a lot of dead people, and the diseases stepping in, of course, because they have no health facilities available. We have encouraged Canadians to donate by matching their donations, Mr. Speaker. And I think there's a number of Canadians right now, some of them for their own concerns and concerns of their relatives that would want us to be able to get to the level where we've contained, we're prepared, and we find a vaccine, and would be prepared to contribute to that. There's also a significant number of Canadians who would want to contribute to organizations, charitable organizations that are duly credited and recognized by Revenue Canada, and that are officially involved in this effort in Western Africa, that would want to contribute to them. And the government saying, you can put a limit to it. It's not, nothing should be unlimited. But if the government says, yeah, we've put $65 million in, if they said we're prepared to match for another X millions of dollars any donations that the Canadians would give to help fight this situation, to help get this situation under control, to help develop a vaccine that indeed would be, would be the solution eventually, so that if ever, once we've managed to contain this one, another explosion of the virus happens, we would have the instruments necessary to extinguish it immediately. Well, I would think, Mr. Speaker, that the Government of Canada would do a good thing by that, not just for the world, but for our own citizens who would want to contribute and would feel that having contributed would generate a matching donations from the government to try to tackle, not to try, but to tackle the most significant health situation now around the world. And so with all of this, Mr. Speaker, I'm going back to the motion that's before us. I hope that we don't see a government defeating this, because it would indicate a total lack of respect and caring for the Parliament of Canada. The fact that we are here as duly elected representatives, each of tens of thousands of constituents who are all concerned with this situation and want some regularly available and regularly updated information, objective, factual information, advice that they could then incorporate in their daily routines and their daily weeks, and especially if they have to travel. People are getting concerned about that. Well, I think that would be good. And when we manage to contain this and end it, we will have a huge job to do. The world will have a huge job to do to help these three countries in particular and those in that general area, because their economy is just wrecked right now. The
economy of those three countries is in freefall, Mr. Speaker. Industries are closing up. People are on the verge of panic, and unfortunately, it might well last, because the WHO has also acknowledged that we're far from putting an end to it, because they came out with a disastrous scenario. If we don't succeed in containing the virus soon, there could be more than 1 million people who will die from this virus, Mr. Speaker. Now, I prepared a report in August, and there were 4,500 people afflicted, some 2,000 people who had died, and we're looking at the double now. We're up to almost 10,000, and there are almost 4,500 or more who've died. And the predictions are that between now and the end of the month, there might be another 10,000. So I think that's causing people to wake up, to realize that it's high time that something is done. Something more aggressive, more active, and that we invite the people of Canada to participate in this effort. As I said earlier, and I'll repeat what I said in English earlier, but it's time to ask the government to match funds donated by Canadians to organizations that are already involved in efforts to assist people in those countries. The needs are very high in terms of help, Mr. Speaker, protection. Our volunteers who are on site, the doctors and nurses, Mr. Speaker, as well. And there are many healthcare professionals, doctors, nurses, who've been affected and who've caught the virus, Mr. Speaker. It's staggering. And we must acknowledge that we have to say hats off to these people. They're not soldiers, Mr. Speaker. And I'm among the people who acknowledge and recognize the importance of our armed forces. But these are people who are putting their own lives potentially in danger, Mr. Speaker, because they understand the absolute importance of containing the situation. So those people need assistance. The victims need help. Children of these families, children whose parents have died. People need food, drinking water. So assistance to those three countries, Mr. Speaker. The needs, in fact, are very high. So it's important to encourage Canadians to contribute and to encourage the government to match the funds, dollar for dollar. So, Mr. Speaker, this debate is something we've had twice now in a short period of time because the situation hasn't been contained. And I think that the political and public authorities have finally begun to understand the immensity of this issue and the importance of bringing it under control as quickly as possible. Thank you, Mr. Speaker.
Questions and comments? Oh, I see the honourable member for Edmonton Centre is rising on point of order.
Yes, thank you, Mr. Speaker, and pardon the interruption, but I believe there have been discussions and unanimous consent is requested for the following motion, that notwithstanding any standing order or usual practices of the House, if a recorded division is requested on Wednesday, October 22nd, 2014, on Ways and Means motion number 15, it shall be deemed deferred until the expiry of the time provided for government orders that day.
Does the honourable member for Edmonton Centre have the unanimous consent of the House to propose the motion?
Yes.
The House has heard the terms of the motion. Is it the pleasure of the House to adopt the motion? Yes? Agreed? Agreed and so ordered. Questions and comments? Questions et commentaires? La députée de Charlebourg.
The honourable member for Charlebourg, Saint-Charles. Thank you, Mr. Speaker. On the one hand, we have Canadian authorities saying that Canada is well prepared for a potential outbreak of Ebola virus here in Canada. But at the same time, nurses are saying that the quarantine procedures aren't clear and that they had material that wasn't cutting-edge materials. We know that the Conservatives have cut $60 million to the Public Health Agency of Canada over the past few years. So my question is very simple and very clear, in fact. Does the member have an idea as to where Canada is going and what Canada is doing to fight a potential outbreak of the Ebola virus here in Canada? The honourable member for Ottawa-Vanier. Well, Mr. Speaker, Canada has a healthcare system that is well developed and fine-tuned, but what we need to have is the system equipped to deal with an outbreak if ever there were one, or people contaminated with the Ebola virus. Now, what we need to focus on is this. The federal government must play its role. And that role, well, it has several roles, but one of the roles is ensuring that information, accurate information, is shared on a regular basis. Now, that's the importance of the motion that's before us here today. Canadians must understand that the government is serious in its approach and that the members of Parliament who are elected to represent them have access to information in a non-partisan way on a regular basis, access to accurate information. So when people call us, as is the case, we can provide them with information that is useful, that is accurate, and advice that will be helpful as well. Now, I don't want to get involved in a debate on this issue, but as parliamentarians, we need to play the role that we have been elected to play. What's expected of us?
Questions and comments? The honourable member for Winnipeg North.
Yes, thank you, Mr. Speaker. And inside the resolution we're going to be voting on, it emphasizes the importance of meeting twice a month. It emphasizes the importance of the Chief Public Health Officer of Canada, the Minister of Public Safety, and, of course, the Minister of Health. And it doesn't necessarily limit to other ministers. I'm wondering if my colleague would just be able to provide clearly why it's so important that the Standing Committee, and he's been able to do this throughout his speech, but if he could just capture the essence of why it's so important that these individuals be made accountable at a Standing Committee and how Canadians would benefit by that.
The honourable member for Ottawa-Vanier.
It's of Parliament of Canada to do that whenever we're facing a situation. We've done it for Afghanistan, we've done it for other situations, and it demonstrates a respect by the government of the Parliament and its role. And that's all we're asking, Mr. Speaker. Come to the committee which has its mandate, which is the Health Committee. It's made up of members from all sides, and I can therefore tell my colleague, who is the member of the committee, I've gotten these concerns, I've heard these things, could you please find out? And that's how it works, Mr. Speaker. There's a level of collegiality that has to be attained when collectively we're facing a very difficult and severe situation. And I'm not sensing a willingness on behalf of the government right now to enter into that collegial mode, which I think would be the best way to serve all of our fellow citizens.
Questions and comments? The honourable member for Trois-Rivières. Thank you, Mr. Speaker. I'd like to thank the member for Ottawa-Vanier not only for his presentation but also for his involvement, his long-standing involvement on the Canada-Africa Parliamentary Association. I'd like to go back to that spirit of collegiality because some of the information that I would like to obtain, if he can disclose it, is that over the years we've discovered that the Conservatives have elevated partisanship to an unprecedented level, not only in Parliament but within the associations as well. And we had the unfortunate opportunity of discovering that at official languages at the committee. But if there is one place where partisanship is less present, where we don't see this, is with the friendship groups. So I'd like to ask him this. Within the Canada-Africa Friendship Group, does the member think that the other members of Parliament who participate on that committee, are they effective spokespersons beyond partisanship, beyond a partisan approach? Now, to my mind, this Liberal motion doesn't go far enough, but that's not reason to defeat it. But that's my question for the member. The honourable member for Ottawa-Vanier. Well, I have the tendency to wash my dirty laundry at home and not in public, Mr. Speaker, as we say in French. But to go back to the question, the Parliamentary Association that we were talking about met a couple of weeks ago. There was a briefing. A representative from the Public Health Agency, from Foreign Affairs were there, and they talked about Ebola. We did it in conjunction with the Commonwealth Association, which was traveling to Cameroon. And we had also planned a trip to Africa, and we wanted to have an update, a detailed update. And I must say that the meeting we had was very beneficial. It was done in a collegial way. There were members of all parties present, and the information shared, the questions put, etc., were very timely. So that's an example, Mr. Speaker, of the type of mechanism that the House could use. It could use the Health Committee in that regard on a regular basis. Now, I've been here for a few years. The next election will be my 8th election. But it seems to me that we're really sliding towards too much partisanship. And with a crisis like this, the Ebola crisis in Western Africa that could spread, it could decimate entire populations. I think, Mr. Speaker, we need to set aside partisanship. We need to adopt a more collegial approach. We need to share information, not for us, but for the people we represent, the people who sent us here to this House, so that we can help them and provide them with the information in a timely and accurate manner, Mr. Speaker. So that's why I think that, well, my colleague thinks this motion doesn't go far enough. Well, we're not asking for much. We're asking for the government to adopt a collegial attitude and to share information with us, not for our personal benefit, but for the benefit of the people we represent, for the 34 million Canadians we're here to represent. It being 5:15, it's my duty to interrupt deliberations now and to put forthwith all questions to deal with the business of supply. The question is the following one.
By Ms. Duncan, Etobicoke North, moved that the House recognize the devastation that Ebola is wreaking in Western Africa and the serious threat to public health that the virus could pose to Canada, and call on the Minister of Health, the Chief Public Health Officer of Canada, and the Minister of Public Safety to appear before the Standing Committee on Health twice monthly to report on Canada's efforts at home and abroad to ensure that the outbreak does not pose a threat to the health and safety of Canadians. Then Ms. Duncan, Etobicoke North, seconded by Ms. Foote, moved the following amendment, that the motion be amended by replacing the words the Minister of Health, the Chief Public Health Officer of Canada, and the Minister of Public Safety to appear before the Standing Committee on Health twice monthly, with the words the relevant minister or ministers to appear twice monthly, and the Chief Public Health Officer of Canada to appear monthly before the Standing Committee on Health. The question is on the amendment. Is it the pleasure of the House to adopt the amendment? No? All those in favor of the amendment will please say yea. All those opposed will please say nay. In my opinion, the nays have it. Call in the members.
Mr. Speaker, I ask that the vote be deferred until after the orders of the day tomorrow, Wednesday, October the 22nd.
Accordingly, the recorded division stands deferred until tomorrow at the end of government orders. And I see the Honourable Chief Government Whip rising.
Yes, thank you very much, Mr. Speaker. I would request that we see the clock as reading 5:30.
Is that agreed? Agreed, yes? Agreed and so ordered. It being 5:30, the House will now proceed to the consideration of private members' business as listed on today's order paper. Orders of the day.
Private members' business, resuming debate at the second reading of Bill S-211, National Health and Fitness Day Act, in the name of Mr. Weston, West Vancouver, Sunshine Coast, Sea to Sky Country.
When the House last took up the question, the Honourable Member for Haliburton, Kawartha Lakes, Brock, had 7.5 minutes remaining in his time for comments on the question. The Honourable Member for Haliburton, Kawartha Lakes, Brock.
Thank you, Mr. Speaker. And while I realize that having a chair occupant rise on debate is a little like witnessing a solar eclipse, this is actually the second time that I've had the opportunity to speak to this bill. And I am delighted to speak on the subject of health and fitness as addressed in Bill S-211, which has been sponsored in the House by my colleague from West Vancouver, Sunshine Coast, Sea to Sky Country, and in the Senate by Canada's athlete of the century, Senator Nancy Green-Rain. And this bill would establish a national day to promote health and fitness for all Canadians. Before I begin my remarks, I'd like to reference a couple of paragraphs from the bill itself because I think it will explain what this is about and why we're doing it. For example, whereas the Parliament of Canada wishes to increase awareness among Canadians of the significant benefits of physical activity and to encourage Canadians to increase their level of physical activity and their participation in recreational sports and fitness activities. And subsequently, whereas the Government of Canada wishes to encourage the country's local governments, non-governmental organizations, the private sector, and all Canadians to recognize the first Saturday in June as National Health and Fitness Day, and to mark the day with local events and initiatives celebrating and promoting the importance and use of local health, recreational sports, and fitness facilities. Mr. Speaker, I think this is an excellent bill that I'm hoping all members in this place will support. It's not a silver bullet, and it's not a panacea that will cure all the physical ailments of Canadians, but it is an important piece in a larger puzzle in terms of encouraging Canadians to be fit and active and to look after their own health and that of their children. When I spoke for 3 minutes about this a few weeks ago, I mentioned that it's a challenge that members of Parliament face, access to good food and not much time to exercise is a combination that causes many members in this place to struggle with their weight and their health and their fitness. And so it's something that I'm hearing some here's from some of my colleagues. But I think that that it is important for all Canadians. We have one body that we have to make do from the time we're a child until the end of our lives. There are things that we can do. Modern medicine really is filled with miracles in terms of interchangeable parts. But every time when I see something on television from Cuba, and I see one of those old 1950 vintage cars, it always reminds me that those taxi drivers knew they had a car and they weren't going to get another one. And so they had to look after it, and they had to learn how to repair it and how to maintain it, and the fact that that was just going to have to do them for a long, long time. And for people, I think it's the same thing. Whether you're in your 20s or your 40s or your 70s, you have one body. And really, health and fitness, I think years ago we thought about health and fitness mostly in the context of living longer, and that's still part of it. But I think most of us have figured out that it's about the quality of the life that we enjoy. And when we see somebody in their golden years who can still ride a bike or go downhill skiing or do other physical activities, we're reminded that they didn't get there by accident, but that they've probably looked after their health over the years, and that's why they are still able to be active in those later years. Mr. Speaker, about a year or so ago when I turned 50, one of my friends told me, he said, well, I guess you're playing the back nine now. And I hadn't really thought of it, that somehow I was over the hump and that I was kind of teeing off on the 10th hole. But it's probably true. And so it reminded me that it is important for all of us to mind our health. I have 2 young children. I tried to remind them of this at the same time. Obviously, there are all the economic arguments about good health at a macro level for our country and for our society. We all benefit if we all stay in better shape because it reduces acute health care costs. But I would suggest that there is a stronger argument than that. And this is really the central point that I want to make. And that is that it's about quality of life, about staying healthy and fit, so that we can do the things that we all want to do. This bill today is a part of that. It's to encourage other levels of government, for example, municipalities that have, whether they're squash clubs or hockey arenas or curling clubs, other facilities, possibly to open them for one day a year so that people that maybe aren't familiar with it can go in and try that activity and see if they enjoy it. It's an opportunity to remind all of us, again, adults and children, that there's actually an abundance of recreational facilities in many of our communities. Sometimes we go by them many, many times without ever setting foot inside. So having a day set aside to focus on this, reminding Canadians that it's important. I really wanted to tip my cap to my colleague, the Honourable Member from West Vancouver, Sunshine Coast, Sea to Sky Country, who is a true leader in this area. He leads a group of parliamentarians on Tuesday morning for a run. He leads another group on Thursday mornings for a swim. So he is leading by example. Even though it doesn't show up in the name of his riding, that area that he represents includes the town of Whistler, which was the home to the 2010 Winter Games. And so, and for anyone who's ever visited Whistler, they'll know that recreational activities are pretty much what makes that place and what attracts so many people there. So it's not surprising to me that he is the one pushing this. The fact that he has been joined by one of our senators, the Canada's Athlete of the Century for the 20th century, I think is a perfect set of bookends around this idea. And I would really encourage all members not only to support the bill, but to actually take to heart the sentiment that is captured by the bill and to get involved themselves and to encourage friends and family and constituents to do the same thing. Thank you.
Resuming debate. Reprise de débat.
Resuming debate. The honourable member for Joliette. Thank you, Mr. Speaker. Like many of you know, I will be 70 years old next year, and it never occurred to me that I should stop being active. This summer, I went for a parachute jump from 3,500 feet in the air with actor Guillaume Lemaitre-Vierge. It was not nobody, and that, Mr. Speaker, that means that I went from 0 to 250 kilometers an hour in just a few seconds, and I'm ready to do it again. So all that to note that there's no age where you can't do anything, and continuing to be active as we get older is something that everyone should do. Our aging population here in Canada raises some essential questions on what we can do to make sure that our fellow Canadians stay active as long as possible. And this includes both physical activity and family activities. This can also include community involvement. And, well, sometimes in certain communities, for certain people, it can be difficult to be active. Having a healthy population is both a social and an individual choice. Now, the aging population is something that I can talk about because, well, I'm part of that. And I'm aware that we have a growing problem of juvenile obesity. But among my 8 grandchildren, so far there's no one who suffers from obesity. Without meaning to make a bad joke, well, Mr. Speaker, here's a problem that is reaching embarrassing proportions. 20% of young people are overweight, and when they become adults, well, over 50% of the population is overweight. What will we have tomorrow? Obesity is hard on the body, on circulation, on arterial health, on the heart, and on many other things. How will our young people today be when they reach my age? Will they reach my age? This is something that's a true concern, because I know that leading a long, active life is something that we can all do, and it's something that everyone in Canada can do. Now, it's not always easy to stay active. We're busier and busier. Our work can be very demanding, and parents often have to work very long hours or work several jobs to make ends meet. When they're at home, they need to take care of kids, clean the house, prepare lunches, pay bills. This doesn't leave a lot of time for physical activity, and maybe that's what explains why 85% of adults don't reach the minimum level of physical activity to ensure their good long-term health. Among young people, this proportion is 10% higher, Mr. Speaker. So this is really something to be concerned about. And it's for these reasons that I support Bill S-211. I would also like to note that November is coming up, and often November is associated with depression, with fatigue, and often even with suicide. Do Canadians know that physical activity can help in that context? I think it's important that we remind them that a little bit of physical activity in their daily life improves mental health. It reduces stress. It adds self-confidence, and it makes people happier. And so physical activity on a regular basis increases, as well, your energy level. Dédé Fortin, a singer, didn't write his work about November for nothing. We live in a northern country, Mr. Speaker, and the beginning of winter is hard on us. It's important that we remember what physical activity can do to counter that. And it's also worth noting that prevention is good. Heart disease and stroke cost billions of dollars in Canada every year, almost $30 billion. With that sum, we could buy 350 million pairs of running shoes. We can also promote physical health through a preventive approach, and the NDP has been calling for that through 2011. We need to improve access to federal parks. Here we have, in Ottawa, the area, we have the Gatineau Park, which is free and available to all, but we don't have that in every region. For example, the Mauricie National Park in my riding is becoming more and more expensive to get into, and for low-income families, getting into a park can be a challenge. In my opinion, creating a family price, a low family price for parks, would be a good step forward. In the NDP, we believe that the federal government should work cooperatively with the provinces and territories to ensure that every child can establish the foundations of a healthy life by integrating physical activity in their daily life. We could also facilitate access to sports teams and to gyms. I don't think that parents should have to choose between buying groceries and signing their kids up for hockey. A number of organizations in Canada recognize the importance of physical activity and believe that the government has a role to play in promoting physical activity among Canadians. For example, the Nursing Association of Canada, which admits that the federal government is responsible for playing a leadership role to promote active living in Canada. The same thing from the Cancer Society of Canada, which notes that the government is one of the most important stakeholders who can influence Canadians and encourage them to have an active life. I could list many more groups and people who are in favor of greater government involvement in promoting physical activity, but I think that my position is already quite clear. So to sum up, I am very much in favor of Bill S-211 because I recognize the importance for individuals and for all of us in having a healthy, active lifestyle. How could we be opposed to that? In my opinion, this bill is one of many initiatives that will help Canadians lead healthier lives so that we can all age healthily. To promote the health of all, it is important that we start by facilitating access to our national parks, which are true national treasures. We should also allow more Canadians to have access to physical training centers and join sports teams. In that way, by doing so, rather, we would have stronger, healthier communities. And healthier seniors can offer more to their communities longer and allow others to profit from their experience. As for young people, they'll be more active and better prepared for work. But overall, and this is very important for me to remind everyone of at this time of year, everyone will be happier, in better shape, so happier, and hopefully that can prevent certain frustrations, if you will. Thank you, Mr. Speaker.
Resuming debate, the honourable member for Vancouver Centre.
Thank you very much, Mr. Speaker. Liberals will be supporting Bill S-211 because this bill aims to designate the first Saturday in June in each year as National Health and Fitness Day. Now, we're pleased to support this bill from my colleague of West Vancouver Sunshine Coast, Sea to Sky Country. It's a laudable initiative indeed, though symbolic. I think we need more than just a day, and we certainly need to do more as governments to promote healthy, active living at all ages. I remember in my years as a physician when I was very involved with the British Columbia Medical Association and the Canadian Medical Association, one of the things we had been trying to do for years, and I mean years, I'm talking like about maybe 30 years, we were trying to promote daily, 1 hour of daily quality physical activity in schools, and we couldn't get that done. Not all provinces have that at the moment. And yet, as I heard my colleagues say, if you begin as a young person learning to be physically active every single day of your life, it becomes a lifestyle habit. It becomes like brushing your teeth every day. It becomes like having a snack in the middle of the afternoon. It becomes like getting your homework done, watching TV, doing all of those other things. It becomes a part of your routine and a part of your life. And it's easier then to carry that on as you grow and as you go through your life cycle, so that by the time you become a senior, you will be able to continue to have that active physical living. But we know that active living is not only a good thing to incorporate into your lifestyle, it is an important part of health promotion and disease prevention. We know that exercise, for instance, and active living helps people who have Alzheimer's to actually be able to postpone the onset of Alzheimer's. So that if we can start getting people to be active and seniors throughout their lifetime to be active, we can see that we may be able to postpone Alzheimer's. We know that if we postpone Alzheimer's for 5 years, we will literally be seen to have eradicated the disease, mainly because we don't live 5 years longer every year, so that we will be able to have people not having their ability to remember and their ability to function neurologically different. We also know that we see the rise today of children who are never going to be as healthy as their parents were, mainly because of type 2 diabetes and of obesity. It doesn't help to have computers as we all sit here every day and we watch ourselves kind of becoming slightly addicted to the social media and to everything else we do with computers. It tends to, again, bring down the level of physical activity in young people. We also find that eating fast foods, eating processed foods, eating a large amount of foods that are high in fat and sugar have a tendency to create obesity. We know that that increases the risk of stroke, heart disease, and with type 2 diabetes, vision problems later on in life, and the ability to have neurological problems and walk well later on in life. So that we see that, in fact, if you can start and promote active living, that this will be able to assist you throughout life to either prevent or to postpone chronic disease and chronic illness that, to be crass, costs the healthcare system a great deal of money. It will create savings in which we can put money into other things that are necessary to keep us healthy and to give us a quality of life, to maybe into mental health, maybe into looking at areas of health promotion and disease prevention in other places other than active living. We can maybe even look at finding a way to assist people who are physically and mentally unable to be able to fully access their physical and mental capacities, to be able to be trained to work and to live reasonable, qualified lives. So there are lots of things we can do with that money that we save out of the healthcare system, reducing hospital costs, reducing hospital beds, and also at the same time, people who are healthy and who work and who live long, and we can see seniors here today living longer and working longer. They continue to contribute to the tax base, they continue to contribute to the economy, they continue to contribute to the productivity of the nation. So the initiative to designate a National Health and Fitness Day has been gaining widespread support for all of those reasons. Right across the country, we now have about 150 municipalities across Canada who have adopted some form of a health and fitness day. Now, this bill originated in the other place by Senator Nancy Green-Rain, an avid supporter of active living. Increased physical activity not only promotes physical health, but also mental and emotional health. Again, we find that people who exercise more are less likely to be depressed. We find that people who exercise more are less likely to have, as I said before, problems like Alzheimer's. Over the last decade, the participation rate in physical activity in Canada has actually declined. The majority of Canadian adults and children do not meet the physical activity level guidelines. And according to the Public Health Agency of Canada, in the period between 1981 and 2000 and 2009, measured obesity roughly doubled in most age groups in the adult and youth categories for both sexes. And data also indicated that approximately 1 in 4, which is 24.3% of Canadian adults aged 18 years and over, is obese. The combined rate of Canadians overweight and obese is 62%. In 2005, costs of adult obesity in Canada were estimated at $1.8 billion in direct healthcare costs and $2.5 billion in indirect costs, for a total of $4.3 billion. Obesity and lack of physical activity increases the risk of developing, as I said before, several chronic diseases, and including osteoarthritis, and we know that it is linked, although we don't quite know how direct the links are, to some types of cancer. A 2009 report estimated that on average, an inactive person compared to an active person spends 38 more days in hospital and uses 5.5% more family physician visits, 13% more specialist services, and 12% more nurse visits. The rate of obesity varies across the country, as you well know, Mr. Speaker, and so this is a good thing to bring across as a day that goes across Canada, and for the federal government to be talking about this, since the federal government is responsible for the health and well-being of Canadians regardless of where they live. When we saw from a recent UBC study, my province of BC has the lowest obesity rate. Now, that's probably in part because British Columbians tend to engage in more healthy and active lifestyles. It just happens that we also live in Lotus Land, and we're also the best things in sliced bread in BC. And I speak to the mover of the bill on this one. I'm coming from British Columbia himself. In 2005, the previous Liberal government invested $300 million over 5 years to the Public Health Agency of Canada for an integrated strategy of healthy living and chronic disease to ensure that Canada had an integrated approach to address major chronic diseases and their risk factors. And one of the key pillars was promoting health by addressing the conditions that lead to unhealthy eating, physical inactivity, and unhealthy weights. So, Mr. Speaker, there are many factors that play into the physical activity and healthy living of adults all the way through their life cycle, and this is really, really important. But I want to say that this is a start. This is only one of many things we can do, and it is one way to remind us at least once a year that we should get out there and become active. Thank you, Mr. Speaker.
Resuming debate, the honourable member for Kildonan St. Paul.
Thank you, Mr. Speaker. It is my great pleasure tonight to speak to this bill. I think it's one of the most important bills we've had in this Parliament, because it affects all of us in a major way. And I have to compliment the member from West Vancouver, Sunshine Coast Sea to Sky. This member has taken a dynamic leadership role in making, first of all, MPs aware of healthy eating and healthy living styles. And I know in Parliament Hill, Mr. Speaker, this is the place where we eat on the run. We eat unhealthy foods because we're so busy, we're on a plane all the time, and need I say more about airplane food? Or inactivity as you're sitting on a plane. We have chronic issues there. But having said that, when I was first introduced to the member from West Vancouver, Sunshine Coast Sea to Sky, he was starting all these fitness programs around this place. Now, Mr. Speaker, I'm possibly the most least sports-minded fitness person. As a mother, I took my kids to every sports known to man, from hockey to soccer, and I was the hockey mom, the soccer mom, did all those kinds of things. My husband is a wonderful athlete, does everything from martial arts to hockey to whatever. And that certainly helped him when he got a chronic cancer, because today he is in remission, and I credit that to, number one, prayer, and the second thing is his fitness level was fantastic. And, you know, so when I look at what the member from West Vancouver, Sunshine Coast, Sea to Sky has done, it has begun to reset the channel in terms of even Parliament Hill. You know, the place, the seat of learning or the seat of Parliament where we're supposed to be producing laws for all Canadians and be an example to all Canadians. And I know I had a big challenge personally, Mr. Speaker, because at a very young age, my younger brother drowned, and it hit our family very, very hard, particularly my mom. I was a baby at the time, so I don't remember my older brother. But I remember my mom sitting in a rocking chair, and every once in a while, she would start to cry. And even when I was a teenager, Dad would say, "Leave Mom alone for a while. She just needs this time." And she was remembering the tragic loss of her son and our little brother. And I have to say, it sort of seeded a fear of water in me. I love to look at the water. I love to put my toe in the water. When I was very bold, I would, you know how you sort of walk up to your neck and hope you can still reach the bottom? Well, that was me, because I liked the water in a way, but feared it dreadfully. So one day, the member from West Vancouver, Sunshine Coast, Sea to Sky, came and said, "Why don't you come and learn how to swim?" And I kept telling him, "No, I don't have time." And I really didn't have time. I was very busy. But it was a very healthy thing to do, and he's very persistent and very persuasive. So here I was. I couldn't believe it. I bought a bathing suit. I bought goggles. I bought my cap. I looked like something from outer space, and I don't have the greatest figure in the world, so getting me out there just on that basis was a challenge. But having said that, I started going in the water, and you know what, today, I'm not a bad swimmer. I know how to swim. And I have learned how to go underwater, and the most exciting thing is having your goggles on, going underwater and seeing all the things that are happening there. And so I got over my fear of water. But it did another thing. It also got me into the physical activity. The other thing that I do on a regular basis is I've started to bike. Now, you could be walking down Wellington, or you could be walking down O'Connor, and there you see the member from West Vancouver, Sunshine Coast, Sea to Sky, early in the morning on his bike. And it never ceases to amaze me how he can bike in extremely cold, windy weather. So I am not that dedicated, but I am dedicated to you know, a charity that I started, and I've biked for victims of human trafficking, and I've done that kind of thing. That sort of motivated me as well. But over and above that, the leadership under the member from West Vancouver, Sunshine Coast, Sea to Sky, has sort of changed an environment around this place. And it's an environment of activity, and it involves people from all parties. It's just amazing. You know, you can get together, and it doesn't matter what your party is. You're out there running, you're out there biking, you're out there swimming, and it's very pleasant. For me, it became a 3 times a week event over the summer, and now I'm down to 2 times a week. But I do other things, and I'm aware that, you know, really taking care of your body, as one of the members earlier in their speech has said, you know, it's like a 1950s car. I wish I was a 1950s car. My car would be a little older than that. But having said that, you have to take care of it and repair it, and you live longer. And so this awareness that the West Vancouver Sunshine Coast Sea to Sky member has brought has been of paramount importance. In my own riding, I love the idea of having the first Saturday of June a National Sports Day. And the reason why, or a day to establish a national day to promote health and fitness for all Canadians, I love that. And why I love that is because it makes us all aware. It's not a school that's going to change a mindset. It's not a parliament that's going to change a mindset. I've always said education is our greatest weapon. The more we know about the problems we have if we're sedentary or if we don't move, if we don't take care of our bodies, is a tremendous toll on families, a tremendous toll on our lifestyle, a tremendous toll on our quality of life. You know, when you heard members here talk about different aspects of the healthcare system, 1/4 of the colon and breast cancers are attributed to the sedentary lifestyle we have. 27% of diabetes in Canada, or 30% of chronic heart disease, is attributed to inactivity. I think it's very telling when 1 in 3 children are overweight in this country, or obese. I think it's very telling when it costs $7 billion a year in health costs due to overweight inactivity. That's something we can do something about. And under the leadership of the member from West Vancouver, Sunshine Coast Sea to Sky, we've been caught up with this awareness about physical activity. And in my riding, I know I've talked to many of my municipal leaders about, doing something special on that day. Like that day having maybe a free entry into the pool, maybe having a special thing for seniors to get them out, a bike-a-thon, maybe there's anything that we could do on that National Health Day, and each of the municipalities have the ability to do that. I think that when we know that only 13% of Canadians participate in sports, I think that says an awful lot about our need to become very aware of the health benefits from activity. And when we know that only 6% of Canadians choose to spend their leisure time in sports, and that would have been me before, but it's not anymore. When I have some leisure time, now I look to either going for a swim or a bike ride, some activity, because through all of this process, it wasn't only overcoming the fear of the water, it was, which was tremendous. It was also the lifestyle enjoyment, the activity, the physical activity. And, after you exercise or get out, it clears your head. It clears your mind in such a way that you feel better mentally and physically. So having said that, I have to congratulate once again the member from West Vancouver, Sunshine Coast Sea to Sky, because I have to say, without his tremendous leadership on this, and look for him on the hill, you'll recognize him, because he always has a bicycle attached to his lapel. And I think it's marvelous, because he gave me one of those little bicycles, and I wear it quite frequently now, and I'm proud to say, and I couldn't say this before, that I'm a bit of a sports jock now. So there you go. Thank you very much, Mr. Speaker, for this time.
Reprise de débat. La députée.
The honourable member for Chambly-Bordua. Thank you very much, Mr. Speaker. It's my pleasure as sports critic for the NDP to speak to this bill. I was going to say my colleague's bill. Of course, it's a Senate bill to promote health and fitness, for a national day to promote health and fitness, I should say.
I'll try and get this mouthful out in one piece. From West Vancouver, Sunshine Coast Sea to Sky Country has done phenomenal work on this issue. It's been a pleasure as the sports critic for the NDP to work with him on this issue, on really trying to find a solution for the inactivity that seems to plague our youth. It was funny that I looked at we had meetings. It's actually Sport Matters' lobby day on the Hill today, which is appropriate timing as far as I'm concerned, and one of their representatives used the word inertia, speaking about the need to move forward, and I thought the choice of words was appropriate because it's what we're trying to solve here today. Mais, Monsieur le Président,
But, Mr. Speaker, when you look at this issue, one can really be worried. Various governments in the past 40 years have tried hard, I would say, to find solutions to the question of inactivity. I even saw a report from the World Health Organization that demonstrated that calorie consumption has not increased as significantly as one might think, but obesity rates have increased significantly. So one has to think about the factors at play here. Though it's important, simply blaming cell phones and video games is not enough. Yes, that's a factor, but it's an oversimplification that prevents us from putting in place public policies that would seek to solve the problem. But let's talk about the bill before us today, Mr. Speaker. I think it brings forth an important issue. My colleague opposite who's sponsoring the bill has often said that it's important for parliamentarians to be a good example. The member for Etobicoke North, my colleague for Sackville in Eastern Shore, have always promoted physical activity for members of parliament. So we have to live in order to do our jobs and not be hypocrites and just talk about it. It's not just us. I think it's important to encourage people in our communities, because when I work on the sports issue, I look at amateur sport, elite sports, Olympics, international sporting events in which Canada takes part, be it figure skating last year in London, Ontario, or the Pan Am Games in Toronto in 2015. We know that the elite sports system is well developed, but we have to look at the local level, and this is what we appreciate in this bill from Senator Nancy Green and my colleague. We like this bill because it really focuses on municipalities. We firmly believe in the NDP, and this is why we support the bill. We firmly believe that we have to work more with the provinces and municipalities to make sure that they also have the tools necessary not only to encourage elite sport, but also the man and woman in the street. Make them want to participate and use sports facilities that they may have. It's no secret, Mr. Speaker, there's a problem with access sometimes. I come from a community in Greater Montreal, on the South Shore of Montreal, in Chambly-Bordua. I look at the municipality of Chambly. People are very lucky. It's a well-managed city. We have 3 hockey arenas, so there are a lot of sports facilities for the people there. But that's not the case everywhere, unfortunately. What I hope is that this sort of national day that encourages the use of these municipal facilities will also shed light on the fact that we need to work together, all parties, all stakeholders, to create a situation that is likely to raise consciousness about the need for infrastructure and lead to investment. What we mustn't forget, Mr. Speaker, is that it's all very nice to encourage the young and not so young to participate in sports and have an active lifestyle, but if the tools aren't there for them to be able to practice that lifestyle, well, we're back to square one, and I think that's an important consideration that must be pointed out.
Whether it's in committee, when we study amateur coaching, when we study preparations for the Olympic Games and our athletes that we are so proud of, the different elements keep coming back, and there's still debate going on about what the solutions are. As I said at the beginning of my speech, I don't think we've yet found the solution, and governments have been looking for a few decades now at what the solutions can be. And what I appreciate in this bill and the fact of putting forward a day where we encourage folks to think about their health, to go out and participate in sports and use the installations that are available in the municipalities, I think it allows us a chance to continue the debate. I think every time this House votes on a bill to put forward a national day representing issue X, whether it's dealing with awareness for an illness, or in this case, whether it's dealing with something more positive about promoting an active lifestyle, I think that, yes, the day is important, but we as New Democrats are supporting the bill because it also allows us to continue a discussion that my colleague has been at the forefront of having with different stakeholders who've been involved in promoting this particular issue. And I think the government has tried to put forward different measures to try and solve this issue. We can think of the Children's Fitness Tax Credit and other measures such as that one. Unfortunately, with varying degrees of success, they haven't always been the solution that's been required, but I think that's why having this debate is so important. One of the things, Mr. Speaker, that I think is important to mention, since we're talking about, I've mentioned going to the local level and not just looking at elite sports, is I think one thing that comes back often when we study sports issues in committee in particular, but even when we meet with stakeholders, is I think more and more we need to think of it as a pyramid, sports as a pyramid. Yes, you need to look at that top, that small piece at the top, which is our elite athletes, who we are very proud of, as I mentioned, Mr. Speaker, and we want to continue promoting them and allowing them to succeed. Because contrary to what it may seem like, it's not always a glamorous life. These folks work very hard, but are great role models for the folks at the bottom of that pyramid, the folks that a bill like this is helping out and pushing forward in and having an active lifestyle. You really need to not forget the community level. Monsieur le Président, je pense que c'est vraiment là le défi.
So that's the real challenge that we're facing. Yes, we do have models with our Olympians. They are examples for our young people to follow. But it's really at the provincial and the municipal level that we have the pyramid that I referred to when I was speaking English. And that's...
And I think that's really important here, Mr. Speaker. C'est le fait d'avoir...
So, as I was saying, it's about having young people who won't just participate one day, who will continue to participate. And this is an excellent initiative. I'm proud to support it. And I'd like to say, Mr. Speaker, that I'd like to go back to one of the first speeches I made as a critic for young people, and for sport, rather, a couple of years ago. It was about active kids living, and it gave young people a D for their activity levels. Now, without necessarily focusing on the causes, because there are many, as I mentioned, it was something that was quite striking for many people. And what's interesting with an issue like this is, and it's reflected in the work that I did with the Minister of State for Sport, with whom I have a very good working relationship, is that this isn't a partisan issue. When we see the situation, we're all concerned. Because this is an issue of health. There are costs associated with the healthcare system as well. Yesterday at the Movember reception, Senator Green said, well, sometimes it's like the healthcare system is a system where we simply treat illnesses. We need to focus on prevention. And that's where sport can play a very positive role. And as legislators, we need to be behind that. And that's why we're supporting a bill like this, or this initiative in the name of my colleague, the member for West Vancouver, Sunshine Coast, Sea to Sky Country, because this is really a step in the right direction. It's a day that will make people aware of the importance. It's a day that will enable us to continue to focus on good public policy, and at the end of the day, to encourage our communities to be active and to have to see positive spin-offs associated with that. So I want to once again congratulate my colleague opposite. We're proud to support it, and we hope that we'll continue to work on these issues in the future. Thank you, Mr. Speaker.
Resuming debate. Reprise de débat. Accordingly, I invite the honourable member for West Vancouver, Sunshine Coast, Sea to Sky Country, for his right of reply. The honourable member has 5 minutes, or up to 5 minutes. The honourable member for West Vancouver, Sunshine Coast, Sea to Sky Country.
Mr. President, Mr. Speaker, it's really a great honor today to speak to S211, a bill that will be moving to a vote tomorrow, but also to mark, as my colleagues have marked, a historical moment. And Mr. Speaker, how would we know if we were at a historical moment? I would suggest that there would be a need, there would be a consensus around that need, and there would be a movement into action. We've heard my colleagues speak about the need, Mr. Speaker, the sedentary behavior in our culture today, the failing to meet our own physical activity guidelines, the obesity trends that suggest that a third of our youth are overweight or obese, a third who now face 14 times the likelihood of a cardiac event by the time that they reach 50. Mr. Speaker, the preventable diseases. We've heard about cardiovascular issues, about diabetes, and Mr. Speaker, not only are they preventable, but the costs associated with them are phenomenal and growing. $7 billion a year, says the Public Health Agency of Canada. Mr. Speaker, it is tragic when people hurt other people, but it is also tragic when people hurt themselves. And we are hurting ourselves with these trends of inactivity, with this trend of sedentary behavior, with the fact that less than 7% of our youth get the recommended 6 hours a week of healthy activity. So, Mr. Speaker, we are at a time for change. And if we were at a historical moment, there would be a consensus around that time for change. And we've seen in this place on Parliament Hill, MPs and senators from different parties coming together to say, yes, we can do better. We can do better, and we're doing so through the Parliamentary Fitness Initiative. It's been mentioned several times today, Mr. Speaker, how MPs and staff gather early on a Tuesday morning for a walk or a run, or to swim on a Thursday morning with remarkable volunteer coaches like Phil Marsh and Pierre Lafontaine. It's been mentioned, Mr. Speaker, about the unity in this House, about how people came together, 160 of them yesterday with Movember, which will be celebrating men's health in the months to come. We've seen the work with the Senate, and this bill originates in the Senate, Mr. Speaker. The Senatrice, Senator Nancy Green-Rain, Canada's female athlete of the 20th century, who did a great job of bringing this to this House from the other place. We've worked together, the two chambers of this legislature. And Mr. Speaker, today, Sport Matters is on Parliament Hill, trying to invigorate us parliamentarians to be role models throughout the country, not just in passing legislation, but in showing, as the member for Kildonan St. Paul said, that she, not an athlete in her own mind, can be a role model in improving her own health and fitness by extending herself in physical activity. Mr. Speaker, we've seen initiatives in the province I come from, British Columbia, Rotary Ride for Rescue, which raises money for people who are saved by North Shore Search and Rescue. We've seen Cops for Cancer all around the country, supported by West Van Police Department. The Terry Fox Run is another great example of getting people to run, not only in Canada, but all over the world. And Mr. Speaker, I'm proud to say the Terry Fox Run will resume in Taiwan next month. Mr. Speaker, there's Ride for Refuge, a ride that has been promoted by the member for Kildonan St. Paul. All of these activities are activities that bring people together in common cause and help people to understand it's time for us to get up and to move. Mr. Speaker, in my community, all 12 local governments have proclaimed National Health and Fitness Day, which is really the point of Bill S2 and 11. A bill that suggests that local governments ought to put an emphasis one day a year, the first Saturday in June, to get their citizens more active. Why one day? Not as a token, but as a way to get Canadians more active throughout the year. In the area I represent, Susie Gimsey of has worked with the Federation of Canadian Municipalities, which was quick to support National Health and Fitness Day this year. And we've had other groups like that. Vancouver Whitecaps former captain Jay Demerit and Whistler's Olympic gold medalist Ashley McIver. Mr. Speaker, we're at a historical moment because we're about to pass a bill. It's the beginning, not the end. It's the beginning of a nation coming together, working together, promoting healthy physical activity, Canadians getting more active and encouraging one another to get more active, deputies in this House approaching their mayors and councillors, and, Mr. Speaker, moving us, our country, and our people to become the fittest nation on earth. Thank you, Mr. Speaker.
And the question is as follows. Mr. Weston, West Vancouver, Sunshine Coast, Sea to Sky Country, seconded by Mr. Wallace, moved that Bill S211, an act to establish a national day to promote health and fitness for all Canadians, be now read a second time and referred to the Standing Committee on Canadian Heritage.
Is it the pleasure of the House to adopt the motion? All those in favor of the motion will please say yea. All those opposed to the motion will please say nay.
In my
In my view, the yeas have it.
Yeas have it. Pursuant to Standing Order 93, the division stands deferred until Wednesday, October 22nd, tomorrow, immediately before the time provided for private members' business. And now, pursuant to Standing Order 37, that's 30, subparagraph 7, subarticle 7, the House will now proceed to the consideration of Bill C-592 under private members' business. Orders of the day.
Second reading of Bill C-592, an act to amend the Criminal Code, cruelty to animals. The honourable member for Notre-Dame-de-Grâce-la-Chine is not present in the House to move the motion. As on the order paper today, as a result, the bill will be dropped to the bottom of the list of precedents. Accordingly, pursuant to Standing Order 38, a motion to adjourn the House is deemed to have been made and seconded at this time. Therefore, the question is that this House do now adjourn. The honourable member for Lac-Saint-Louis.
The Fisheries Act is the federal government's main and by far most powerful legislative instrument for protecting Canada's lakes, rivers and streams. In other words, the Fisheries Act is at the heart of federal water policy. Since first being elected, the Conservative government has waged an almost incessant crusade to progressively undermine the Fisheries Act. In other words, to effectively weaken the Act's prohibitions against harming fish, and by implication polluting Canada's water courses. First, the government used Schedule 2 of the Fisheries Act's mining effluent regulations to open the door wide to converting more and more northern freshwater lakes into dumping grounds for toxic mine tailings. The original intent of the regulations was to grandfather lakes that had already been destroyed by mine tailings in clear contravention of the Fisheries Act. In other words, the intent was to retroactively make these toxic lakes legal under the Act. Then in 2012, the government weakened Section 35 of the Fisheries Act, the Act's provisions for fish habitat protection, by restricting the section's application to recreational fisheries, commercial fisheries, and aboriginal fisheries only. In regard to Section 36 of the Act, the section that prohibits the deposit of deleterious substances into fish-bearing waters, absent an explicit regulatory exemption granted by the entire Cabinet, the budget gave greater power to the Minister of Fisheries to, by himself or herself, carve out exemptions to the Act. In other words, to accord permission to those who wish to be allowed to legally pollute waterways for purposes of research or in the process of conducting various industrial activities, including agricultural production. In the case of agriculture, the government's aim is to make it easier to allow pesticides to leach into waterways. In Budget 2014, the government followed up on the broad enabling provisions adopted in the 2012 budget by more precisely defining the regulatory framework within which the minister can create blanket exemptions to the water pollution prohibitions found in Section 36 of the Fisheries Act. It is the government's aim to carve out exemptions for the oil sands industry specifically, an industry that, despite persistent and I would say stubborn earlier denials by the government, has been found by scientists, including the government's own scientists, to be causing harm to the Athabasca River watershed.
Parliamentary Secretary to the Minister of Fisheries and Oceans.
Thank you, Mr. Speaker, and I appreciate the opportunity to provide a little clarity on the question that was asked. Let me begin by saying our government is committed to taking real action to ensure the protection of the environment and sustainability of our resources, and we take our responsibility for pollution prevention very seriously. The scope of the fisheries protection provisions of the Fisheries Act has not changed. It prohibits the deposit of deleterious substances unless authorized under regulations. These provisions represent a strong and effective legislative regime for environmental protection in Canada. In 1978, Environment Canada was assigned the responsibility for the administration and enforcement of the pollution protection provisions of the Fisheries Act. A designation order made March 12, 2014, made by the Governor and Council, has formalized this arrangement and provides clarity for Canadians regarding responsibility for Section 36 of the Fisheries Act by designating the Minister of the Environment as responsible. This order also identifies the Minister of Fisheries and Oceans as the responsible minister for those same provisions, but specifically for the purposes of aquaculture, aquatic invasive species, and aquatic pests. Our government has modernized and clarified the way these regulations are administered. For example, in some circumstances, such as dealing with an aquatic invasive species that could have a significant impact on Canadian fisheries, there is a new ability for ministerial regulations to authorize deposits for the control of these destructive species, such as Asian carp or zebra mussels. In putting forth these new ministerial regulations, our government has ensured the appropriate safeguards are in place. Conditions set out in GIC regulations ensure that ministerial regulations can only authorize deposits if they are for aquatic research purposes or deal with aquaculture, aquatic invasive species, or aquatic pests, and are for the purpose of proper management and control of the fisheries or the conservation and protection of fish, or pose a low risk. For this last condition to be met, there must already be a federal or provincial instrument that requires that the deposit meets science-based water quality guidelines. Canadians are engaged in this process, as all ministerial regulations made authorizing deposits must provide an opportunity for public comment through publication in Canada Gazette Part 1. Let me be clear, these ministerial regulations provide a new tool to effectively manage deposits, but they do not provide a blanket authorization. They do not offload responsibility for pollution control to the provinces. These regulations simply recognize that where deposits are for research purposes or are necessary for the conservation and protection of fish, or where an effective provincial or federal regulatory scheme already exists, that these deposits can be authorized by ministerial regulations under the Fisheries Act. This is a common sense change and provides stakeholders with certainty that they are in compliance with the Act without the need to create an additional or duplicative regime to manage the same activity. In fact, the Minister of the Environment has already made use of this new tool by developing the Experimental Lakes Area Research Activities Regulations, which allow for the continued use of substances and experiments in the experimental lakes areas. This regulation is an important component of the government's commitment to ensuring a new operator is well equipped to take over the experimental lakes area and to facilitate those ongoing experiments. So in closing, I'd like to reiterate that the federal government remains responsible for pollution prevention and, as I said previously, takes this role very seriously. The new tools our government has created allow us to maintain this current high level of environmental protection in a more efficient and clear manner. They also facilitate greater regulatory certainty for Canadians by allowing the government to use ministerial regulations when they are already well managed by other instruments or jurisdictions. Thank you, Mr. Speaker.
The Honourable Member for Lac-Saint-Louis.
Mr. Speaker, in 2011, wastewater from a Suncor oil sands project was accidentally released into the Athabasca River. We were surprised to learn that the test applied to determine if this was a violation of the Fisheries Act was whether more than 50% of affected fish died. I'm told this is a provincial standard, one that appears to be in contradiction with the traditional federal standard that says nothing should be allowed to enter water that could be harmful to even one fish. How can this more lax standard be allowed to exist under the enforcement provisions of the Fisheries Act? Is it because Fisheries Act enforcement has been devolved to the province, where the Provincial Environmental Protection and Enhancement Act applies weaker standards? Are the regulatory changes in Budget 2014 at least partially aimed at allowing the Minister to retroactively exempt this and other industries from more stringent federal anti-pollution prohibitions in favour of more lax provincial ones? If so, which other industries and provinces will be benefiting from the Minister's new power to single-handedly exempt pollution-generating activities from Fisheries Act prohibition?
The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. And as I've said previously, our government is committed to taking real action to ensure the protection of the environment and take our responsibility for pollution prevention very seriously. For any protection regime to be effective, stakeholders need certainty and clarity respecting what activities are within the law. The changes that our government has made to the Fisheries Act allow the Minister of Fisheries and Oceans and of the Environment to take the steps necessary to reduce red tape and increase compliance certainty among stakeholders, while at the same time protecting fish and fish habitat. As I noted, these changes only allow for ministerial regulations authorizing deposits of deleterious substances under very specific conditions. These conditions will ensure effective protection of Canadian fisheries by only granting the ability to use ministerial regulations to authorize deposits in areas that are already well managed. And our government will continue to ensure that the pollution prevention provisions of the Act are enforced. Thank you.
The honourable member for Thunder Bay, Superior North.
Thank you, Mr. Speaker. Tonight I want to talk about the state of this House. Let's face it, Canadian democracy is in deep trouble, especially since the current government came to power. It's not just the Conservatives, though, that are responsible for the mess we're in. The leaders of the Liberal and the NDP are more interested in crushing dissent within their parties than encouraging debate. MPs are often forced to vote against their conscience and against the will of their constituents. Anti-democratic attitudes abound in party back rooms. For the last year, we've been discussing the member for Wellington Halton Hills proposed Reform Act. I truly believe that with this Reform Act in its current form, we have an opportunity to transform Canadian democracy for the better. So you can imagine my disappointment, but not surprised, when the three main parties have waffled on their positions and criticized parts of this important bill. Canadians want change, Mr. Speaker. They want democracy restored. The groundswell of support from ordinary Canadians for this bill is significant, Mr. Speaker. Everyone I've spoken to has told me they are calling on their MPs to support this important legislation. This Reform Act makes some long overdue changes that will make Parliament work better for Canadians, again, instead of party leaders. It would make party leaders more accountable to their MPs by establishing a leadership review process. And it will end, Mr. Speaker, the requirement for a candidate's nomination papers to be signed by the party leader, the anti-democratic but little-known change to the Elections Act made by Pierre Trudeau in 1970. This reform will empower MPs to once again stand up for their constituents. It's the primary reason why I'm supporting this bill in its current form. I even introduced a similar motion back in 2012. The Reform Act is important because it scales back the excessive powers of party leaders and restores local control over party nominations. But recently, changes were proposed, I can only assume to placate party leaders, that will weaken the most important parts of this bill and hand endorsement power right back to party leaders. The Reform Act is only the beginning for democratic reform. Several other changes must be made to make Parliament more productive and less partisan. We must make our voting system more proportional to reflect the actual choices of Canadians. We must increase cross-party cooperation to end mindless partisan tribalism, and we must take away the Prime Minister's power to declare any bill a matter of confidence and stop him from bullying Parliament, imposing bloated omnibus budget bills, and ignoring his own fixed election date. It's time we prevented parties from forcing their MPs to vote with their party. The Green Party unanimously passed this summer a resolution to ensure that MPs would always be free to vote independently. We must also restrict the Prime Minister's unilateral power to appoint, without any oversight, senators, judges, parliamentary officers, and many other positions. The Reform Act, Mr. Speaker, in its current form is a step in the right direction. I urge my colleagues to recognize that it's time for all MPs who care about democracy to re-empower themselves and support the Reform Act in its current form without weakening it further. Will Conservative MPs, and indeed all the MPs in this House, have the courage to vote for the Reform Act in its current form? Thank you, Mr. Speaker.
The Honourable Parliamentary Secretary to the Minister of Fisheries and Oceans.
Thank you, Mr. Speaker, and I thank my colleague for his intervention. This may be a brief response, not because it's not an important issue, but because it is. Democratic reform is a very serious and difficult task, and I begin by commending the member from Wellington Halton Wellington Halton Hills for his important work in strengthening our democratic institutions and bringing forward the Reform Act. The Reform Act is an effort to strengthen Canada's democratic institutions by restoring the role of elected members of Parliament in the House of Commons. Now, the member opposite said in his original question that the leaders of the three major parties threatened to kill the bill if it is not watered down. But I would like to point out that, as with all private members' business, said we would take time to carefully review the amendments proposed by the member to his own bill. The Reform Act, you'll see 586, has now been read a second time and has been referred to committee where it currently is right now. Now, of course, the committee is the master of its own destiny, but the honourable member from Wellington Halton Hills proposed two changes in response to consultations held over the summer and to build support for his bill. The first is that he concluded that perhaps the way it was written with respect to party nominations was too prescriptive, that making it difficult for parties, for example, to meet diversity targets. In fact, the member opposite is from a party where there's exactly 50% male and 50% female here in the House of Commons, but other parties have not reached that target yet. And so the amendments that the member from Wellington Halton Hills has proposed is that instead of insisting that it only be a local decision in terms of who signs nomination papers, that the party could determine who it is, other than who it is that would sign these nomination papers. Now, that could be somebody locally, that could even be the leader, but it would not be prescribed to be the leader as is currently in the current Canada Elections Act. The second change that he is proposing is that each House of Commons caucus, after every general election, as its first item of business in a recorded manner, could vote on whether they wanted to kind of accept the template that's laid out in his bill or a different set of rules, and they would have that freedom to do so. But quite simply, the bill takes the current unwritten convention and makes explicit in statute the rules and process for caucus to review the party leader. Additionally, the Reform Act proposes that a party leadership review may be initiated by the submission of a written notice to the caucus chair signed by at least 20% of the caucus members, and mandates that the caucus chair make public the names of those caucus members requesting the vote. When a majority of caucus members vote in favor of a leadership review, a second vote by secret ballot occurs immediately to select a person to serve as the interim party leader until a new party leader has been elected. Mr. Speaker, our government has continually delivered on its democratic reform commitments. More backbench MPs have passed bills into law through this majority Conservative Parliament than under any government since 1972, and we still have a year to go. And I should add, Mr. Speaker, that the Globe and Mail analyzed 162,000 votes over almost 2 years and found that Conservative MPs are far more likely to vote independently from their party than opposition MPs, as opposed to the NDP, for example, which found that in those votes not a single MP voted against the party line. So as the member opposite knows, the Prime Minister and our government supported the bill, and as it comes back from committee, this House will have the privilege to examine the bill again at third reading. Thank you, Mr. Speaker.
The honourable member for Thunder Bay Superior North.
Thank you, Mr. Speaker. I'd like to commend the member opposite on his thoughtful comments tonight. Logical, clear. I don't agree with them, many of them, but it was a cut above the average that I hear sometimes in this House. But, Mr. Speaker, I really don't understand why some Liberal, NDP, and Conservative MPs are fearing supporting the Reform Act in its current form and want to weaken it further. As elected representatives of our constituents who have expressed a clear preference for the current bill, I would hope that all members will think long and hard before trying to water down a bill of this importance. The current version of the Reform Act will re-empower MPs and get them once again working for our constituents rather than for unelected backroom apparatchiks. It will allow MPs to put the needs of Canadians ahead of narrow party interests. While I'll support the bill in its current form as an important step forward, I'll have to think about it if it is significantly watered down as changes are made later. So, Mr. Speaker, I ask, will all MPs in this House support the current version of the Reform Act and restore democracy to the House of Commons? Thank you, Mr. Speaker.
Parliamentary Secretary.
Thank you, Mr. Speaker, and I thank my colleague for the additional comments. I think the member from Wellington, Halton Hills, has actually demonstrated for all of us, an effective approach to doing business in this place. After he produced his bill and it was in the public domain, he indicated that he welcomed suggestions to improve this bill to make it more palatable to a broader number of members and so on. And in fact, that's what he's done. And as with all private members' business, we said we would take time to carefully review the amendments that have been proposed by the member. These amendments would keep parties in control of their nominations and allow caucuses to set their own rules. And in light of these proposed changes, the government supported Bill C-586 at second reading and look forward to seeing it when it comes back from committee.
The motion to adjourn the House is now deemed to have been adopted. Accordingly, this House stands adjourned until tomorrow at 2 o'clock, pursuant to Standing Order 24-1.